Okay. Thank you very much. Appreciated. Welcome, honorable members, Madam Secretary General. Let me start by establishing the protocol so that which will guide us as we start our joint session ahead of the 58th Plenary Assembly. My name is Shaunen Kurasha. I'm Director of Parliamentary Business and Programs. And have the pleasure of welcoming honorable members to our joint session, which is running for the next 4 days when we have joint sittings, and then the last 2 days we will have statutory meetings of individual standing committees. Honorable members, you would have received programs. If any of the members haven't received programs, let us know. We will share in the groups, the standing committee groups via WhatsApp. Allow me to establish protocol by recognizing the acting president of the SADC Parliamentary Forum, Honorable Sylvia Elizabeth Lucas, Madam Secretary General, Excellence Boemo Sekoma, chairpersons of SADC standing committees, honorable members of the SADC Parliamentary Forum. I wish to also recognize the former Minister of Justice of the Republic of Namibia, Honorable Yvonne Dausab. I also wish to recognize representatives of different partner organizations that are in the meeting, namely Plan International, K International, YIVOS, Equality Now, UN agencies, specifically UNFPA, UNICEF and UNESCO, Girls Not Brides, SIOF, SAF-AIDS, Oxfam. I also wish to recognize representatives of civil society organizations, distinguished guests, ladies and gentlemen. As I indicated earlier, we have circulated copies of the program in your standing committees groups, and honorable members must be able to access the program. And when you look at the program, allow me to just run through the program, which is officially starting today, 25th of October, as I said, with the first joint session. 26th October, we have the 27th October, we have a joint session, which will start with the official opening session of this joint sitting of standing committees. This will continue on the 28th and the 29th of October. On the 30th and 31st, we have our statutory meetings of standing committees. And the theme for this plenary joint session, for this standing committee session, is on enhancing the role of parliamentarians in advocating for signing, ratification, accession, domestication, and implementation of SADC protocols. And we are honored that we're going to have colleagues from the SADC Secretariat who are going to make substantive presentations on the topic during the course of our session as per the program. Honorable members, without any further ado, I wish to usher us into the first track. We have characterized our different sessions as tracks. The first track will be chaired by the chairperson of the Human and Social Development and Special Programs, Honorable Mopekati. And I have the pleasure of handing over to the chairperson. But maybe before I do, I also wish to inform honorable members that should you have any logistics related issues, we have the pleasure of the presence of the Director, Finance and Corporate Affairs, Madam Ngandi, who is in the room, and her team. They will be happy to facilitate you. So reach out so that your stay is as comfortable and as enjoyable as possible. Asante sana. I hand over to Honorable Kati. Thank you.
Thank you very much, Kuresha, for this opportunity. Please allow me as well to honor the protocol that has already been set. Specifically, would like to pass my sincere greetings to the Secretary General of the SADC Parliamentary Forum, Madam Boemo Sekgoma, the distinguished members of the SADC Parliamentary Forum, the representatives from the SADC Secretariat, esteemed development partners, and our valued resource persons. It is my honor to welcome you all in this important meeting. Your presence here today reflects our shared commitment to advance SRHR as a cornerstone of public health and sustainable development in our region. SRHR is not merely a health issue, it is a matter of dignity, equity, and empowerment. Ensuring access to comprehensive SRHR services strengthens our communities, it promotes gender equality, and contributes directly to the achievement of our regional and global development goals. As we engage here today, let us reaffirm our collective responsibility to build resilient health systems and policy frameworks that protect and promote the rights and well-being of our women, our youth, and our vulnerable populations. Once again, welcome everyone, and I look forward to a productive and insightful session today. At this point in time, ladies and gentlemen, allow me to proceed to our first resource person to make some remarks. It is my honor to invite Ms. Rose Ektesadi, the Executive Director of SAFEITS, which is an organization that continues to play a pivotal role in advancing sexual and reproductive health, gender equality, and human rights across SADC region. Ms. Rose, we kindly invite you to share your short remarks with us. Thank you very much.
Good morning. Sawubona, molweni, dumela, habari gani, bon dia, bonjour, mulibwanje. Thank you, sir, and Your Excellency, Madam Secretary General Boemo Sekgoma, former ministers, representatives of the SADC Secretariat, partners from civil society, and of course, the most important audience here, yourselves as members, honorable and esteemed members of Parliament, all distinguished guests, and friends. Thank you so much to SADC Parliamentary Forum for the continued healthy, progressive collaboration that SAFEDS has been honored to have over almost a decade, and more recently, under the sterling leadership of Her Excellency, Madame SG. This has been consolidated in the past 5 years, and we have intersected with, I see familiar faces, many of you in this room today as well. Esteemed honorables, this year in 2025, you are probably more familiar than I. The value of governance and the imperative role that you play in our region has become more paramount. You're all aware of the cuts on aid, development aid that have affected our member states. You're all familiar with the onslaughts that have increased on human rights and dignity. And I believe you all appreciate that this has threatened the safety, security, and ultimately the democracy in our region that needs to be safeguarded if we are to attain the Sustainable Development Goals, the SDGs, but also the commitments that our member states have made to the African Union, SADC, and member state-specific targets and development parameters. Now more than before, we need to encourage one another and work collaboratively, yourselves in the governance space, but also us partners, shoulder to shoulder in your efforts, so that the commitments that member states have made to safeguard our region is given greater attention. In particular, domestic investment and financing, so that the loss that has hit many of our countries in the region with the withdrawal of funding from the global north, you are familiar, some of it is from the US, some of it is from other spaces of the global north, should not damage the good work that you have done and others in our region. Particularly around sexual and reproductive health, food, agriculture, food security, agriculture, education, and keeping the gender responsive, inclusive, and pro-rights-based lens at the center of all of this, so that the vulnerable in our community feel safe, hopeful, and really, having elected yourselves, they have entrusted you as constituencies to have this role. And position yourselves as lawmakers outside of bias, outside of moralization, and instead applying value-based decisions to bring the executive to account, using lived realities and scientific evidence. And I am confident that parliamentary structures in this region are very advanced in that, and all of you will continue to play that role. As we face the anti-rights increase and the claim that SRHR is Western, un-African, we need to remember, esteemed honorables, that this is a fallacy. We are so privileged in this continent that we have a set of phenomenal principles called Ubuntu. I believe we all are familiar with Ubuntu. And Ubuntu, for centuries, set by our forefathers and foremothers, has kept compassion, love, rights, equality, embracing all, irrespective of who they are, what their character is in our communities. And as governance instruments, as lawmakers, you have the power to remind others that in lawmaking, in making decisions for this generation and the other generations to come, Ubuntu needs to remain central. And the beauty of Ubuntu that no other continent has is that it washes away our prejudice, our individual bias, and it makes us remember that we're all one. And this is why our forefathers, before colonization, foremothers, made decisions that kept our communities safe and healthy. And I'm sure you are more familiar with that than I am. So when we have conversations around SRHR that many of you are familiar with, and those who are not will gradually, hopefully do, we do need to remember that it is an issue of dignity, equality, and it is not a public health issue alone. SRHR contentious issues, matters such as gender-based violence, safe abortion, access to contraceptives, these actually contribute to peace and security. How many of us are familiar with that? Most of us believe SRHR is just a public health issue. It's only for the health, but it's not. And there is scientific evidence, there is social science, there is lived realities that many of you may already be witnessing in your respective constituencies, that when sexual and reproductive health rights without bias and restriction are honored, there is greater citizenry productivity, macroeconomy, meso and microeconomy improves, national targets in human and social development is strengthened and achieved, and there is greater peace and security. This is evidence that we have to hold on to as we address the matter of SRHR. So, honorables, in wrapping up, my very humble sentiments to you and motivation, encouragement to you for today, I'd like to give you, at the request of my Excellency, Madame SG, a little bit of background to the matter that is going to be shared in today's session around the Safe Abortion Agenda. This journey began several years ago. Some of you in this room today were part of the journey, have been part of the journey, in engaging with members of parliament, with statutory structures within the parliamentary forum, and building on the Mahe Declaration. Maybe some of you were part of that in 2017 in Seychelles. And then around 2023 and moving on into this year, earlier this year, members of parliament who we engaged with, other partners engaged with via these statutory structures, recommended themselves that based on the evidence, the science, the lived realities that are illustrating morbidity, mortality, and fragmentation to society due to unsafe abortion, due to lack of access to contraceptives and prevention of early and unintended pregnancy, it was time for the region to take a step forward and be progressive more than it already is, and coin a SADC model law on safe abortion. So for us, as supporters, as allies, as civil society who are there to serve you as members of parliament, it was so refreshing to witness this progressive stance that came from members of parliament themselves. Honorables, we have an opportunity this year where the world has really, as I said at the start, has really started to fragment because of loss of aid, because of the wars that are taking place, because of strife and all other adversities. To continue as a SADC region to be progressive, to show ourselves as well as the West that as African lawmakers, are solution-based and progressive, and to remove the perception that it is only the Western law space that is progressive and that is unbiased. And I am very confident in the humble experience I have had with parliamentary structures around the region over the past almost 20 years to feel proud that the SADC region's governance architecture really is progressive. And I encourage you to be frank, unbiased, and keep our people in mind, as you always do, in the deliberations that will ensue. Thank you very much. Kialeboa, enkosi, nyabonga kakhulu.
Oh, thank you very much, Ms. Rose. Indeed, as you say, SRHR is not only a public health issue, it cuts across all aspects of sustainable development, and it must be treated as such. Honorable members, at this point in time, we are going to have our first presentation, and the presentation is going to be on SRHR scorecards, which is a vital mechanism for tracking progress, promoting accountability, and strengthening regional cooperation in advancing sexual and reproductive health rights. It is my honor to introduce Dr. Lamboli Kumboneki from the Directorate of Social and Human Development at SADC Secretariat. Dr. Kumboneki holds a bachelor's degree in medicine and PhD in public health, and he is currently pursuing an MBA. He brings over 15 years of experience working collaboratively with health departments, community and faith-based organizations, associations of people living with HIV, and multilateral and bilateral partners across Africa. His expertise lies in health system strengthening, policy formulation, and the design and evaluation of public health strategies at national, regional, and continental levels. Dr. Kumboneki is a culturally competent leader with a proven record of building strong partnerships and leading multidisciplinary teams to deliver impactful health and developmental outcomes. Ladies and gentlemen, please join me in welcoming Dr. Lamboli to speak to us on SRHR scorecards. Dr. Lamboli, you're welcome. Thank you.
Yes, it's fine. Yeah, it's fine now. Yeah, I think. Should be fine. Good. Good morning, honorables. Let me write on the protocol observed before. As mentioned, my name is Lamboli. I'm from the SADC Secretariat. So I'm going to give you a short presentation on the SRHR scorecards, which I'll try to make it more social, so we can correlate. But before we move there, let me just try to introduce a bit the SADC Secretariat, the work we do, and how we correlate also with the SADC PF, to give you just the context and a small background on that one. And as we are all aware, as the SADC Secretariat, as SADC as a community was established since 1980. And in 1992, that's where the SADC Treaty was amended. That way we had the SADC Secretariat being formed and established. It's established and also based in the Republic of Botswana. The vision and of the Secretariat is to be mainly a reputable and efficient, responsive enabler organization to facilitate regional integration. So that's one of, that's the vision, and the mission is mainly to provide strategic expertise and coordinate the harmonizations of policies, strategies across the region. So that's what, as a secretariat, we focus more in terms of facilitating, helping member states to work in terms of harmonizing policies which are going to foster regional integration in our region. We have a mandate as the secretariat, and these mandates start from strategic planning, management of program, implementations of decisions. You know, when our head of states or head and the ministers meet, they take some decisions to facilitate and also accelerate the regional integration agenda. So that's the role of the secretariat, monitor and then facilitate implementation of those decisions, which is passing also by through one of the whole key role of the secretariat is in terms of facilitating the convening of meetings among member states, also representing and promotion of the SADC organizations, and also facilitating that harmonizations and those policies that we talk about. The value, this all is anchored in some values, which are quality of services, professionalism, competencies that guides the work of your secretariat, as we call it. And I'll just also give you a bit of idea on how we work. We have the structure of the secretariat, mainly starting with the Office of the Executive Secretary, who is being supported and helped by two Deputy Executive Secretary. We have the Deputy Executive Secretary in charge of corporate affairs and the other one in charge of regional integration. All the programs, the different directorate which are in charge of developing policies and also monitoring the implementation of those policies are under what we call the Deputy Executive Secretary in charge of regional integration. That way falls the Directorate of Social and Human Development. And this is the directorate which works hand in hand with the Directorate of the Social and Human Development and Special Programs at the SADC Parliamentarian Forum. As you know, us as the Social and Human Development, we work mainly in facilitating policy development, harmonization, strategies, and also facilitating the implementation. That's how we work with member states, supporting them. At the Human Development, we work hand in hand with the health sectors. We have mainly the Ministry of Health, which are our counterparts at country levels. We interact with them regarding different programs. When it comes to the SRHR, it's mainly the program in charge of sexual and reproductive health at countries level. And we also interact with other ministries, which are the Ministry of Education, because education is part of this directorate. We also have the Ministry of Labor and Employment, or the Ministry of Youth, which are working with us. And we also work hand in hand with the SADC PF to facilitate these harmonizations and implementation of the policies. The SADC PF comes in terms of augmenting and facilitating our visibility and also augmenting our efficiencies when it comes to implementing those different policies. So this is how we work as the SADC Secretariat. So this will take me now to the core of the issues, why I'm standing in front of you in presenting you the SADC scorecards. The SADC SRHR scorecard, this is a tool which has been mainly developed to support or to facilitate, to monitor the implementation of what we call the SADC SRHR strategy. Before we move to the scorecard, I'll give you just a background on the strategy. In the strategy that we're implementing right now was developed in 2019 and approved during the ministers' meeting in the Republic of Tanzania. So the scorecard is mainly aligned to what we call the SADC SRHR strategy. The strategy is planned to be implemented between 2019 and 2030. Today, in 2025, we've been 6 years implementing the scorecard. And on a biannual basis, we monitor the progress that countries and member states are making towards the implementation of the scorecard. We have developed so far two scorecards, which is the first in 2021. In 2023, we had the second one. And this year, we also had the 2025 scorecard, which has not yet been approved by the ministers, but we're going to give you the privilege to look at the data as it stands for now, since we haven't finalized it. So it gives you also an idea on how member states are currently performing against the different objectives that we have set as a region to achieve the objective that we want in terms of sexual reproductive health and rights. So in the scorecards, we work hand in hand also with the different UN agencies. We have the WHO, we have the UNFPA, we have the UNAIDS and also UNICEF, which are partners who are working with us to collect indicators and information for the purpose of developing the scorecard. As you will see, the scorecard has got mainly 20 indicators, which has been summarized to give you an overview on how we are performing when it comes to sexual reproductive health. Those indicators have been selected in agreement with the member states, mainly the program of sexual reproductive health. And those indicators also are helping us to first reflect a multi-sectoral response, because in the indicator, we are not only talking about health indicators, but we are also looking at issue of accessibility to health services, issues of the legal and the political environment, which allows or facilitate accessibility to the different health services or SRHR services. But we are also looking at the alignment to the global continental strategy or commitment that we have made. And as you know, all our countries have made commitments, strong commitment toward the SDG goals in 2030. So these are the points that we are looking at, and this is how we monitor the scorecard. The scorecard is publicly available. We have a website which gives you access to the SADC SRHR scorecard. Like right now, you can access the 2021, the 2023, and also the draft of the 2025 scorecards, providing you different indicators. As you can see, the indicators has been developed. The scorecard has been developed using a dashboard approach, which green means that light green actually means that you have reached the milestone. Dark green means that we have reached the SDG 2030 targets. Yellow means that we are in progress. We are making progress toward reaching those targets, while red means that we haven't reached those targets. So for the purpose of your meeting, I've summarized and tried to provide you some indicators which are the most important throughout the scorecard, and also giving some explanation on them. We will start with few strategic indicators. For example, when we do the scorecard, one of the key indicators is the maternal mortality. The maternal mortality is being used because this is an indicator which also reflects or shows the developments that a country is making. When a country is able to take care of the most vulnerable, which are the pregnant women or the newborn, it means that your system is very responsive, is well strengthened and established. And this is a system also which is mostly developed, and because it can take care of the most vulnerable. So when it comes to maternal mortality, the objective, the SDG target here, is for each country to reach a target of at least maximum of 70 deaths per 100,000 delivery, as compared to, so initially all countries in the region have had more than that target. We had few countries, right now we have few countries which have reached that target, and we have also countries which are far much above this target. When you look at the current status when it comes to the population maternal mortality, you'll notice that we have two countries mainly which have reached it, which is Mauritius and Seychelles, while the countries such as Malawi, Mozambique, South Africa, the United Republic of Tanzania, and Zimbabwe have reached the what we call the SDG milestones. In achieving the SDGs, we have set up certain milestones, which shows the progress that the country is making toward achieving the SDGs. For example, when you look at the maternal mortality targets, each and every country in 2016, when the SDGs were developed, were at a certain stage or a certain, I'll give an example, a country like the Democratic Republic of Congo was having by 2016 had a maternal mortality estimated at 850 deaths per 100,000. So by 2025, we expect that the DRC would have reduced that target, that rate by at least 50%. So the DRC would have had by now a maximum of 450 if we take averagely the half of reduction by 50%. So if the country did not reduce by 50% between 2016 and 2025, we conclude that they did not reach the 2025 targets, because this was the agreed target. By 2025, each and every country would have reduced the maternal mortality by 50%. So that's what is reflecting on this table that you see now. So it means that we have countries such as Malawi, Mozambique, South Africa, URT, and Zimbabwe, which have reached the target for the 2025. While Angola has made significant effort but did not reach it because it's less than 50% reduction. It's estimated around 41%. And you have countries which have not reached that target, which are Comoros, DRC, Swatini, Lesotho, and Madagascar. So this is how we perform versus the SDG when it comes to maternal mortality targets. The second indicators which the scorecards also reflect is the neonatal mortality, which is death which occurs within the first 28 days of life. So when we have a newborn, we count those who are dying before 28 days of life. That's what we call neonatal mortality. And when we have achieved, we also had countries which have achieved the SDG targets, which counts for Mauritius, Seychelles, and South Africa, while Angola and Zambia have met the 2025 target of reducing the same rate by at least 50%. We have countries such as DRC, Lesotho, Malawi, and Madagascar, which have made significant progress in regard to this indicator, while some other countries are still below the expected targets, as you can see. The third target comes in terms of the adolescent birth rate. This is also one of the key indicators that we are trying to monitor, which gives us the reflection on how countries are doing when it comes to SRHR. In these circumstances, you will notice that 11 countries have met the SDG targets. Why are we having this figure? This shows the reflections of different policies, increasing accessibility to SRHR services, especially through the youth-friendly services, which has been taking place in different member states. Hence, you see we have a higher number of member states achieving that target. We have the milestone has been reached by the Republic of Madagascar, while few member states need to put more effort in terms of reaching this important milestone. So, and the next point also is when you have young girls between 10 to 19 falling pregnant, there's a high risk of maternal mortality because their body is still developing and they are very vulnerable and more likely to die in the process of giving birth. Hence, this or one of the indicator which is being monitored, because once you improve on reducing pregnancy, early and intended pregnancy among adolescent girls and young women, you are more likely also to impact on your maternal mortality. The next indicators that we'd like to share with you is the percentage of obstetric and gynecological admission due to abortion. 20% of maternal mortality in this region are due to abortion. It simply means that depending on the countries, but based on the laws and also on the regulation, one of the key issues that we are having is unsafe abortion, where the young girls and the young women are trying to seek care from unqualified or unskilled professionals. That's an epidemic which is also affecting the maternal mortality rates that we're experiencing in this region. And you will see that when you look at it, member states, there are 7 member states which have met the SDG targets, while we have 7 member states where we do not have data. So these are very important data, which shows also the effort that we are making in ensuring that we are reaching the SDG targets and the effort that we also are making in terms of ensuring that we prevent maternal mortality. The percentage of maternal mortality due to abortion, as I said, abortion represents on average 20%, ranges between 0.1 to 23%. In our member states. The table in front of you shows how member states have been performing in regard to that indicators, abortion leading to maternal mortality. So it's an indicators where we need also to work as countries, as region, to address the challenges. Some of the challenges or the key challenges when it comes to abortion is mainly about the legal and the political framework which is supporting accessibility or facilitating accessibility to such services across the region. This is also one of the key points where we believe that there's a lot of work to be done at political level and at legal level to ensure that our women are accessing those services. During the speech that we just heard now by Madame Rousset, she mentioned the percentage of women who are having unmet needs when it comes to accessibility to family planning or contraceptive. This is also, when you look at it, we have 1 member state which has reached the target, which is Zimbabwe, and we have 5 member states which have also met the 2025 milestone, while other member states are still yet to perform, to make efforts and ensure that we reach and we provide contraceptive family planning services to our women so they have the choice to decide when they can get pregnant or not. And when we also talk about maternal SRHR, one of the key indicators that we are trying to monitor is the comprehensive sexuality education, life skill-based knowledge that will impact. Different study in the region has shown that our level, when it comes, for example, to HIV prevention level for the youth, between 10 to 25, it stands at it stands between 36 to 40% in most countries. There are only 2 countries which are able to reach to the threshold of 50%, which tells us that when it comes to knowledge how to prevent first HIV, how to prevent pregnancy, our youth are not well informed. So this is one indicator that also we follow and we see how it's being impacted to our youth within the education system. When it comes to education system, we have seen that 12 countries have reached 100% in terms of coverage for comprehensive sexuality education. This is what the indicator says, but we have a challenge on this one because this is not a mandatory subject, is not a subject which is being assessed at the end of the year. Hence, they could be covered, but at the end of the year, when you do the assessment, you'll notice that students or youth have not yet reached the level that you would like them to reach. Hence, we stand on an average of 40% as a region. We have 12 countries which have missed the SDG target. Countries, which is the United Republic of Tanzania, which has met the milestone for 2025. 1 country which are sustaining, like Botswana, is standing at 94% for this indicator mainly, and 2 other countries where we did not, DRC mainly, where we did not get the data. So the next indicators on the SRHR scorecard, it speaks mainly to HIV, and HIV would like just to expand a bit also to give you the picture on the HIV epidemic in the region. As you know, we are the most affected region when it comes to HIV. 17 million of SADC citizens are currently living with HIV, of which we have approximately 14.5 million on treatment. The aim has always been to reduce infection, because as long as we are not reducing infection, it's a challenge. Between 2010, the SDG target has been to reduce HIV infection by 90% between 2010 to 2030. By now, most countries in 2025 were expected to have reduced by 90%. But as a region, in 2010, we are standing at approximately 900,000 new infections. And when you look at the data recently from 2024, which has been the latest data, we are standing right now at 441,000, which is an increase compared to what we have recorded in 2023, which was standing at 393,000 new infections, 391,000 new infections. It means that HIV, we have made progress, but we have not reached the target that we have set for ourselves. We also made a lot of progress when it comes to health-related death, with a reduction of almost 65% compared to 2010, which is set as the baseline for the region. When it comes to protecting the most vulnerable or to eliminate mother-to-child transmission, the coverage of mother-to-child transmission of PMTCT prevention of HIV in pregnant women has been increased. Almost 9 countries are sitting above 90%, which is a good progress compared to 2010, and few countries which were standing at less than 20% in 2010 today are standing around 70 to 80%. We still have a lot of work to do, but it's a commendable progress which has been made by the region. When it comes to averted, which means infections which have been avoided in the region due to the coverage, we are standing at 147,000 new infection which has been avoided or prevented in that category, meaning mother-to-child transmission has been 147,000 babies have been saved or have been prevented from getting HIV infected from the mother due to the coverage and due to the treatment that we are offering to pregnant women. We also look at HIV among children. Children, while most of our countries, we've got 7 countries actually, I would like to, 7 countries in the region today, which have reached the 95 target, which is 95 of people living with HIV knowing the HIV test status. From those 95%, at least 95% should be on treatment. And from those who are on treatment, at least 95% having a suppressed viral load. So we have 7 countries, which are the Republic of Botswana, the Kingdom of Eswatini, Lesotho, the Kingdom of Lesotho. We have Malawi, we have Namibia, Zambia, and Zimbabwe, which have reached the 95 among the 7 countries. So, but we are still remaining with one challenge, is pediatrics HIV. The kids are also between 0 to 14 are still less covered than the adults. In most countries, you find out the maximum coverage stands at 75% or 80%, while for adults, we are standing at 95%. So these are the few challenges that we have. And when you look at the new infections compared to age, these vary. In most cases, you'll find that 40% of new infections of HIV occur between the age of 15 to 24%. But there are few countries where HIV is mainly in the adult groups, which above 25%, as you could see in countries such as Madagascar, Mauritius, Namibia, and Eswatini. These where now the HIV is mainly affecting those who are the adult populations. And HIV continues also to affect women, more women than men, as we have always said it from the beginning of the epidemic. So besides and after HIV, we are also looking at in the scorecard few other indicators which speaks to what we call the legal indicator, the minimum legal age for consent to marriage for all. We have 13 countries have the legal age of consent to marriage at 18. While we have 3 countries where the legal age of consent to marriage is standing at 21. The legal status of abortion, we have 1 country has the legal status of abortion as illegal, which is the Republic of South Africa. 1 country, 14 countries have the legal status for abortion as legal, but with some restrictions, which means abortion is only allowed within certain conditions which are related to, in most cases, medical decisions or a decision by a judge. But otherwise, people do not have access to those services. We have existence, the other indicator, we are looking at the existence of laws and policy that allow adolescents, girls, and young women to access SRHR services without a third-party authorization. These are countries where when the young girl or a young woman goes to the facility, she's requested to come with the parents or an adult to access those services. So in that, we have 9 countries which have laws and policies that allow adolescents and to access SRHR services without a third-party organization, a third-party authorization, sorry. The next indicator that we are looking at is the allocation of the budgets, the health budget, the national budget to the health sector. We all know about what we call the Abuja Declaration. And the Abuja Declaration has stated this was a commitment made by countries and member states at continental level of allocating 15% of the national budget to the health sector. So in the Abuja declaration, when we compare the targets of the performance of our region versus the Abuja declaration, only one country is currently sitting at 15%. That's the Republic of South Africa. But in that case also, you'll notice that in most countries which have reached that target have not sustained that target. That has been the case. For example, you had the Republic of Namibia, which reached the 15% in 2018 and 2019. You had the Republic of Madagascar, which was at 15% between 2022 and 2023. So it's not sustainable. Countries in more cases are not sustaining that target. But also when you look at compared to other target, which is the expenditure per capita, which is assessed by the World Bank, we have 5 countries, I think, if I'm not mistaken, which have reached that target. That will be Seychelles, Mauritius, Botswana, South Africa, Namibia, and Lesotho, if I'm not mistaken, which have reached that target. But it's just to say that we need more effort in terms of mobilizing domestic resources when it comes to support health financing. That also has been mentioned in the previous speech here, and especially in the face of the current funding landscape globally and the assistance that most countries have been receiving, where as far as HIV and other diseases are concerned, including SRHR. So what are the key observations that we can make from the 2025 scorecards? First, there's a very slow progress when it comes to reduction of maternal mortality. We have 2 countries which have reached the SDG target, but most countries haven't met this target. We still need more effort in terms of investing in SRHR, in terms of investing in maternal mortality, through commodity, through capacitating our healthcare workers, and also improving the health system. Unmet needs for family planning remains high. Around 44% of member states are not on track compared to the SDG targets, which means also accessibility, or we need to increase accessibility to family planning choice within the region. There's mixed results when it comes to mother-to-child transmission. However, we have noted also we have 2 countries which are on the path to eliminate mother-to-child transmission. These are the Republic of Botswana and the Republic of Namibia, and the rising incidence of STI. The rising incidence of sexually transmitted infection is mainly due to the fact that we also have a reduction in terms of the use of condom, especially among the youth. So these are the key observations. Other observation has been the rise in GBV, as you are all aware, or intimate partner violence, and the investment in health has been mentioned, and the issues of data collections when it comes to health programs. So with this, I'll thank you for your attention. Merci beaucoup, and obrigado. Will be standing here, maybe waiting for your questions and comments or clarification. Thank you.
Thank you very much, Dr. Lamboli, for such a data-packed presentation indeed. And I think I picked something quite important that you said, that the scorecard does not only track health indicators, but it also looks into other factors that affect accessibility of health services, such as political and environment that you spoke about, the legal frameworks that exist. So this, I think, speaks very strongly to us as the right audience, as members of parliament, to really look into how then do we help our countries to catch up as far as the progress is concerned. The data you presented here, I look at it as an opportunity for us as the Model Law Oversight Committee, the SADC Parliamentary Forum Model Law Oversight Committee. This is an opportunity in our efforts of, monitoring progress within our member states, We should pick interest in this during our benchmarking activities to say which countries are doing well in certain aspects, which countries are lagging behind, what are some of the strategies that can be recommended for countries that are still left behind as far as achieving these targets that are very crucial for SRHR. And perhaps the other thing to really consider is the report that is going to be produced during these sessions that will go to the plenary. It should have, or should capture this country data to say which countries have actually reached targets, which countries are left behind, and what are the strategies that should be implemented for countries that are still lagging behind to achieve these issues. Honorable members, I'm going to open up some sort of question and answer session. Given the wealth of this presentation, I'm very sure where you're seated, you have something to say, you have something to ask. So before Dr. Lamboli leaves us, I would like to give you an opportunity to interact with him, either through questions, seeking clarification on issues that he has presented, so that we don't stay behind, itching our brains and saying, I wish I should have asked this. So I'm going to offer this opportunity, honorable members, to interact with Dr. Lamboli. And we'll be looking at the hands of interest. Kindly raise the paper so that we're able to see who is there. I see Botswana, I see Kingdom of Eswatini, I see Angola, I see Zimbabwe, I see South Africa, and by our acting president of SADC Parliamentary Forum. That's right, Madam SG, right? Thank you so much. So let us go in that, or I will defy the order. I will give it to our acting president first. Then I will take Zimbabwe, Kingdom of Eswatini, Botswana, and Angola. Thank you very much. Oh, we also have, that's DRC, thank you. We'll have DRC as well. Thank you very much.
Well, thank you very much, Program Director, and good morning to Doctor and the resource persons that is present here. Yeah, let me welcome the presentation as being done by Dr. Lamboli. It is in actual fact a very, very informative presentation. I think the members will agree on that score. But I was also concerned to notice that there is in some instances countries that have actually reported no data, which means we don't have a complete picture of the progress that we have made in terms of the SADC countries in the achieving the SDGs, and also in making sure that we do actually have a concerted effort to actually respond to the issues as being put under our like SRHR, we will put it like that. So I would really want to know, the doctor, from your side, what is the level of coordination and what is the template of reporting, and if countries are reporting actually just like on ticking the boxes, but also do we really have the kind of results that we would love to see taking place in terms of that specific areas. I think there is a concern, particularly with regards to the issue of abortion, and particularly teenage pregnancies and the issue of abortion. So it is actually giving us an opportunity as a subcontinent to make sure that we develop some kind of policies as to how to address specifically the issue of teenage and adolescent pregnancies. So I think it's a very informative presentation, and I want to express appreciation. Thank you very much.
Thank you very much, Madam President. Doctor, how many would you want to take it a go, respond, then get back to the rest? 3. Okay. So we're going to take 3 of you honorable members, and then we'll allow Dr. Lamboli to respond, and then we'll take another batch of questions. So we'll have Zimbabwe, and then cross to Kingdom of Eswatini, then come to the rest of members.
Thank you very much. Thank you, our presenter. I would like to get some more insight, especially on the issue of safe abortion. For example, you have mentioned South Africa, which has done it very, very well. And in other countries, even in Zimbabwe, yes, we have got some cases where this abortion is allowed, but not in every cases. And mainly in view of the fact that many countries have adopted that law on safe abortion. In Zimbabwe, obviously, it's after a serious investigation, which would end up sometimes that girl would go to 7 months with that pregnancy, and later on she's allowed to terminate it. So I would like to know how did South Africa managed it, and taking into consideration the issue of culture, how did people take it, so that maybe we can also have some laws which also allow without also having challenges, especially with those teenage pregnancies. I thank you.
Thank you very much, Honorable Vice Chair. You have captured that, Dr. Muli. We are going to then give an opportunity to Honorable Member from the Kingdom of Eswatini. That will be our last for this batch, and then we'll allow Doctor to respond.
Thank you very much for the opportunity to make an intervention, ventilate the presentation as made. Maybe, I don't know whether it's rightly directed to the presenter, but his opinion would be much appreciated. He beamed the organogram for SADC. I think it was in particular reference to the SRHR. What one would want to be sure, we are in SADC. There is always this question that comes up, and I'm not sure if I always present or misrepresent this organization. Are we part, or are we an organ or subsidiary of mainstream SADC? I was just tempted to ask that question, seeing that organogram there. Secondly, the achievements, the performances we are making, I think I'll follow previous speakers and ask, what is the methodology of checking how each and every one of us in SADC are performing? And what support is there to ensure that you are dragging feet, pull up your socks, if I may put it that way? Some monitoring and support mechanism at the end of the day. I think naturally we are driving to achieving the 2030 SGDs, and that is at the corner now. It's at the corner now. Any overview how we are doing, how close or far away are we as a region For instance, I will quote a 95 threshold. Some of us are there shown having done and are doing well. How about sustainability, given the new orders, if I may say, executive orders by what is the impact on our performances towards that, given the new development, let me say, by the SAA. It's not a secret that they were supporting us through PREFA. I thank you, Mr. President.
Thank you very much, Honorable Member. Doctor, I think these are the three questions, these interventions, I say, that you can come up and address. Then we'll give the rest of the honorable members an opportunity as well.
Okay, thank you, Chair, and thank you to honorables for these very good questions and clarifications requested. I'll first address the questions which regards the process of collecting the data. As I mentioned, this data is collected in collaboration with the Ministry of Health, mainly the program, the sexual reproductive and health programs. So countries on a yearly basis, there are different approach how they collect data. There are surveys which are made at country levels, which mainly informs you when it comes to the needs for contraceptives and when it comes to the issues of accessing the SRHR services. These are the data where we collect, how we collect the data through surveys which are conducted within countries. We also have data which are collected through a much broader investigation or survey, which we call the DHIS. Which countries usually they proceed to those survey on a biannually basis, and depending on the availability of funds and so forth. So they collect those data, and this also feeds. This is a survey which gives you the overall pictures of the health sectors. So it does not only look at the SRHR, but it also looks at issues such as HIV, which is done through other survey, but it also looks at other issues such as malaria, tuberculosis, so the whole health as a whole sector, and gives you those informations. So when it comes to the SRHR scorecards, we work with focal points in the Ministry of Health, which are collecting those informations. Once they collect, they respond to those questions or to those information because they have a template. We compile those data and provides now the overall picture in the region. Hence, you'll notice that in some instances, you may not have data because maybe the data, the last time the countries, for example, has conducted the survey has been more than 2 years back. So these are data that we do not consider. We'll need to have more recent data. Those are the challenges that we may face. But in terms of coordination, countries are responsive, and hence you see that in the past 6 years, we always have those data. We continuously produce or develop what we call the scorecards. The next question has been the second question was regarding the teenage pregnancy and teenage pregnancy actually. So when it comes to teenage pregnancy, I'm sure you've seen that in the past decade, we've been having a very high rate of teenage pregnancies. And hence it has gone down, but we are not yet where we want to be, because we are still having challenges in terms of restrictive laws or policies allowing the teenagers to access to those services. That will also lead me to speak to the issue of abortion. I think when it comes to the a law for abortion, for safe abortion, establishing law, we in countries, I'm sure what has been done in countries where abortion has been legalized, it's mainly looking at the benefits versus what are the challenges or the negative outcome that you may have throughout abortion. Remember, when I've spoken about the maternal mortality, we have mentioned that in most countries, 20% of maternal mortalities are due to abortion, unsafe abortion, because when we define maternal mortality is defined as a death which occurs within the course of your pregnancy and 42 days after your pregnancy. It means that we also take into consideration the issues of abortion to compute or to account for maternal mortalities. And during that time, we have at least 20% of abortion, of maternal mortality are due to unsafe abortion. And unsafe abortion meaning that we have our young girls and our young men seeking for care through unskilled professionals, because you cannot find those services through the legal channel or the normal channel of going to a facilities and seeking for those care. So these are investigation or data which needs to be collected by the countries, so that when we come to the decision makers or the lawmakers, you could see what are the benefits of allowing or legalizing abortion versus what are the pros and the cons when it comes to legalization of abortion for the country. What are we benefiting from that? We had another question which was speaking to mainly in terms of the organogram. I'm going to leave it to Madam the Executive Secretary. She's going to address the organogram and the issues in terms of between the SADC Secretariat and the Parliamentarian Forum. She will relate to it better than me. When it comes to the achievement in terms of, I think methodology have addressed it and how we perform and the support. Okay, in terms of the 95-95 and the support, first, the support, what we do as a region, we work with countries and looking at the different challenges countries are having in regard to the target, in regard to the SRHR scorecard. And those meetings or those interactions with countries, mainly in terms of capacity building, understanding the national context and what is needed in terms of interventions. And this is a work which is not done only by the Secretariat. Hence, you've seen that we developed the scorecards in collaboration with the WHO, which provide a lot of support when it comes to technical support. We do it with the UNFPA, with the UNAIDS and the UNICEF. So that's the support that we usually provide to countries and work with them jointly to address the challenges that we face. When it comes to the 95-95-95, indeed, we are yet to see the impact of this withdrawal. Remember, the withdrawal has happened in January this year, and the reports that we are presenting are the reports from last year, 2024. So we are yet to see that, but in general, we know that the cuts which has been made are mainly affecting when it comes to, we know, for example, that member states in this region, 21% to 8%, in some circumstances, 93% of the HIV funding was coming from the US, from through PEPFAR. So these are how member states have been affected. And and in most cases, you have the prevention program, which has been the mainly affected because treatment and care are still benefiting from that support. The prevention, that's where we are now having that shortfall, where we need now to step in a country and provide the necessary financial support to ensure that we continue prevention interventions. So we are yet to see the impact, but already when it comes to health workforce, we have cuts. There's a huge impact in terms of cutting the health workforce more than, in some instances, you have the estimation which has been done recently by the WHO for the whole SADC region has been almost to 200,000 healthcare workers which have been cut, or jobs which have been lost through these cuts because of the US funding cuts. But I'm sure as we move toward 2026, we'll have a clearer picture on the impact, especially when it comes to HIV new infections, when it comes to the maternal mortality, and when we'll be collecting information for next year. Thank you, Chair. I'll leave the question in terms of the The organogram and the organization will be left to Madam Boemo. Thank you.
Thank you very much, Dr. Lomboli, for that. Honorable members, just before we take another set of questions or concerns, I just want to point it out that it is important for our respective committees to be capturing this information, because, as we said, we are going to have a lot of this information informing our committee reports that are going to end up going into the plenary. So I would urge the committee of chairs to be very, very attentive to this information, the HSDSP committee, the GWAD, and all other committees, because we did mention that, the issue of SRHR is cross-cutting across various sectors. So we do know that it affects all of our committees. So it's important that we are mindful as we receive these presentations. I will move on to allow the other three members. I think that was the member from, we now also have another new hand from Lesotho, but we'll start with DRC, we'll move to Botswana, we'll move to Angola, and perhaps we can take Lesotho in the same bunch. Just have four of them present their questions or concerns. DRC, you do have the floor, please.
Ça marche pas? C'est bon? Vas-y.
Tag team, could you please guide us which channel is English, which one is Portuguese, which one is French?
Merci beaucoup. Docteur, je te félicite pour ton intervention là. Même si on n'est pas médecin, mais on a
One is English, I'm informed.
appris beaucoup de choses. J'avais une petite question à poser au docteur. Pour le cas de la République démocratique du Congo, je ne sais pas si vous avez mené vos recherches et que vous avez eu des données récentes. Parce qu'aujourd'hui, en République démocratique du Congo, il y a la gratuité des maternités. Le taux de mortalité a tellement baissé avec la gratuité de la maternité. Je crois que si vous pouvez encore mieux vous informer sur cette question-là. Mais il y a un problème. Cette année-ci, lors des examens d'État, on a vu beaucoup de filles qui étaient en sixième, enceintes. Et ça crée beaucoup de tollés dans les écoles. Je ne sais pas si nous pouvons voter une loi qui autorise l'avortement à ce niveau-là. Parce que des filles mineures, en pleine école, qui tombent enceintes, je crois qu'on peut encore autoriser l'avortement à ce niveau-là. Et la RDC, dans la partie Est, où les rebelles violent les petites filles qui transmettent des maladies, toutes sortes de maladies-là. Je crois que c'est un cas où vraiment il faut tenir compte de ça aussi. Merci.
Thank you, honorable member. Let's have honorable member from Botswana.
Thank you very much. Maternal mortality and I'm using the laws as legislators to try and reduce the number of deaths. My particular interest is around the issue, and like you said, 20% of the deaths are on account of unsafe abortions. We've got three categories of the countries. One where the laws allow, which is South Africa. And the other extreme is where it's totally not allowed, which is Madagascar. Would you say that the statistics from the two countries indicate a higher, I would assume Madagascar would have a higher percentage of deaths due to unsafe abortions? Is that the case? And then the majority of countries, we fall into the group, the middle ground, where there is abortion with restrictions. And my question would be, obviously, well, before the question, obviously we differ from one country to the other. And the desire would be to find out which system seems to work where you have legal abortions, but with restrictions. And I'm raising this up because there obviously will be a pushback when countries try to migrate from limited abortions to maybe say, I don't know, abortion on demand, where the laws are now not only limited to certain instances, but it's free for all. So which system seems to work such that countries may wish to influence a gradual migration to a system that delivers more safer abortions than is currently the case?
Thank you very much, Honorable Member. We'll then give a chance to Honorable Member from Angola, after which we'll take Lesotho and Doctor can respond.
Muito obrigado, Sr. Presidente. Bom dia, ilustres deputados e todo o protocolo observado. Cumprimento também os nossos preleitores. Eu gostaria, em primeiro lugar, de agradecer por me concederem a palavra. Felicitar também o Fórum Parlamentar da SADC por nos proporcionar este momento por via do secretariado da SADC para fazermos uma avaliação e monitoria do progresso que alcançamos nos nossos países. Eu estou preocupada porque a maior parte dos países não alcançaram ainda o orçamento preconizado na reunião de Abuja, que são 15%, e considerando que nós devemos optar por uma medicina preventiva e não curativa, e tendo em conta que os parlamentares têm estado a fazer advocacia no sentido de se aumentarem as verbas destinadas ao setor da saúde, eu gostaria de saber do nosso preleitor qual é o conselho que daria aos parlamentares, que estratégias sólidas e seguras devemos continuar a adotar para que, de facto, os países possam cumprir com a meta dos 15% que foi defendida em Abuja. Temos cada vez mais problemas no setor da saúde e precisamos, de facto, que esta meta seja alcançada. Sabemos que há esforços que estão a ser feitos nos vários países, mas sentimos cada vez mais a necessidade de alcançarmos essa meta. Gostaria da vossa experiência nos pudesse aconselhar de que forma os parlamentares poderiam contribuir neste sentido. Aproveito para felicitá-lo também pela sua brilhante explanação aqui, que serviu certamente para chamar a atenção dos parlamentares para um maior engajamento nesta monitoria e avaliação. Muito obrigado.
Thank you very much, Honorable Member from Angola. I'm realizing that we have another additional interest of intervention. So for that reason, I'm going to allow him to respond to the three. Oh, then it will make them 5 because we had Lesotho in addition. We have another member from Angola interested. Can I pick all 5 of them? Okay, so I'll take the member from Lesotho and then come back to the member from Angola.
Thank you very much, Honorable. And I would like to thank the presenter for the informative presentation. It also gives us clearance. It's clear as to how the individual countries are performing, and we are grateful for that. Here is my question. My question is, according to the graph you gave us, in 2023 and 2024, the HIV infection was increasing, and you anticipate that there will also be further increase. And this was long way before the funding cuts from America. What could be the possible cause? And The second question is, there comes the funding cuts. Do you see us as a region being plunged back into the HIV crisis? And I tend to think, honorable members, that once the HIV infection increases, this is going to have a negative impact on the targets we have made, or on the progress we have made up until now. So what would be your advice to countries? Thank you.
Thank you very much, honorable member. We'll have our last member from Angola.
Muito obrigado pela palavra. Primeiro, a par dos deputados que me antecederam, parabenizar o nosso preletor, que de facto trouxe dados que nos dão uma ideia clara do que foi feito, do que está sendo feito e do que vai ser feito. Isto evidencia o esforço que tem sido feito pelos governos, pelas organizações das Nações Unidas, e também coloca em frente de cada Estado-membro os desafios que ainda tem pela frente. Na sua preleção, o nosso preletor passou aqui um dado, segundo o qual, na região da SADC, 14,5 milhões de infectados, ou seja, portadores de HIV, estão em tratamento. Mas esse número é de pessoas esclarecidas, pessoas que aderiram ao tratamento, que aceitaram o aconselhamento. O que é que tem sido feito para persuadir os incrédulos, aqueles que não aceitam, aqueles que não aderem aos programas? Muitos até refugiam-se na bebida em vez de aceitarem o tratamento. Esta é a primeira questão. Também dizia o nosso preletor que a nossa região da SADC, e eu vou usar dois termos ao mesmo tempo, é a região mais afetada e infectada. O que é que coloca a nossa região? Quais são os motivos que colocam a nossa região no topo das infecções em África? Essas eram as minhas questões. Muito obrigado.
Thank you very much, honorable member. I think you have captured everything, Doctor. But before you come, I think I want to just put some few things to your attention. And perhaps some of these things you can be able to address them later when we get to the relevant sections within our presentations. During your presentation, I'm pretty sure some members here are just wondering, they didn't hear you say much about what are the roles of MPs in making sure that the information you have been sharing with us can actually translate to positive health outcomes. What are the specific roles that they can play as members of parliament and everything like that? But I'm quite aware that in our agenda, there is a place where we are going to be specifically speaking about the roles of parliamentarians and things like that. But I just wanted you to have in mind that they would have loved to know what role can they play to actually improve the performance of the scorecard. That was one thing that I wanted to put out there. The second one, perhaps that is important as well, is on the increasing new HIV infections. We do know that there is this tendency of, men who have a very poor health-seeking behavior, who don't seem to want to go to hospitals to do. And we know the HIV infections definitely will play a role in having those new HIV infections. What is it that we can do I also wanted maybe when other members were, intervening, I would have loved to hear any member who's puts before us here that perhaps since the funding cut, since the health funding cut, what have our parliaments done? Are there any parliaments that can say we have actually put forth a law for local resource mobilization for health specifically? So these are things that really, if you may have information on those to say, we have seen some positive trend in other countries that have done this to respond to the issues of health cards and things like that. So I just wanted you to have that in your closing remarks, and the rest maybe will be responded to when we get to the specific session on roles of parliamentarians. Thank you very much.
Thank you so much, Chair. I'm going to try to respond to the question asked by the honorable members of parliament. Let me get the first question from DRC. For this, I will speak in French for better understanding. Pour la question de la RDC, vous avez mentionné que les données, effectivement, les données qui ont été présentées sont celles du Programme national de la santé de la reproduction. Il faudra aussi noter qu'il y a eu réduction de la mortalité maternelle, comme je l'ai expliqué depuis le début. En 2016, la RDC, la mortalité maternelle était estimée à peu près 850 pour 100 000 naissances au niveau du pays. Aujourd'hui, lorsque vous regardez, par exemple, l'année passée, pour les données de 2023, la RDC avait atteint l'objectif cité pour l'objectif pour l'année 2023. Mais malheureusement, en 2024, cela n'a pas été fait. C'est pour cela qu'il y a eu cette augmentation-là. Et l'estimation est à peu près à 740 décès pour 100 000 naissances vivantes. Et concernant les filles enceintes lors des examens d'État, faudra-t-il autoriser l'avortement? Je pense que c'est une approche pluridimensionnelle qu'il faudra adopter. Lorsque nous avons présenté ici, nous avons dit qu'il y a d'autres facteurs qui sont importants. Celui, par exemple, de l'accessibilité à la planification familiale. Vous avez les contraceptifs, vous avez les différents outils de planification familiale qui existent, qu'il faudra aussi mettre à la disposition de ces jeunes filles et de toutes ces jeunes personnes. La deuxième chose dont il faudra aussi tenir compte, nous avons parlé de l'éducation sexuelle qui se passe dans les écoles. Nous avons vu des pays faire des progrès, mais les progrès ne sont pas encore reflétés au niveau des résultats, parce que nous savons par exemple que lorsque nous faisons l'évaluation de nos jeunes dans la région, le niveau de connaissance des jeunes en matière d'éducation sexuelle est en moyenne aux alentours de 40 à 50%. Le pays qui a le meilleur indicateur dans ce domaine-là est établi à peu près 52%. C'est pour dire que nous devrons encore adopter des politiques normalement au niveau du ministère de l'Éducation pour que ce soit des programmes qui sont soumis aussi à des assessments comme tout autre programme. Parce que les jeunes, c'est vrai qu'ils assistent à ces programmes, mais ils ne les prennent pas aussi au sérieux comme on prendrait des sujets tels que les sciences, les mathématiques et consorts. Donc, c'est une approche un peu multidimensionnelle qui est requise dans ce cas-là. I'll move to the second question, which was asked by the Republic of Botswana regarding maternal mortality and the existence of abortion law. You rightly asked, actually, that's a very good question, because when it comes to the abortion law, or when it comes to abortion, even maternal mortality, the approach should be multi-sectoral and multi-dimensional. It doesn't mean that if today we have an abortion law, it's automatically going to reduce the maternal mortality where we want it to be or achieving the SDG goal. When you look at countries such as South Africa, for example, before adopting the law, the abortion law, there's been a thorough investigations informing the lawmakers in terms of what are the impacts, what is happening within the country when it comes to abortion, like the number of abortion, the number of unsafe abortion, the number of maternal death related to unsafe abortion. All this informed the establishment of the law. And when you look at also the data, actually, there's been a substantial reduction when it comes to maternal mortality. That's the impact. When you go to countries such as, for example, Madagascar, you have mentioned Madagascar. Madagascar and DRC are the countries which have got the highest maternal mortality in the region. You wouldn't say that it's mainly due to the abortion, but you have to go to the data and look at what are the main causes of abortion within your country. When you look at a country like DRC, you'll notice that you have 11.5% of abortion are contributing to maternal mortality. But when we go to the region, that way we have the 20% average. For the case of Botswana, the latest assessment, if I'm not mistaken, was assessing it around 19% of abortion contributing to maternal mortality. So when it comes to each and every individual country, we need to go into data, into zooming or going into data to analyze what are the key factors which are leading to our maternal mortalities and what could be the impact of having adopting, for example, of legalizing abortion within the country. But data also have shown that once we legalize abortion, it opens up, like in terms of you are more likely to have not only, because when you talk about abortion, it's not only about the mortality, but it's also about morbidity on the impact of those women. Because once, in most cases, you find out once you have gone through illegal abortion, you are more likely also to have cases where there's been what we call hysterectomy. A woman has been removed her womb because it was no longer viable due to the method which has been used to perform this abortion. So there are so many cases like that which could account maybe for up to 5 to 10% of women today who are no longer able to give birth or to carry a pregnancy just because they've undergone a illegal abortion during the course of their life. So these are different multiple impacts, maternal mortality being one of them. You have also the morbidity, and also the impact on the woman's life throughout the course of her life or the remaining of her life. So those are the challenges that we are looking at. So when we do that, the best approach would be to have a thorough assessment, and with the sexual reproductive health program and providing data and also supporting the adoption of such a legalization of the abortion. And for Angola, the question was regarding the 15%. What could be the advice on the 15%? As I mentioned, when it comes to the health sectors for the budget, we have mainly, when you look at even the African scorecards, the African Union scorecard, we have 3 indicators that we are following. We have the Abuja Declaration, which gives you the 15%. We have what we call the expenditure per capita. This has been established by the World Bank. It's established at $86 at least per country, and then you have the percentage of the GDP, which the threshold is around 5% of the percentage of the GDP. So these are the 3 indicators which are being combined to assess how countries are performing. When it comes to the 15%, we have only 1 country, as I said. But if you look at the GDP and the expenditure per capita, approximately around 5 countries, which we have South Africa, you have Mauritius, you have Seychelles, Lesotho, Botswana, and Namibia, which are also reaching the GDP and the percentage. But now, what are the efforts that we could make in terms of increasing the health financing? Health financing, first, we are looking at the domestic resource mobilization. Domestic resource mobilization speaks to the budget allocation, the national budgets. How do you mobilize the budget and the percentage that we allocate to that? But we shouldn't, as parliamentarian, I believe the effort will be on the budget, but also on creating the legal and the political environment, which will allow other sectors to come in and also invest into the health sectors. We have the private sectors, which could also come in and invest into the health sectors, which can facilitate the government in terms of increasing the investment in the health sectors. We have seen, we have the trends today. Most countries are trying to establish what you call the national health insurance system. This is one of the steps in ensuring that we take control of our health, we take control of our expenditure. But when we have the national health insurance, we also look at in most cases, the best approach would have been to also looking at your social environment, what we call the social registers, because they should be speaking to each other. You should be able, when you establish your national health insurance, to know who needs that insurance as for the support from the government and who can afford the insurance on their own. For example, those who are working, the working class, and so forth. So those are the key issues that we are looking at. The other sector is also in terms of manufacturing. How do we give incentives to private sectors to come on board, invest in the health sectors through provision, not only provision of health services, but also manufacturing of health commodity. I'm sure you have noted that you've mentioned, you have heard a lot about local manufacturing, you've heard a lot about the procurement of drugs and health commodity. And recently, I'm sure also you heard the speech which was made by the President of the Republic of Botswana when he was addressing the issue of the commodity crisis in the country. He mentioned that sometimes the country could pay for those drugs 3-4 times the price which another country would have paid. Just a simple example. In the region, for example, we're buying ARVs. When it comes to ARV, South Africa buys ARV less than all other countries in the region, simply because of the numbers, which gives them the bargaining power in terms of negotiating. We have come up with what we call the pooled procurements, the SADC pooled procurements, which is one of the initiatives which has been established. The aim is to reduce exactly those kinds of inequity, of injustice, because when you buy a medication, it's not like when you buy your soap in the shop. Actually, the manufacturer has the bargaining power. In most cases, when they come to Lesotho, for example, Lesotho would order 300,000 doses. But if they come to a country such as DRC will ask them for 6 million doses. Then they will rather go and sell the drugs to DRC, because that allows them to make economic of scale and sell them. So these are issues where by now it's important to come as a region together, purchase those health commodities and reduce the cost. So this is, and the next point, the last point that we would like to come up is creating also the enabling environment, which will allow our own manufacturers, our own companies, local companies, to start producing at least the commodities that we need as a region. Because as long as we continue buying from elsewhere, we will be subjected to those injustices in terms of the bargaining power and the price, and it's going to affect our budgets. And we'll be spending more for health and getting less results. Thank you. That would be my contribution. I think the question from the Honorable Member of Parliament from Lesotho was speaking to the rise in HIV infection in 2024 and 2023, and also, yes, the impact in terms of the cuts, what can be done. So the first point, when it comes to the rise, indeed, there's been a slight rise in terms of new infection for 2024 compared to 2023 and 2022. Some of the issues that we have noted even when you go across the region, when it comes to HIV, there is a new generation which has not seen your HIV how you have seen it, how the older generation have seen it. So the perceptions of risk compared to HIV is very low. Hence, we need to change the approach when it comes to HIV prevention. We need to come up with new strategies and how do we sensitize these new groups when it comes to HIV. You would have seen that lately in the early 2000, the main approach was to use your billboard and so forth and so forth. Now, most of the HIV program are trying to use your new technology through your podcasts and so through the different means of technology to reach the young generation to ensure that they capture the message, and also they're able to apply what they're being told to. So this will require now to rethink on how we approach prevention if we want to continue reducing the HIV infections. When it comes to the cats, the impact on will it take us back to the HIV crisis? I'm sure you have heard the estimation from the UNAIDS that if we do not address these cats, we are more likely to experience 5 to 6 million HIV-related deaths between now and 2029, which means we are going back to another crisis if we do not do anything. But what are the challenge, the approach that can be used? There's been few countries have tried to address the cuts. I'm sure you also heard that the United Republic of Tanzania recently has adopted the establishment of the AIDS Trust Funds, following which has been what has been done in Zimbabwe in 2008, 2007, when the country was facing a very acute crisis in terms of funding the HIV response. So this has been one of the approach in terms of establishing HIV Trust Fund. But also in some countries, I'm sure also you have been following actually the different activities or news. For example, in South Africa, the Department of Health and the World Bank and other partners have been working on how do we close the gap for the cuts which has been noted. The approach which has been advised, or the advice which has been made through that exercise was, first, we need to acknowledge that the funding which was coming in some instances, for example, you'll have the PEPFAR providing 400 million to cover your prevention programs. But it doesn't mean that the country should be pitching $1 for $1, because we have a system. We do not need to go, as we say, we do not need to use a fancy approach to address to close those gaps. When you look at, in most cases, sometimes you only need 60% of what has been supported to your country to close the gap and having an efficient system to address the challenges. So these are also some of the strategy in terms of understanding really what has been the cut for and which program has been affected, and how do we close the gap with the minimum possible. We don't need to be closing $1 for $1 or replacing the $1 for $1, but we just need to be more efficient in the approach. I think this is what is being used by the Department of Health in South Africa to advise the Ministry of Finance on how much they would need to close the gap which has been created by the cuts which we are seeing at international level. The next question, which was asked by the Honorable Member of Parliament of Angola, regarding the number of the number of people who are affected by HIV. Indeed, it's true. We have out of the 17 million, we have 14.5 million approximately, or 82% of people who are on treatment. For those who are not on treatment, as I said, we have those who, because when it comes to HIV, we do estimation. Those are estimation that which are made in terms of figures. So the estimation shows 17 million. But the gap that we are looking at, there are some people who are not aware of the HIV status, which needs to be tested. Those who are aware of the HIV status but do not want to get into treatment. This is where you have your sensitizations, you have the HIV program still working through sensitizing those different category of patients to bring them on board on treatment. But you also have those who have been lost to follow up. Like, for example, there's been a treatment, they felt like they are now healthy and they've moved out of treatment. Those are people also that the effort are being made to bring them back. But this is going also to be affected by the cuts because it's not part of what is being currently funded by the program. Hence, we might also experience some challenge in that regard. The last one that I would like to talk to is the effort of the role of the MPs. why do we want, why are we exposing or presenting all those data to the members of parliament? First, we all know that what has brought the change in the HIV response, or what has helped this region to address efficiently and effectively the HIV epidemic, has been the change in the political will, which has been demonstrated at the highest level, but also the adoption of those laws and regulations which have allowed and facilitated accessibility to services. Hence, you see in the scorecard, we are talking about the legal status of different laws. We are talking about the legal status on how do we access to health services, because once the MPs are working towards creating that enabling environment, it's going to impact on our health indicators, allowing our young people, allowing our people in the region to access health services, but also benefit from what they should be benefiting, or what is the right approach in terms of health services. So this is one of the reasons. The second reason also, we all know that the MPs are the ears, they are the voice of the government at some point. And we believe that speaking to you and also being on the same page with you will help us in changing the government policy, the government approach when it comes to the health sectors or to the different health programs. Hence, we are sitting with you today and we're trying to give you as much as information that we can, which is going to allow us to improve access to services, but most importantly, impact and increase the efficiency of our health services and the life expectancy of the SADC citizen. Thank you.
Dr. Lamboli, as you're on the podium, I realized that South Africa wanted to have a last intervention.
Okay.
So to avoid a situation where I bring you back to the podium, I would like you to take it directly from there, and then we can be able to, yes.
Thank you, Program Director. Let me also appreciate the presentation. The question that I had was on the mobilization of domestic budget through the National Health Insurance. But to a larger degree, you did make an elaboration on that. So, but the question that I want to pose relates to, is there a case? Is there a case for SADC members to legislate on the national health insurance? Because the sense that I get is that if I'm correct, but if I'm not correct, you will correct me, that not many SADC members has adopted the national health insurance, and that globally it will be countries like Canada, Japan, South Korea, Australia, Germany, and France. And this is the reason why I'm raising this point is because dualism in the health sector is more pronounced between the rich and the poor, between the urban and the rural, and therefore a case of South Africa with that reality, given where we come from, national health insurance law was passed. But because of the contestation from the private sector, they are reviewing that law, which clearly I suspect is because of the greediness on the part of the med schemes, because they are they benefit from this dualism in the health sector. Thank you.
Dr. Lamboli, just realized again, perhaps after opening up a session for South Africa, there are also two other members. So perhaps you should be writing because I think, yeah, respond to South Africa. Then I'm going to pick DRC and Kingdom of Eswatini. And honorable members, I plead with you that those will be the last members that we close the session with. We have quite a couple of things to deal with. I will find a way to squeeze some of your concerns as we go forward with other sessions. Thank you.
Okay. No, thank you so much, South Africa, for the questions. I think this is a very important debate as we are trying to reach a level of equity and also to address those injustices that we've seen in the past. In the case of South Africa, I think what has led the government to adopt the NHI has mainly been the different assessments. I'm sure you are aware that in the past years, of the good health expenditure that you see in South Africa, 80% benefiting only to 20% of the population, while the rest of the population were only accounting for the 20%, which means that most of your health expenditure was mainly concentrated spending on the private insurance and so forth. When it comes to the continents, on the continent, we are still, most countries are at its inception level when it comes to NHI. You have few countries in the region. You have Zambia started with the NIMA, but the NIMA is only covering around 20% of the population now, because they've just recently started. They've been moving toward, because some of the challenges they have is to bring also the informal sector and so forth. When it comes to countries which have tried also to copy because when it comes to Africa, especially the sub-Saharan Africa, the countries which is being mainly cited is Rwanda in terms of the health insurance, in terms of the community health insurance. This is a system which have started differently from the South African one. In Rwanda, it's been adopted first at community level, covering only community and the services that you could be trying to access within the community. And after 4 or 5 years, they moved to the district level. Now they're about to go to the national level to cover. So this has been also one of the examples, but this depends also. It's an approach which I do not believe may work in a huge country like South Africa. South Africa may need to have a different approach. Hence, you've seen that the government have tried to move toward learning some lesson learning from South Korea, from countries like Canada, from the UK, from France, and so forth. In the national health insurance, the challenge that we have in most cases, like for example in Africa, I'll give an example of one country where there's been a thorough assessment, but I'm not going to name the country here, but it's not a SADC country. There's been a very thorough assessment for the national health insurance, to establish the national health insurance. And also the next point, when you do your national health insurance, you need, the most important point is to understand who needs the support, because you always have a proportion of your population which will need that social grant, social support from the governments. These are the most vulnerable people, which without the national health insurance could not afford to access quality healthcare services. And this, for you to get those this proportion of population, you need to also have a strong social register, meaning that you need to know who works, who doesn't work, or who can afford this quality of services, so has to be supported by the government through some grants or maybe coverage. Once you have established that social insurance, it becomes easy. And the next stage is now to look at those who are working. How do we create a political or enabling environment whereby once you have been registered by the Labor Department, your employer actually has the obligation to register you to the national health insurance and paying also for you, maybe half of it or covering the whole insurance. So only when you have established that type of social register, you have a strong link between the labor register, the social register, and the national health insurance, you may succeed to have this. This usually comes when you have a common identifiers in the country, where your ID is being linked to all those policies, and it facilitates accessibility to that. There's one country in Africa which has done that. In Tunisia, they do that. It's very easy so they've done that. So they've linked the ID and also the access to the accessibility to your national health insurance, to the to the labor register and also the social register are well linked. So hence it allows them to know who's supposed to be covered by the government, who is not supposed to be covered, and who is being supported by workers. So there are different approaches which are being used. If you go to Western countries also, you'll see that the different approaches where you have the British system, the French or the German system, which is trying to combine both the British and the French system. They bring them together, and hence they are a bit more efficient compared to others. Thank you. So that's why I can put it. Thank you.
Thank you very much, Dr. Lamboli. So as I mentioned, we have two additional members. Honorable member from DRC, have the floor, and then we'll have honorable member from Eswatini.
Merci beaucoup pour la parole. À l'instar des intervenants qui m'ont précédé, je voulais remercier et féliciter l'orateur pour la qualité de son exposé. J'ai deux petites préoccupations. La première est la suivante. Je voulais juste avoir une idée sur les mécanismes qui sont mis en place pour accompagner, au niveau de la SADC, pour accompagner les États ou les pays membres qui ne parviennent pas à atteindre les objectifs ou les cibles dans les domaines, par exemple, de la mortalité maternelle ou celle néonatale. C'est tenant compte de l'intégration régionale, je crois qu'il faille adopter une approche un peu plus globale, régionale, que de laisser chaque État de lutter ou de se battre pour pouvoir atteindre la cible et la cible ou les cibles ou les objectifs poursuivis. Parce que si on laisse chaque État évoluer de façon solitaire et après on vient constater que voilà, tel État a atteint la cible ou les objectifs assignés et tel autre ne l'a pas atteint, à ce moment-là, c'est un cercle vicieux. On rentre toujours à la case du départ. Est-ce qu'il ne faut pas une approche un peu plus globale, un peu plus communautaire? Alors, la deuxième préoccupation, c'est en rapport avec le gel de financement ou la coupe de ressources auxquelles les pays ou les États membres de la SADC font face, par exemple dans les domaines sanitaires. Alors, je voulais savoir quelles sont les dispositions qui sont prises au niveau, par exemple, de la SADC pour faire face à ces gels de financement. Parce que vous avez dit qu'il faut changer d'approche. Certes, oui, je suis d'accord avec vous, parce qu'il ne faudra pas remplacer les dollars par dollars, il ne faut plus changer d'approche. Mais ne pensez-vous pas qu'il faille une approche, comme je l'ai dit, pour le premier cas, un peu plus globale? Par exemple, au lieu de laisser à chaque État de créer, par exemple, les fonds fiduciaires pour lutter, par exemple, contre le VIH-Sida, mais avoir un fonds un peu plus, avec un caractère un peu plus régional, un fonds au niveau de la SADC, par exemple, qui aiderait toute la communauté, toute la région à pouvoir faire face à cette pandémie du sida, par exemple. Merci beaucoup.
Thank you very much, honorable member. Let's have our last honorable member from Eswatini and allow Dr. Lamboli to respond, and then we can close the session.
Thank you very much, Session Director. I wish to commend the presenter for the insightful presentation. I also would like to congratulate the member states that have reached the target on certain aspects of the scorecards. Mine is just a suggestion, Honorable Director. I would like to know if it's possible to forward the presentation to the honorable members of Parliament so that we can go and work on it in our various member states to improve the performance on scorecards. Thank you.
Thank you very much, honorable member, Dr. Lamboli. You have the floor, and then we you could consider also having your closing remarks once you finish responding to our members, and then we can close the session. Thank you.
Thank you. Thank you, Chair. For DRC, I'll respond in French as well. So, pour la première question concernant l'atteinte des objectifs assignés et le mécanisme d'accompagnement au niveau régional. Pour ça, en fait, ce qui se passe au niveau régional, généralement au niveau technique, nous avons des forums des différents managers ou des différents programmes nationaux qui viennent ensemble, qui discutent des questions, et aussi, c'est aussi un forum qui permet l'échange des expériences pour pouvoir améliorer nos performances nationales. Ça, c'est une première approche. La deuxième approche se fait à travers des interventions conjointes entre le secrétariat de la SADC et les différents organismes des Nations Unies. Lorsque vous voyez, la plupart d'ailleurs de ces forums que nous organisons sont faits en collaboration avec les organismes des Nations Unies. C'est justement pour avoir une approche commune et aussi avoir des interventions conjointes et surtout communes qui, pour les mêmes objectifs et surtout pour pouvoir accompagner les pays dans l'amélioration des services de santé, dans l'amélioration des systèmes de santé au niveau national. Concernant le deuxième point pour le gel des financements, le gel de financement, je pense que aussi bien que nous avons, par exemple, des pays qui prennent certaines mesures, par exemple, créer des fonds fiduciaires et tout pour pouvoir pallier à certains déficits, mais c'est en ce moment-là aussi que nous pensons que la raison même d'avoir ce forum est très importante, parce que c'est là où nous avons besoin de la volonté politique, parce que tout commence au niveau politique, quand il s'agit de l'allocation des fonds, quand il s'agit de la création des fonds régionaux, quand il s'agit aussi des interventions communes. S'il faudra avoir des fonds régionaux, cela relève du niveau peut-être du Conseil des ministres ou encore peut-être suggéré par les parlementaires ou encore par les chefs d'État qui vont prendre une telle décision pour accompagner la région et avoir des fonds qui vont pouvoir aider les pays. Nous avons par exemple le fonds pour le VIH. Le fonds pour le VIH, c'est un fonds aussi minime qu'il soit, mais c'est un fonds qui permet de la mise en œuvre de certains projets dans les pays. C'est un fonds qui est approximativement, qui est estimé à peu près 1,6 million de dollars par an. Et c'est cela qui est utilisé aussi pour pouvoir mettre en œuvre certaines interventions qui permettent d'alléger les souffrances ou encore d'améliorer les soins, l'accès aux soins de santé pour un certain groupe de populations. Je pense que là, la balle est à votre camp comme parlementaire. Vous avez l'oreille des chefs d'État, vous avez l'oreille des chefs d'État juste à côté de vous pour pouvoir faire le plaidoyer à cet égard. And the next question is the one for Ms. Swatini. Of course, we are going to avail the presentation, but as I mentioned, also the scorecard is available online. We just you get it. We can send you also the link, and you have you can make your own opinion on how countries are performing toward versus how the scorecard. So this is a tool which is available online on the SADC website, and also we have the link that we can share for you to access the scorecard. Otherwise, you're going to share the scorecard with the honorable members of parliament. Maybe the last one would like just to thank you for your attention, for giving us the opportunity to exchange with you and providing you with these updates as far as SRHR is concerned and other issues related to the health sectors. We hope this is not the last opportunity, and next time we'll also come and exchange with you, most likely the good news, and when you would have adopted laws which are going to allow our countries to give more funding to the health sectors and more. Thank you so much.
Wow, what an interactive session, honorable members. Thank you very much, Dr. Lamboli. And I think it is well deserved for us to say we really appreciate the SADC Secretariat for always being resourceful to us as SADC Parliamentary Forum. I know you did try to avoid answering the question on whether we are a subsidiary of SADC Secretariat or not, but really we do have a very, very good engagement with you, and you are always there to be supportive and resourceful to us during our committee sessions. And we just wanted to make sure that you have that on record, that it is our pleasure to always have you. And we also believe this is not the last time this happens. Honorable members, looking at our agenda, we have reached a point where we are normally encouraged to, have some half break. I'm told that we might have tea outside at the corridor. The time right now is 11:02. I think we normally take 15-minute break. Is that the case, or is that too much? Let me just look at what was allocated for us on the agenda. Yeah, it's normally 15 minutes break. So let us break now and then come back here at 11:30. That will be too much. That will be 30 minutes. Okay, is that fine, honorable members? Let's reconvene here at 11:30. We are now going to have the next presentation from SAFEITS. I will have a pleasure to introduce the presenter later after break. Thank you very much, honorable members. Let's meet again at 11:30.
As if I'm contributing. Yes. Thank you. Thank you.
Okay. Like I'm contributing something.
This a big. You want the three of us. Mhm. Yeah. The chief, I'm good. Kwete yakadai. Ewoni. Eyo zvakanaka.
Honorable members, can we all settle down and start our session, please? For those who are outside, let's come in, honorable members. Honorable members, I hope we all had a fruitful health break. We have our energy back. We are alert to get into the next session of our day. And I would like to thank our previous speaker, Dr. Kuboneki, for such an engaging presentation, very informative presentation indeed. So at this point in time, we are going to proceed to our next presentation, which is going to focus on value clarification for attitude transformation within the SRHR policy and governance. This presentation is essential approach for ensuring that our policies, our practices, and leadership reflect empathy, inclusivity, and respect for human rights whenever we engage with them. It is my pleasure, honorable members, to introduce Ms. Charmaine Picardo from SAFEITS, an organization that continues to champion evidence-based advocacy and transformative approaches in advancing SRHR across the SADC region. Ms. Picardo has been instrumental in facilitating capacity building and value-based dialogues that promote progressive policy implementation and strengthen governance systems. Ladies and gentlemen, please join me in welcoming Ms. Charmaine Picardo to take us through her presentation on values clarification for attitude transformation in SHR policy and governance. You may be aware that you have some papers that have been put on your desks. Do interact with them because those are the materials that our resource person will be using. This is much of an interactive session if it goes by how I know it from our previous interactions. So honorable members, afford her the kind of participation that she would be asking from you. Thank you very much. Ms. Charmaine, the floor is yours.
Oh, thank you. Good afternoon, honorable members. Please allow me to stand on the protocols that have been established. Thank you very much, Honorable Chair. And as the Honorable Chair has indicated, good morning, Madam SG. So as the Honorable Chair has indicated, this is a very interactive session. So I'm going to ask you briefly to also de-roll in some of the exercises. So move away from being an honorable member and look at it as your own individual self. So in this instance, this would be me looking at it as Charmaine and not necessarily as an SRHR programmer, as an example. So looking at that, but we'll have some sessions where the two will merge again, the individual and the parliamentarian will come back together again. So we're going to go through a series of exercises as part of the session, just to really reflect on some of the key issues as it pertains to issues of sexual and reproductive health and rights, and the lived realities of the diverse populations that we have in the SADC region, but particularly so adolescent girls and young women. So just looking at what they go through in their day-to-day lives, what they experience, and what you could do differently as policymakers, having that appreciation and understanding of their diverse lived realities. So we're going to start with, sorry, Ronald, if I could have the presentation up, please. No, not. Okay, no, not this, the actual PowerPoint presentation. Oh, and also I'll be moving around a bit. That's why I have the roving mic and I'm not behind the podium. So it's the nature of the session that is very interactive. So that's why I'm not behind the podium. So if you could confirm for me that you have one full sheet of paper in front of you, and then also 6 small ones. So you should have 2 orange papers, 2 green, and 2 light yellow, and then 1 full sheet of paper. Okay, so from that pile, I would like you to take the full sheet of paper first. That's what we're going to start with. So I need to just bring the... Next slide, please. Thank you, Ronald. So the first thing that we're going to start with is my values tree. So mine is going to be up here as I draw it. Please forgive me, I was never very good with drawing, even at school. So honorable members that share my reality of not being able to draw, please don't worry about the drawing. What we need are the labels more than the tree. So the first exercise that we're going to do is my values tree. So what you're going to start with are the roots of the tree. So what we are looking at the roots of the tree is, where do your values come from? So as an individual. So think about the way you view sexual and reproductive health and rights, or issues around sexual and reproductive health and rights. And where some of those views come from, right? Because there's a way you believe certain things about certain subjects. Think about your culture, for example. Think about consider faith. So if it was my tree here as I'm drawing my roots. So I was raised by a Catholic father and a Methodist mother. I was raised Methodist. And when I got to become a teenager, because my parents were very free about issues of religion, I became Pentecostal. I was still Christian, but now Pentecostal. Catholic father, Methodist mother, and then Pentecostal myself. So sometimes I would go to Mass, sometimes I'd go to a normal Methodist service, or I'd go to a Pentecostal church. And then when it comes to issues of culture, growing up, because my mother has Shona, Ndebele, and Kalanga ethnicity or cultural heritage, I was exposed to those three as well on her side. And on my father's side, I was exposed to something else. So right from a young age, I understood issues of diversity. So even as early as primary school, I had an appreciation of what diversity was about because of that exposure in my own family. And then when it comes to issues of upbringing, I would have what I would call liberal conservative or conservative liberals as parents. So there were certain issues we could talk about. They had boundaries, they were very strict, but they were very open as well. So for example, most of my sexuality education actually came from my parents because we had that open relationship where we could talk about different issues. When it came to the education, I also had certain views formed because for high school, primary school, I went to co-ed. High school, I went to girls only. So there are certain things where you start to speak of freely. For example, issues around menstrual health, hygiene, and dignity, because it was a big thing because we were all girls. There was a very big thing around that. There was no shame around those issues. If anything, we could freely discuss. You could see any of the teachers and talk about issues. We even had what we call a free sanitary bin where you could go and get free sanitary ware before I even knew it was an advocacy issue that could be taken up. So I had that appreciation of knowing that for girls in school, you need to have sanitary ware available for them in the event that someone needs that. Issues around dignity and respect and other things were instilled right from an early age. So think about that as well as you start to draw your tree. And when it comes to the trunk, think about how do you currently approach issues of sexual and reproductive health and rights as a policymaker? Are there issues that you've interacted with before? Are there issues that you are interacting with or open to interacting with? Or are there issues that you haven't really interacted with? What do you stand for? Are there certain areas where there's a bit of tension, for example, where what is pertaining on the ground might not necessarily be what you believe in, or it deviates from your cultural beliefs, deviates from your religious beliefs? So think about that as you draw your trunk as well. And write your current stance or guiding principle on the trunk. So are you open to addressing the issues because you understand there's a need, or the issues are a no-no? And as you do the branches, when you start to draw your branch, so if I had my tree, it would look like this. And I'd already shared the disclaimer about my non-artistic ability in this regard. So this would have been my tree. I would have a symbol or something else. So for example, I would have a symbol here or words. So my symbol, for example, would be women, because because of what I've just shared. Being in an all-girls school, I started to appreciate women's issues and what it means as an example. And then when it comes to the trunk, I would have something else. Maybe it's a symbol on equality, right? That is based on this. So I would share the symbol or the word equality outside of my trunk or inside of my trunk with an arrow. On the branches now, what actions have you taken or path do you plan to take to promote sexual and reproductive health and rights and gender justice? So is it, for example, a motion in parliament? Is it a community engagement with your respective constituents, bringing them together, bringing a space, having a space for religious and traditional leaders with your adolescents and young people in that same space? And then think of laws, policies, advocacy dialogues, or community engagements efforts Maybe you want to look at a policy on prevention of pregnancy for adolescent girls and young women. This could be here. And then draw or write on these branches and leaves. So these become your leaves and your branches as well. So we have about 5 minutes. Would that be sufficient? Then we'll call on a few volunteers amongst the honorable members to share how their trees look. So remember, the roots are the early influences. And what were the critical issues or the key words that are associated with these influences? The trunk is your current approach or what you're standing for currently. You can write this as a symbol, you can write it as a word or words, because sometimes it's not just one word that describes it. It could be equality, it could be justice, it could be other things as well. Access for all, that's welcome as an entire phrase. Then the branches or the leaves are looking at how you act on your values. So the key actions that you've taken or the key actions that you'd like to take or plan to take to promote sexual and reproductive health and rights and gender justice. So this is how the tree would look. Okay, how are we doing, honorable members? Can we have the volunteers to share or give a few more minutes to finalize the tree? So maybe 3 more minutes to finalize. Is that all right? Okay, thank you. Thank you, honorable members. So I would like to call a few volunteers. So I think we can take 5 volunteers. Is that all right? That are willing to share their tree. So from the roots and explaining how they came about the tree. So the roots, what influenced that, the trunk, and then the branches or the leaves. So we'll take 5 volunteers. Okay, I see honorable from Lesotho. Yes, honorable, please go ahead. Thank you. Would you want to come up?
Whichever way.
that's all right.
It's okay.
That's all right.
Thank you very much. Who am I today? Okay, let's talk about my values tree. I was raised by a Catholic family, very conservative. So SRHR related issues were not much of a topic in the house growing up. But however, in our Sotho culture, there's somewhere we call Takaneng, where we have an elderly lady who'd call in all the other, not all, but some teenage girls, put them in and educate them about hygiene and conduct of a young lady. Apparently I was in a mixed school, both boys and girls. So SRHR related issues were not much of a spoken topic, because now with the boys, it seems uncomfortable. With the girls, it feels uncomfortable at some point. So I didn't get much. But however, jumped into the educational side now, tertiary side. Then I started doing sciences. And then majoring in BSc biology made it a bit easier for me now. Started to understand the anatomy and all with respect to okay, let me just say the SRHR related topics and all. Then that's when the door opened. Been in the sector for long. And then that would be my brand, like my roots, because it's mixed, but eventually it put me where I was supposed to be. And then on the roots side also, then God gave me a gay brother. Then it changes the entire perspective now regarding that he's male, but he's behaving like me. It's just chaotic. But then I had to sit down, understand how the entire situation works. Then I became a parliamentarian. Ta-da! Being a parliamentarian now. I'm a chairperson overseeing the SDG implementations in the National Assembly. Now, being there, I've been preaching equality, equality, equality. But the moment I stepped into the National Assembly, I learned something new called equity now, that we don't feed people who had breakfast. Yeah, if you had breakfast from home and we have a large chunk of bread here, we would consider maybe to give more of the bread to somebody that didn't get breakfast. Then I started advocating for equality and equity and not leaving anyone behind. So that's where I am. If I'm looking into a situation and realize that there's somebody that is being left behind, then my head starts ticking in some way. So that's where I am right now today. That's my trunk, leaving no one behind. Then the branches. What do we do? Let me start from my personal efforts. Then we had what we call a child protection bill. And the child protection bill has forever been looking towards having a male and a female child. But we haven't been there looking after the so-called intersex baby. So now I did throw in an amendment that was protecting the intersex baby so that they can have a better SRHR life in their teenage years. So I'm just protecting the baby after birth for them to for them to be prone to surgery with respect to backed up by scientific data. If the child is not assessed, we don't touch the baby. We leave them until they are fully assessed or until they are 18 and make their full decision on which genitalia to keep. So that's where I felt like I had to protect this baby, because the sexual reproductive health that comes later, if ever the genitalia is being tampered with, it becomes a bit of a problem to this particular child in the near future. Okay. Secondly, on the branches, we have an oversight that we are running as a Sustainable Development Goals Monitoring Committee. We're doing oversight in schools to make sure that the sexual reproductive health education is done properly within our schools. Just actually 2-3 days ago, we were with Honorable Khati going around the country, different schools, trying to find out, because they call it LBSE, like life skills and sexual based education. So we go out and find out whether is it being implemented fully? Is it frustrating the teachers, and so on and so forth? Lastly but not least, it's community engagements on the effects of climate change on health, on SRHR, in the hard to reach areas in Lesotho. So we go out as a committee, go to the hard to reach areas, pull community gatherings, and then have conversations with women and men with respect to the challenges that they are facing on SRHR. So that's my tree. Thank you.
Thank you very much, Honorable, for your tree. It seems it started from the roots, the trunk, and a lot of blossoms and flowers right at the top. I'll take another volunteer. Yes, Honorable, please go ahead. So I'll take Botswana and then Eswatini in that order. Thank you.
I'll try and make it a bit faster. For me, with my roots, I'm the eldest child with 4 younger brothers, meaning no sister. Growing up, we didn't really relate with the girl child and the challenges they face. For us, it's about male domination. But then also the church, again, parents very strict Seventh-day Adventists. I think some like Zimbabwe, where the church is big, know how strict the church is, looked down and shunned a girl child who fell pregnant, or any female who had a baby outside marriage. So those are the kind of my roots type of things. And moving to the trunk, I'll only pull out one. And it's my current reality and tension is around issues of gender balance. In Parliament, our party has 15 members of Parliament. And out of the 15, only one is female. That means we had about just less than 7% of women representation in. So it's a big issue, but there is certainly a reluctance by the male members of the party to try and reform and accommodate. And then on the branches about what I hope to be able to impact. Some years ago, I was involved in becoming a patron for the Ministry of Finance on issues of maternal mortality. A lot of issues were brought to the fore. I was in opposition, as I still am. The ruling party became uncomfortable with me sitting in that committee because possibly asking too many questions. But I think for Botswana, it's a group that suffers behind the curtain because no one speaks out. We do well in many other variables. We have huge budgets for health, but there is this dark side that is not being talked about. So it's something that I'm hoping to have an impact on. Thank you.
Thank you very much, Honorable. A round of applause for Honorable. I think it takes a lot of courage to share and also reflect. So a round of applause for Honorable. It's Honorable Ngumalo. Please go ahead. Thank you.
Thank you, Charmaine. I will just mix my roots and the trunk together, and I'll be short as well.
Myself, I was raised by a single mom, but my father was present as well. I went to a girls' school, so that's why I learned my independence. Also to openly communicate issues. I also grew up in the area or scourge of HIV during that time. So my mom would buy, when I was older, tertiary, I grew up with a bunch of sisters. So my mom would buy condoms and put them in the house and say, these are for you, but I'm not sending you to go and have sex. But should you have the need, or should you have to use a condom? Because I will not be able to she said she was not going to give us care when we were sick during the time of HIV. So that made me to be able to negotiate for the use of a condom when I started engaging in the process. So I think that was power that I was given at a young age. And also my mother, she would give me an allowance. She gave us all allowances as girls in the house. We would have an allowance. That led to us not running after sugar daddies or older men because you needed financial assistance or whatsoever, because we were given an allowance. That again also has driven me to fight for financial liberation for women to this stage, because I was equipped at a young age to be financially independent. And also, again, what she also did, she would bring her payslip, because my mother was a police officer. She would bring her payslip and say, this is what I earn. Tell me, choose, let's budget together. Should I pay your school fees or should I go and buy you clothes? And as a child, remember I said I was raised by a single mom. As a child, then you had to choose that, no, it's okay, mom, you'll buy for me clothes later. I think she was working on my psychology. And again, I have said that she was a police officer. She headed the Department of Domestic Violence and Sexual Offenses. I think that is where I got that. To now that I am in Parliament, I am able to openly advocate for SRHR because I have grown in that space. And I know the effects of domestic violence and sexual offenses. So as a parliamentarian now, and a very liberal, that made me to be liberal. I'm not conservative, I should say. That has openly made me to openly advocate in Parliament and outside of Parliament for SRHR. I have also put questions and motions in Parliament that have passed on SRHR. I am also the chairperson of the Gender and Development Committee. I think that stems from the way that I was brought up. Thank you. I thought I should just share that.
Thank you very much, Honorable. So we'll take Zimbabwe, Namibia, and then South Africa, and then close the volunteers for this session. Don't worry, we still have a few other sessions to go through. So we'll start with Zimbabwe, Namibia, and then lastly, South Africa. Thank you.
Yeah, thank you very much.
And Angola. So Angola will be the very last. Thank you.
Thank you very much. As an MP from Zimbabwe, my background is from a marginalized societies, marginalized. So that means the roots from a marginalized society. And from a marginalized society, you need to uplift your communities. That was my major aim. Then in order to lift your society, there must be a tank. That is food security. There must be food security. Without food security, you cannot able to have community development. These are branches and leaves. That's when you see early marriages, because there will be no food security for the families. Then you cannot be able to to preach or to educate people because they will be if they will be food insecure. Also, there will be no equal rights because they will be insecure, food insecure, and cannot be able to teach climate change or climate justice because they will be food insecure. So, from my I see the roots as from a marginalized society as an MP. Then the trunk that is food there must be food security in order for the leaves and the branches to occur. I thank you.
Thank you very much, Honorable. So already showing the interlinkages, right? Issues around marginalization, poverty, food insecurity, amongst other issues. Yes, Honorable from Namibia. Thank you.
Yeah, thank you so much, Madam Charmaine. I come rather with roots by indicating and starting with my father. My father had a very interesting way of loving women. And as a result, women loved him so much that we were born 20 of us from different mothers. So that was something to learn from. But on top of that, I ended up having more sisters. And that taught me a lot about sharing a house with sisters. And of course, that also led to my mother being a single mother and having to share that love with one sister. That also molded me. And then, of course, which led to me learning from my grandfather, who was a bishop and had strong family values. Now, he had his family intact. That also gave me another aspect of family. And then with my grandfather came roles of separation from boy to a girl. And that's where the conservative nature came in that I learned at a later stage. Now, those are my roots. Now, moving to the trunk, who I am today, I've grown to understand the role of a man in a family, that in separation from a woman, and of course, to understand how women are created and what their needs are from having many sisters, and of course, how women struggle with raising children on their own as single mothers, and how difficult it is and uncomfortable to speak about sex, especially to their boy child. And of course, how I've learned how to cherish women from different backgrounds through my father, his love for different women, that I've also learned from. And of course, how to unite and take care of a family from my grandfather, as he would have taken care of many families that were under his umbrella. Now the branches, how I act in terms of my values that I've picked up and how I tend to and intend to push that forward. I intend to create a more grounded children base with the 3 children, the girls that I'm blessed. Now I intend for them to learn from their father. I cannot speak much about the mother because the exercise is about me. And of course, the son, I intend to pass those values through to my son to be a better man than what I am. And of course, also to teach him to love women in diversity, as I've learned from my father. And of course, to teach him how to treat women and be a gentleman. And the children also, I need to teach them in respect of unity as a family. And just I intend to advocate in the whole community in Namibia, now SADC, the importance of unity in a family by ensuring family planning in order for a family to afford the number of children that they have. So thank you so much. Those are what I had to contribute in respect of this exercise. Thank you.
Thank you very much, Honorable. So raising issues of unity, of empathy, compassion, understanding. Yes, Honorable from South Africa. Thank you.
Thank you very much once again. And I also want to join those that spoke about the the issues that you have actually challenged us to speak about. And I am also someone that came from a Catholic religious upbringing, and I went to the church school. And also in a very cultural and conservative household where we never spoke about issues of sex and reproductive health and so on. But in the same time, we lived in a community with very liberal values, where there was a lot of also social challenges and things like that. So this at a very early stage also raised your consciousness. And I became, particularly through my political involvement, more and more conscious about the issues of triple oppression of women, how women are being suppressed as a gender, as a race, and as a class, as a working class particularly. And my values is that we need to build respect and dignity, particularly amongst people, particularly poor people, because sometimes poverty can erode your dignity in many instances. And that is some of the things that I believe in. I also believe in equality and also in humanity, because sometimes we can forget to be humane, particularly if you find yourself in circumstances where people don't have enough for themselves and they don't actually, they begin to become selfish. And that is some of the things that I learned through life, and also collectivity, collective decision making, sharing, like someone was just saying now, sharing is caring. But also I believe in the fact that we need to be empowered, and that we need to empower women, and particularly the girl child. That now led to the fact that when I was sent to the National Parliament in the 6th Parliament, the first thing that I did is to continue with my strong activism on gender-based violence and femicide, and also the issues of public participation, particularly on women and the girl child, and sectoral engagement, like engaging men in particular. I think I was one of the founders of the Men's Parliament, and also the issue of religious parliament, which was something that was outstanding. Churches wanted to be involved, but also, they've got their own challenges with regards to some of the pastors, their beliefs, and the rigidity that you find sometimes in people's beliefs on that is conservatism. And that is some of the things that we, through our sectoral program, addressed. But one of my biggest achievements while I was in that parliament was to review the Women's Charter that was drafted in 1994 when we started with democracy in South Africa. And I found, when I landed at parliament, I found that in 25 years, the charter was never reviewed. So we enrolled in a process of 18 months. All the districts in the province, in the country, province by province, we actually engaged with women, and we could produce a document that can assist. Now, I've seen that even Treasury is using our document, even the Women's Ministry is using our document to actually lead on gender-sensitive budgeting and things like that. So I think that I wanted to share this with this gathering at this specific moment, because I think it's very important that we shouldn't forget where we are coming from. Thank you very much.
Thank you very much, Honorable, for highlighting that. So issues of dignity, of respect, and motivating action, right? Coming into Parliament, realizing 25 years, there isn't much change. Thank you for that. Lastly, Angola. Thank you, Honorable.
Muito obrigado. Esse tema é de grande importância e remete-nos a uma reflexão profunda. Onde é que estamos a sair? Onde estamos e onde queremos ir? E que famílias é que estamos a constituir? Eu sou filho de um pai catequista, que era muito rigoroso na educação, no que diz respeito à religião, mas também era conservadora da tradição africana. Em nossa casa, tínhamos uma educação separada. O pai educava os rapazes num sítio apropriado e a mãe as raparigas. E havia uma linha vermelha que ninguém podia pisar. As meninas eram submetidas ao fico, que é o casamento tradicional. Toda miúda que ficasse grávida sem fazer essa festa de puberdade era um desprezo para a família. E era desprezada primeiro pela sua própria família e também pela sociedade. Pelo que ninguém ousava naquela altura pisar a linha vermelha. Agora, os tempos que correm são outros. Há filhos que já não querem ouvir os pais. Nós, naquela altura, quando houvesse uma festa, bastava o pai abandonar a festa, todos nós saíamos a correr, ninguém podia ficar. O pai foi e quem encontrasse o pai em casa não podia bater a porta, porque ele não abria. Era assim que nós crescemos. Mas hoje em dia, os filhos não querem sentar com os pais, chegam a hora que quiserem e então acontece o que estamos a ver. Mais do que falarmos das consequências, temos que falar das causas, que são muitas. Nós, no Parlamento angolano, há programas em que os deputados se desdobram escolas para fazerem palestras no sentido de formatar a mente do cidadão da manhã. E nisso o Parlamento tem sido feliz, porque isso tem estado a diminuir consideravelmente essa prática nociva. Pelo que é uma luta, devemos encontrar políticas adequadas para, de facto, desencorajarmos essa prática que a todos envergonha. Muito obrigado.
Thank you very much, Honorable, for sharing that. So from all of our volunteers, you see that there's a lot of diversity, right? Right from the roots to the trunk to the branches that shape the values, shape where we are, or shape the future that we are planning. So the reflections as well, showing that diversity. So just like the parliamentarians or the respective honorables that shared, and those that didn't share, of course, have diversity. It's the same representation of the constituents or the SADC citizenry, where there is so much diversity and there are lots of issues then to consider when we're at the policy space or making different laws. So as I indicated that we have a few sessions to go through, so I'm going to go to the next exercise. So this is the next exercise. So the small pieces of paper that are in front of you, honorables, on the green paper, please write agree. So you have 3 pieces of paper. So one green, small green paper. On the green, please write agree. So there are a few markers around the tables, but you could still use a pen. I think we'll just use the color code because we know green is agree. Orange is disagree. And the light yellow is unsure. So green for agree, the orange for disagree, and the light yellow, not sure or unsure. So the green honorables is for agree, the orange disagree, and the light yellow unsure. So I think we have all the 3 ready. So I'll read a few statements. I will not go through the entire statement so that we go through all the exercises. So I'll just pick about 4 or 5 statements to read. But what I would ask you is, if you agree with the statement that I've read out, please raise the green paper. If you disagree, you can raise the orange. If you're unsure, or if you're sitting on the fence, it's a yes or no. You think to some extent you agree, to some extent you disagree, you can raise the unsure, so the light yellow. So I'll read the first statement. It is easier being a man than being a woman in accessing opportunities and leadership roles. So agree, a lot of greens agree. I see one disagree. I see one unsure. So I would like to take one response that agrees. So honorable member from Lesotho, that's disagree. So you represent disagree. And then for agree, I'll go with you, Madam Honorable. And then for unsure, Madam Honorable as well. So we'll start with agree. Madam Honorable, please go ahead. Thank you.
Nós viemos de sociedades coloniais e sabemos que as sociedades coloniais são sociedades machistas. E isso marcou as nossas sociedades mesmo depois da independência. O exemplo que eu dou, eu fui para as Forças Armadas muito cedo e não deixei de fazer aquilo que os meus colegas fizeram, homens, desde o treino militar até algumas outras atividades, mas durante as promoções havia prazos para a promoção e o que nós notamos é que, de facto, os homens eram promovidos com mais rapidez e no prazo que era estipulado, porque até havia lei, e nós as mulheres éramos enroladas e de facto hoje, apesar de termos tido um grande número de mulheres que entrou naquela altura na mesma fase que os homens, hoje e de forma voluntária, hoje temos mais homens que atingiram a carreira do generalato do que mulheres. Essa é a minha experiência recente. Obrigada. Vida na primeira pessoa, como acabou de dizer a senhora deputada Luísa Damião.
Thank you very much. Thank you very much, Honorable. Yes, disagree. Honorable from Lesotho, thank you.
I really don't think it matters whether one is a man or a woman. I only believe that it depends on how a person has been trained or the exposure that a person may have.
Sorry, Honorable, if you could get the microphone a bit closer. Thank you.
I'm saying I really don't believe that it matters whether a person is a man or a woman. I believe the crux of the matter is the exposure that one has been through. Or apart from that, if the person has been trained to stand for what she or he believes, and she can be assertive enough to find the opportunities, she can get the opportunities as the same as the men can do.
Thank you very much, Honorable. Yes, Honorable, please go ahead. Thank you.
Merci pour la parole. Oui, j'ai noté que je ne suis pas sûre que à 100% qu'on privilégie plus les hommes que les femmes. Bien sûr, je viens d'un milieu où j'ai vécu à l'extérieur de mon pays et j'ai eu une éducation occidentale, donc on devait se battre, hommes, femmes, pour un même job. Il est vrai que souvent, même en Occident, les femmes se plaignent du fait que pour un même travail, souvent les hommes sont payés plus. Mais ça ne donne pas, ça vous donne pas l'occasion, de dire que vous êtes dévalorisé ou quoi. En tout cas, je rejoins un peu l'idée de Lisoto qui dit que c'est sa formation, la femme, elle doit se battre, hein, tout comme l'homme pour pouvoir accéder à un poste. Donc, je sens pas cette grande différence. Je pense que ça, c'est une valeur intrinsèque. C'est lié à l'éducation, c'est lié à la formation, c'est lié à beaucoup de choses. Donc, on peut se battre pour accéder au poste au même titre que l'homme. Il est vrai qu'il y a des petites nuances qui peuvent être financières dans certains métiers. Voilà.
Thank you very much, Honorable, for that submission. Next statement. So we won't reflect on these for now. Right at the end, when we come and we're wrapping up all the exercises, we'll reflect on some of the responses that are, that the honorable members are sharing here. So family planning should be a shared responsibility between men and women. Family planning should be a shared responsibility between women and men. So unanimously, it's agree in the entire room. So this is unanimous. We will not agree unless there is an honorable member who's really burning to represent the unanimous submission. Okay, so we'll carry on. All individuals, regardless of sexual orientation or gender identity, deserve equal access to sexual and reproductive health services and rights. So again, another one, unanimous, agree. Next statement, access to safe abortion is an essential part of ensuring women's right to life and health. Access to safe abortion is an essential part of ensuring women's right to life and health. So we have a few submissions. So the majority is on agree, but there's some that are yellow, so unsure. So I'll take one, and then there's a disagree. So I'll take honorable member from Angola for disagree. Honorable member from Namibia, you had unsure, right? Honorable, you had unsure. Yes. And then I would want one representatives from the agree. Would like to share? Yes, honorable. So we'll start with disagree, and then come to unsure, and then lastly to agree. So honorable, please go ahead. Thank you.
Muito obrigado. Nós discordamos porque nós temos uma lei que só aprova o aborto em duas ocasiões. Quando está em causa a saúde da mulher ou quando é fruto de uma violação. Porque nós não concordamos que o aborto deve ser feito a qualquer momento, até porque nós vivemos numa sociedade católica que amamos a vida e achamos que a vida deve ser preservada. Portanto, concordamos que o aborto deve ser feito só em duas ocasiões, quando está em causa a saúde da mulher ou quando é fruto de uma violação. A adolescente não é obrigada a ter esse filho que é produto de uma violação. Mas não podemos ter o aborto a ser feito em qualquer lugar e de qualquer forma. Muito obrigado.
Thank you very much, Honorable. Honorable from Namibia, you had unsure. Please go ahead. Thank you.
Yes. I tend to be neutral, given the background that there are some common practice where it is done traditionally, which is completely unsafe because they use natural remedies to abort. Then secondly, I come from one of the smallest nations if it's legalized, we will be affected economically because we are less than 3 million. That's why I'm not sure. Thank you.
Thank you very much, Honorable. And then lastly, Honorable from South Africa. Thank you.
Thank you very much, Program Director or Presenter. The reason why I wanted to maybe just clarify on why we agree with it. As a Catholic, once again, and one that grew up in a very strong Catholic house, we are totally against abortion. But the buzzword here is about the issue of access to safe abortion. Because abortion came to because of the reality, particularly in South Africa, of backstreet abortions that existed. And how many girls died or women died because of the issue of backstreet abortions. So that is why I agree, not because I'm someone that will promote abortion, but because of the fact that the importance of access to safe abortion for women, that is the one that we agree with. I just wanted for my brothers and sisters with that Catholic upbringing, so that they can have a better understanding of why we agree.
Thank you very much, Honorable Member. And then the last statement. Religion and culture should determine how Parliament addresses sexual and reproductive health and rights issues. So religion and culture should determine how Parliament addresses sexual and reproductive health and rights issues. So I see if you disagree. So religion and culture should determine how Parliament addresses sexual and reproductive health and rights issues. So there's a lot of disagree. Okay, it seems it's unanimous. It's okay, there's one unsure. There's disagree and unsure. So I'll have one volunteer for the disagree, and then Honorable Member, you can share for unsure. Yes, Honorable, please go ahead.
The determining factor should be human rights, not religion or culture.
Thank you, Honorable Madikizela. Yes, Honorable, please go ahead.
Oui, si on doit se baser sur la religion, on a différents types de religions. On a différents types de religion. On a les pentecôtistes, on a les catholiques, et les deux réagissent différemment. Hein? Pardon? Oui, il y a même les athées. Donc, je pense que ce ne sont pas de bonnes organisations qui doivent, enfin, ce ne sont pas ce type d'organisation qui doit influencer maintenant les lois, parce qu'ils ont des idées tout à fait différentes concernant la santé reproductive et sexuelle. Et même les musulmans, c'est différent. Ouais.
Thank you very much, Honorable Member. So the other Honorable Members are saying you're actually with them, you're on disagree with the submission that you've given. Thank you very much, Honorable Members. So we'll skip this next exercise because I'm conscious of time, but it's very much related to the first one that we were doing. So this is what we would call the comfort continuum exercise. Yes, Honorable. Okay. Okay, so Honorable Madikizela has asked for responses. A man cannot rape his wife. So again, agree, disagree, not sure. A man cannot rape his wife. Okay, so Honorable, I'll come to you for Dako, and then for your submission, and then Honorable, your submission on unsure, right? Honorable from Botswana. And then I want one volunteer to speak on disagree. Honorable Madikizela with his question wants to take the disagree. So I'll start with you, Honorable. Please go ahead on agree. Yes, please go ahead. Yes, please.
Merci beaucoup de m'avoir accordé la parole. J'estime que un homme qui est marié, déjà au départ, excusez-moi, l'acte sexuel, c'est un acte sur lequel l'homme et la femme, ça s'accorde dès le départ. Ils savent que, bon, voilà, en se mariant, c'est un acte qui va commencer à se poser. Alors, je me dis, si je parle de mon cas aussi, hein, et partant de ma culture, partant de mes convictions, je ne vois pas comment un homme peut-il violer sa femme. Je ne vois pas. Je ne vois pas. Je ne vois pas comment cela peut-il se passer. La femme peut ou ne pas être d'accord, mais je crois qu'ils vont trouver toujours intérêt d'entente, quoi. Il y a la compréhension qui est à la base de tout ça. Je ne vois pas, parce que je parle de mon cas personnel. Je parle de mon cas personnel que je ne peux pas généraliser. Voilà. S'il y a des hommes qui ont qui éprouvent ce genre de difficultés dans leur couple, bon, je compatis avec eux, mais ce n'est pas quelque chose à généraliser, à dire qu'un homme ne peut pas, un homme peut violer sa femme. Je ne vois pas ça, je ne conçois pas ça comme ça. Voilà.
Merci pour la submission, Honorable. And then Honorable from Botswana, you had unsure. Yes, please go ahead. Thank you.
I'm unsure because I hold a bit of both sides. A bit of me agrees with the submission by the brother behind me, the Christian background of the two being one. I'm also sympathetic to an instance where one partner in main and the weaker partner being the woman being coerced. But I take the position that normally is a product of a failed or failing marriage. So rather than burn energy on can there be marital rape, I think the issue for me really is it's because the marriage has collapsed, and that is what you need to address at the end of the day. Thank you. And that's why I'm split between the two.
All right. Thank you, Honorable. And lastly, Honorable Madikizela, please go ahead. Thank you.
Thank you, Shaman. The reason why I wanted to provoke this debate is because there are two ways to understand that statement. A man cannot rape his wife. Of course, he can't. But that statement is saying a man cannot rape his wife because he is entitled to have sex with his wife, which is wrong. And that is why we say disagree, because just in a simple term, I don't even want to go in a long explanation. Sex must always be consensual at all times. Whether it's between a wife and a husband or a girlfriend and a boyfriend, it must be consensual. And by the way, it has nothing to do with a marriage that has fallen apart. It just has to do that sometimes, as the same as with men, sometimes you don't feel like it on particular days. And I mustn't force myself on you because I feel like it. So that's just the point.
Thank you very much, Honorable, for that. So is that a response, Honorable?
Oui, je voulais ajouter quelque chose. Je me dis, dans le cadre d'un couple ou dans le cadre d'un mariage, il serait préférable qu'on puisse trouver une autre qualification au lieu de parler de viol. Quand, par exemple, un homme force sa femme à poser ces actes-là, on ne peut pas le considérer, on ne peut pas considérer prendre cet acte-là de la même façon qu'un homme marié le ferait avec une femme qui n'est pas avec une dame qui n'est pas sa femme. Je ne sais pas si je me suis fait comprendre. Donc l'acte, c'est bon, mais lorsqu'il est posé dans le cadre d'un couple, dans le cadre d'un mariage, il ne peut pas être considéré de la même façon que lorsqu'il est posé en dehors d'un cadre en dehors des cadres de mariage. Parce que la femme qui a été épousée par son homme, c'est qu'elle est préparée à poser cet acte-là. C'est quelque chose auquel elle s'engage dès le départ. Alors, si par exemple, pour une raison ou une autre, elle estime qu'elle ne peut pas le faire et que son homme la pousse à la faire de façon avec violence, certes, c'est quelque chose de ne pas bien, mais considérer ça de la même façon que l'acte serait posé en dehors d'un cadre de mariage, moi je trouve que la comparaison elle n'est pas toujours bonne.
Thank you, Honorable. So we'll move to the next exercise. I think this opened a bit of a Pandora's box, right? And we could spend time discussing this, but we'll go through the rest of the exercises and then do a reflection right at the end of this. So as I was mentioning that we're going to skip this exercise, but I think already it was coming out. So this looks at comfort levels of honorable members. So looking at just how comfortable you are with discussing issues of sexual and reproductive health and rights, whether it's at the level of the constituency or it's at the policy platform where you're in parliament and you're engaging with fellow honorable members, or at different spaces, now discussing with the media, for example, something has happened in parliament or has been discussed. So this is what the exercise is about. But this exercise that we are going to move to, so I'll need 19 volunteers. And this, honorable members, I'll ask you to get up with me and come into the U shape. So I need 19 volunteers because we have 19 different identities. So I need 19 volunteers from the honorable members. So I have my first volunteer. Thank you. Okay. So there's a suggestion to get one member per country. And then the numbers that are remaining, then we then have the numbers. So Honorable Madikizela for South Africa. For Zimbabwe, do I have a Honorable Karenyi? Okay, so we have Honorable Karenyi for Zimbabwe. And then we have for Zambia, Honorable. Thank you. For Namibia, Honorable. Thank you very much. For Mauritius, we're waiting for Mauritius. So one honorable. So there seems to be a discussion amongst the honorables for Mauritius, who's going to represent the country. Thank you very much, Honorable. Yes, thank you. And then we move on to the Mountain Kingdom, Lesotho. So for good measure, Honorable Madikizela says we'll take 2 from Lesotho. So to cover the numbers. So we need someone else from Lesotho. Thank you very much, Honorables. Then for Eswatini. So 2 as well from Eswatini. Thank you very much. And then from the Democratic Republic of Congo, from the DRC, thank you, Honorable. Botswana, Honorable, yes, thank you, Honorable, by default, thank you. And then Angola. Then 2 from Angola, yes, Honorable, thank you very much. Okay. Yes, please, so you're getting inside, so going right all the way to the end. So if you need to carry your headset, please do so, but right to the end. Are they 19? Sorry, honorable members, are you 19 yet? So I need a 19 volunteers because I have 19 identities. So this is like a raffle. I don't know who's going to pick which identity. I just folded.
Can we have another member from Namibia? Additional member from Mauritius? So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 13, 14, 15.
So we need 7 more. So Zimbabwe, another volunteer from Zimbabwe. We have Namibia. We have another volunteer from
Angola can come through as well.
Angola. If we could have another from Angola and another again from Lesotho.
DRC as well. DRC can come.
So DRC as well could come. Thank you. So like I said, it's a raffle draw. There are 19 identities. I don't know what you're picking, Honorable. So for DRC, and Angola, we'll translate because the identities are written in English, but we'll translate them. No, it's only one. Thank you, Honorable. Thank you. Okay. Thank you. You have. So we have three. Oh, sorry. So we have two more. Honorable Chair, thank you. So we have one more. Yes, Honorable, thank you very much. Sorry, so if I could kindly have one Portuguese interpreter for just a few seconds and one French interpreter for just a few seconds. So the reason why I'm asking them to come where we are is that we don't want to review the identities until right at the end. So it's only when we get to the end of the exercise that we are going to review the different identities that the honorable members have assumed. Rich, please come through. Sorry, the honorables from DRC. Okay, that's all right. Honorables from DRC, please French. So please translate these identities. Yes, they are different identities. For Portuguese, please translate their identities for them as well. I'll give the instructions just now, Honorable. Thank you. Okay, thank you very much, honorable members. So if the interpreters have interpreted for the honorable members, it's all right. You can go back to the interpreters booth. So I'll start reading out the statements. So honorable members, please note, at this moment, you are not your real self. You are the identity that is on the piece of paper. So right now, we don't have Honorable Karenyi. We have the person that's on the little piece of paper. So I'm going to read out a series of statements, and you either move forward or not move based on the identity that is on the paper, not your real identity. So based on the identity on the paper, I'm going to read out a few statements. If that is applicable to who you are, as per the little piece of pink paper, then you move forward. If it doesn't apply to you, you stay where you are. So I'm going to ask us to start as far back as possible. So if you're right at the back, but are able to move forward, and the person in front of you cannot, you would just politely ask them to excuse you so that you can move forward. So I'm going to read a series of statements. So if you agree, you move forward, you move towards me. So the first statement, I have or will complete my education. I have or I will complete my education. Thank you, honorables. I see there's a lot of enthusiasm, but please make the steps a bit small, otherwise we'll go right to the wall. So if it's possible to make them a bit, but that's all right. So the first statement was, I have or I will complete my education. And then the second statement, I do not worry about my next meal. I do not worry about my next meal. And then I can easily go and access HIV testing, treatment, care, and support services. I can easily go and access HIV testing, treatment, care, and support services. Then the next statement, I can easily find a job. I can easily find a job. Next statement, I feel secure, I feel safe and secure walking around at night without fear of getting raped. I feel safe and secure walking around at night without fear of getting raped. Then I have access to the internet. I have access to the internet was the statement. And then it's easy to get a bank loan and start a business. It's easy to get a bank loan and start a business. I can access contraceptives when I need them. I can access contraceptives when I need them. And then I can open up about my sexuality. I can open up about my sexuality. I can easily negotiate for safer sex with my partner. I can easily negotiate for safer sex with my partner. I can easily refuse proposals for sex for money. I can easily refuse proposals of sex for money. And then I can determine how many children I will have. I can determine how many children I will have. I am comfortable going to the police to report sexual assault. I am comfortable going to the police to report sexual assault. When I fall sick, I have no challenges accessing help. When I fall sick, I have no challenges accessing help. I can marry a person of my choice. I can marry a person of my choice. I am respected by members of my community. I am respected by members of my community. And then lastly, my family respects my decisions in life. My family respects my decisions in life. So honorable member here was very excited throughout, and she was smiling and saying, yes, yes. Would like to know who you are.
Thank you very much. Actually, I was very excited. I'm a young business executive.
Why do you feel, honorable member, that it was easy for you to move? Because it seems almost every statement you were easily able to move. You didn't even hesitate.
I think it's because since I'm in business, I'm a young executive, I'm a business person, I have control over my life. I have control money, marriage, relationships, business decisions, and all that. So that's how I was able to move. Thank you.
Thank you very much, Honorable. And then, Honorable, please share with us your identity and why it was easy for you to move as well. Thank you.
Porque eu sou uma jovem de uma família rica.
So Honorable says the identity was a young male from a wealthy family. And why, Honorable, do you think it was easy for you to move at each statement or when each statement was read out?
Para mim foi fácil, porque eu sempre fui educada a que respeitassem os meus direitos, desde a minha infância. Na minha casa nós éramos tratados por igual. Raparigas e rapazes tinham o mesmo tratamento. O meu pai incentivava toda a gente a estudar, contrariamente a outras sociedades em que a prioridade era para os homens e as mulheres só podiam ser domésticas. Eu comecei desde muito cedo a ver que o meu pai respeitava tanto as raparigas como os rapazes. E cresci com este sentimento de que os meus direitos devem ser respeitados. Portanto, não tenho problema nenhum de tomar as minhas próprias decisões. Muito obrigado.
Thank you very much, Honorable. And Honorable, your identity, please, and why was it easy for you to move?
Thank you very much. I'm a single mother with 2 children living in an urban area. Life is tough for me as a single mother. That is why I was almost here. I was not there. Even though I am a single mother with 2 children whom I have to raise in an urban area, but my life is at liberty. I'm responsible for my life. Thank you.
Thank you very much, Honorable. So, Honorable, you're also here. You're not quite there yet. Please, your identity and why did you move to some extent and why did you stop moving?
Okay, thank you, Charmaine. I think I should have been there, but my subconscious as a woman would like keep me back. In fact, I am a male investment banker with $1 million investment portfolio. So I'm there. But then my subconscious would, kept me here. The reason I was able to move forward and fast enough is because I have the resources. I can marry anyone. I can make it rain on the girls. I can literally do anything. I can start a business if I want. I am determined, I'm self-driven. So that's why I am where I am today, because I pushed. Remember, even if I was from a poor background back there, but I had the dream. So that drove me forward. Thank you.
Thank you very much, Honorable. So I'll speak to the last 2 middle. So we have middle, and then this is a bit of a back middle, and then the back. I'm going to come to the back as well. But Honorable, please go ahead.
Perhaps this is not my handwriting, and whatsoever spelling, I don't know. But they call me sex worker who lives in a compound. Sex worker who lives who lives in a compound. Okay, firstly, I should be there because whatever that is happening, sexually, I touch base with almost everyone. You see, the richer, the businesswoman, the child from the wealth family, they always come to me. So everyone now, it cuts across in terms of sexual reproductive issues. I cut across, I touch everyone. So, yeah, everything they do, yes, I'm always there, floating with them, going around. Yes, you like it or not, money plays with me in most cases. Yes.
Thank you very much, Honorable. And Honorable, please, your identity. Do you want me to read the identity and then you can explain why you moved? So Honorable was a female student from a middle-class family.
Oui, comme vous vous apercevez, je ne suis pas tout devant et je ne suis pas tout derrière non plus. J'ai quand même des parents qui sont issus d'un milieu, d'un milieu moyen et qui me permettent quand même d'être formés, hein, d'atteindre certains objectifs, mais pas tout. Alors, c'est dans ce sens-là que je suis ici au milieu et voilà.
Thank you very much, Honorable. So Honorable says, as a female student from a middle-class family, she was in the middle because she had some privileges coming from the middle class, but then also being young and female, there are some limitations. So she couldn't be all the way to the front. So that's why she's here. So I'll come to the back middle. Honorable, your identity and why you were able to move and not move.
My identity, I'm a HIV positive man who has sex with other men. Hey, it's so relatable. Okay. I'm not there. I'm here. I couldn't move because of the stigma. Now, if you start betting for the other team, obviously there's stigma. Getting health services is a problem. You going for a job interview, you are getting eyes and all that. So you can be there. You're getting all the services you need. You're getting all, except the health services, obviously. But all the other things you can leave by day. Every day you can leave. But however, you progressing and growing bigger becomes a bit of a challenge due to stigma. Mm.
Thank you, Honorable. Thank you. I'm a young female, domestic worker, 17 years old. With even a orphanage background from the rural area. At 17, I'm still very optimistic that if I raise enough funds, I can go ahead with further education and also see a bright future that being a domestic worker, they can be success or good future ahead. That's why I'm moving slowly. I see the greener light ahead.
Thank you very much, Honorable. Honorable, go ahead.
Okay, yes.
So Honorable was a 16-year-old girl, married at 11 years old and staying at a farm settlement.
Eu sou uma menina de 16 anos, casada há 11 anos. Vivo numa fazenda. O custo de vida levou-me a contrair um matrimônio com 11 anos. Mas agora que descobri a vida, estou a dar no duro numa fazenda para mudar o curso da minha vida. Muito bem. Okay.
All right, thank you very much, Honorable. So Honorable here was a teenage girl with a sugar daddy or a teenage girl with a blesser.
Donc, je me retrouve pratiquement au milieu parce que, en tant que jeune fille vivant avec un papa qui a assez de moyens financiers, alors ces derniers peuvent m'aider à atteindre un certain nombre d'objectifs. Alors, parce que quand on a l'argent, on a le moyen de pouvoir avancer dans la vie et d'atteindre les objectifs que l'on s'assigne. Mais il y a quand même un frein quelque part au niveau de la société, il y a la réaction sociale. Et des fois qu'on essaye d'avancer, on recule un peu, on se dit, on est étiqueté, on est stigmatisé, mais dans une société qui se paupérise de plus en plus, on constate que c'est un phénomène qui date de longtemps, hein. Ça ne date pas d'aujourd'hui, le phénomène qui consiste à avoir une fille, sortir avec un papa riche et tout ça. Et bon, voilà, mais en tant que tel, je me dis, bon, je peux avancer, mais à un certain moment, j'ai un peu de réserve à cause de la réaction sociale, à cause de la stigmatisation. Donc voilà, c'est pour cela que je me retrouve au milieu là. Merci.
Thank you very much, Honorable. So Honorable says, so I'm paraphrasing for the Honorables that don't have their headsets. So Honorable says, because of the means or having the bless or the sugar daddy, there's some money or some economic power where they can do a few things, but there are also limitations because of the situation that forced them to be with that sugar daddy. And also the social stigma and discrimination that comes with that status. You have the money, but it's something that is socially frowned upon. So it's not something to really celebrate and say, this is where I am. So honorables, I'll just ask for your quick submissions, who you are and why you moved or why you didn't move. Thank you.
Thank you very much. So for me, my identity is that of an unemployed young man with a visual impairment or disability. So I wasn't able to move much, but at the same time, one would say that how come you were even able to move? I think some of the things I was looking at it from the context of my country, let's say, for example, issues to do with education. There is chance that I can finish my education because of the free education policy and bursaries that the government gives to those that want to pursue education. And also a bit of advantage that is given to those that have disability. You know, they are given priority. If you have a disability, you want to access education, you are given that advantage. Then on issues to do with, say, for example, marrying, it's not very easy to marry a person of your choice. But when you marry, when you have an opportunity to marry, you find that you can decide the number of children that you would like to have. On issues to do with being raped at night, there I moved a bit because in our area, it's not very common that male children or male young ones are usually raped. It's very rare. So in terms of security of moving at night, it's there. Then access to internet, of course, I didn't move much because it's not very available. Then on the issue of going to police to report matters, it was I couldn't. I moved a bit because in an event that I have an issue that I want to report, I can easily ask someone to escort me. So basically, that's why I moved a bit, but I didn't move much because while opportunities may be there, but they are limited. Thank you very much.
I am a young girl, young female graduate with a physical disability. Although I'm a graduate, I have limited chance of getting opportunities because some of the people who can give me opportunities do still have perspective that disabled people do not have abilities. Secondly, I also have limited opportunities because in some cases it is not easy to access buildings where I can get opportunities and other services that I may need. Thank you.
I'm a 16-year-old adolescent pregnant girl. I think I only moved once or twice in a statement that says I will finish my education because being pregnant at 16 is not a life sentence. Depends on the decisions that you can make going forward. But because of my age, even though I have access to many of these things, but the stigma that attached to a young girl getting pregnant is the reason why I didn't move much.
Thank you, Honorable.
Okay, thank you very much. I didn't move a lot because my identity by itself was just not clear. It says I'm an informal trader selling vegetables on the streets. Am I a male or am I a female? So some of the statements that were mentioned, depending on my gender, would actually influence how much I would move. Because it's quite difficult to believe that just by being an informal trader, we experience the same thing across our genders. So that made it very difficult for me to decide which statement do I move for, which one do I stand for. But all in all the things that concerned economics or finances. I knew very well that I will have difficulties with those, so I couldn't move on those. But also, I also looked at things in the perspective of the current situation in my country, for example. Services around education, health systems, knowing that they're accessible, they're free, it's what made me move a bit. But then when it started coming to more contextual things that talk about finances, that talk about the, exclusion and everything, in cases where I wanted to move, I would say, what if I'm a female trader? You would not have the same advantage as a male trader. So I just decided to stop and say, let me be here.
Thank you, Honorable. So I'll address what you've just raised. You notice some of the identities are very specific. It says 17-year-old boy. It says this, you're male, you're female. Others were deliberately left like that, where it's ambiguous, you don't know. So you create the context. But as we wrap up the session, I'll go to that. Yes, Honorable.
Thank you very much. I'm an unemployed youth, and I was so biased to say, maybe let me focus more on the girl child. So I said to myself, in terms of the internet, taking into consideration where I come from, the internet is very expensive. And obviously, it's a disadvantage on her in terms of health. If you don't have the medical aid, it's not easy for you to access everything in terms of health delivery. In terms of rate, obviously that one is so vulnerable because she's not employed, and obviously by end of the day she might also get into the issue of sex worker and the like, so she's very unsafe. In terms of the issue of marriage, obviously she doesn't even have that kind of right to choose, because obviously she's not employed, maybe she's poor. That's the reason, because if she was coming from a rich background, obviously she was going to get a job. So everything more is like she can't move because of her predicament. In terms of education, yes, she might be educated, knowing the rights, but when it comes to exercising them, I see that there is a lot of vulnerability. That's why I didn't move much.
Thank you very much, Honorable. So right at the back benches, so they either moved once or did not move at all. And Honorable, your identity, why didn't you move? What do you think were the reasons that stopped you from moving? Thank you.
Thank you so much, Madam Shamaine. I am a 14-year-old high school student in a rural area. I struggle a lot to get certain things done because of limited services at my village. I stay far close to the border of the country where no one comes to visit. And of course, finishing school, I moved once because I have that motive that one day I'll finish school. By virtue of being a 14-year-old girl, my father works far south where the railway station is, where they are working on the railway line. I'm only left with my mother. And she's very beautiful and I look like my mother. That's why I fear rape every time. All the boys young in the village, even the older ones, are always whistling at me and they like me. It is a very big problem because when I go fetch water, it's a problem. When I go collect wood, it's a problem. I feel very unsafe. And I do not have access to the police because the police is on the outskirts. And even the police chief is rumored to be related to one of the criminals in the village. And of course, the internet, we don't even have water in this village. We don't have access to electricity. So I think the internet is a big dream that I might not see if I stay in this village for long. So we suffer a lot and I have to take care of all my siblings. I have 3 children that follow me and I have to take care of them, cook for them every time. I don't get to finish my school. So I remain where I am and I don't see myself leaving this village.
Thank you very much, Honorable. And yes, Honorable.
I represented this character, a female student struggling to pay school fees. I didn't move at all because firstly, it means struggling to pay school fees means poverty. Now, in poverty, there are very few options. You have basically no choices to make. And then for me, when it says struggling to pay school fees, it also means a barrier to education. And without education, you cannot do much. Sometimes we assume that when we say there's free education, it means everyone has access. I represent a constituency that's the capital tourism of Botswana. Some students reside outside the main areas, and they have to travel by foot 10 kilometers to access school. And in those areas, you have free roaming animals, including lions. That therefore means it's a barrier. And every time we politicians talk about not leaving anyone behind, I think we need to factor such things in that scope. Thank you.
Thank you very much. I represent a 16-year-old orphan living on the streets. So I didn't move because if you are an orphan living in the streets, it's just like you are cast without father or no mother, no one to take care, no medication, scratching for food, no health services. So I didn't move. I'm just as helpless as. Thank you very much.
Yes, thank you. So I'm a female migrant worker working in a factory with no legal paperwork to stay in that country. So I didn't move. I'm trapped in a situation where I'm very vulnerable. So I'm waiting for a miracle to save me from the situation.
Thank you very much, Honorable. And thank you very much, Honorables. A round of applause for our very brave volunteers. So as we wrap up this session, so I think it was one of the Honorables that whispered to me and said, but is this relevant? And yes, it's very relevant. Because when you're thank you. So I see Honorables retained my identity. So Honorable says, I don't want to associate with your identity. I'll leave it with you. Thank you. Thank you. Thank you, Honorable. Thank you very much. So the reason why it's very relevant is that when you sit in parliament, these are the people that you're making the laws for. So if we had read out these statements, if we read out these statements, thank you. So if we read out these statements now, based on your identity as a policymaker, or if I read them for myself as Charmaine, I would have been right at the podium there. All of us would have been at the podium, correct? Because where we are is we are empowered, we are privileged. But those that we make the laws for are not as empowered. They are not as privileged. So sometimes it is very necessary to de-roll and come from who you are, regardless of your culture, regardless of your religion and other biases, and think about those that need assistance and those that need laws and what it means. So I liked what Honorable said, to say when we say leave no one behind, are we being rhetorical or do we actually mean that? Because if we mean that, then we put in place measures to ensure that no one is left behind. If there's a 10-kilometer stretch to walk and there are going to be lions on the way, I might not be bothered because I'm sitting in Gaborone and I'm thinking, okay, lions, that's not even a thing that's going to cross my mind. I am in Harare and I'm thinking, lions, that's not a thing. But I know there are areas in Zimbabwe as well where we have the same issue. We have wild animals that are roaming around. So when a law or policy that is made that is in the education sector, are there resources then that are also discussed, or budgeting that is discussed to make sure that we close those gaps? So when we speak of issues of sexual and reproductive health, budgeting, and policies and policy reform, when we speak of gender justice, gender equality, equity, these are some of the considerations or where you need to be to move yourselves from being the individual that you are and think about the end user of the policy. So when the policy is actually implemented now, or if it's a regional framework and it becomes domesticated, will it make a difference in the life of the 17-year-old who's somewhere at the border, right? The Honorable told us about being in the outskirts, 14-year-old, and you're right at the outskirts. At the border, you have no internet, no electricity. The nearest police post is maybe 30 kilometers away. So what do we do then to ensure that at the level of implementation or domestication, we get as low as the 14-year-old who's right at the border, who's right at the outskirts? So it's something to also think about. And the reason why we do this exercise is to get you out of your own role and to think about those that need or those that benefit from the policies or the laws that you put in place. So as a parliamentarian that is representing diverse constituents, these are some of the things to think about. Who needs the services? Maybe I might not believe in it because I'm Catholic, but I know there's someone in the community or a subpopulation in the community that needs this law, that needs funds to be channeled towards implementation of that law, that need for a miracle. I think there was an honorable that said, I'm waiting for a miracle. And that miracle might be policy action or legislative action from the parliamentarians or from parliament that then becomes the miracle that changes their life. So I'll move on to the next exercise. I think this will be the last exercise and then we'll wrap up the session. But I believe you have access to the PowerPoint presentations. So there are some that you can also reflect on. Honorable members, please, when you have time, please engage with the presentation. Sorry, Ronald, can I have the slides back? Thank you. So there's a piece of paper, honorable members. I believe every one of you received this. So if we could take just 5 minutes to go through the story. So if we could have one volunteer, so I'll ask for any volunteer in English, in French, or in Portuguese who would like to read the story of Dolly out loud. Yes, Honorable from Mauritius, please go ahead. Thank you.
That is Dolly's story. My name is Dolly. I'm intelligent and hardworking. I am the eldest daughter in my family and worked hard at home helping my mother when I was there. I love school though, and have always been one of the top girls in my class. I was proud when I won a scholarship to go to university, and my family and community were also very proud of me. It was my first time in a big city, and I found it difficult to make new friends. But slowly that changed, and I settled into my new environment. I continued to study diligently and worked hard to be sure I was always at the top of my class. My professors were very proud of me and took special interest in me. They encouraged me to pursue my professional dreams. After graduation, I joined a professional firm and sent money home to pay school fees for my younger brothers and sisters. I became the breadwinner for my extended family. I met and fell in love with a colleague at work, Richard. At first, Richard was gentle and loving, but gradually that began to change. He became distant and unkind to me. I soon discovered that Richard had another girlfriend. When I discovered this, I told Richard that our relationship was over. Richard became very angry and forced me to have sex even though he knew that I wasn't using contraception. As he pushed me out the door, he declared, "I know that when you become pregnant, you will return to me." About 3 months later, after feeling sick for quite a while, I went to a free clinic where I was shocked to discover that I was in fact pregnant. I had always had an irregular menstrual cycle and had never been taught the symptoms of pregnancy. I determined that there was no way I would go back to Richard. When I inquired at the clinic about terminating the pregnancy, the staff looked at me with disgust and refused to answer my questions. I went to another clinic to ask about terminating the pregnancy, but the midwife there turned me away also, saying she could not help because she did not have the equipment, and anyway, abortion was against the law. I felt afraid and was too ashamed to tell anyone in my family about the rape and pregnancy. I felt that no one would help me, and I became desperate. I tried drinking a toxic potion of household chemicals that I had heard from my friends would terminate a pregnancy. I began to feel sick with a terrible burning in my belly. The last thing I remember, I was lying face down on the floor in my vomit, in agony and moaning for help. I was too young to die.
Thank you, Honorable Member, for volunteering to read the story for us. How does this story make you feel, Honorable Members? How does this story make you feel? Yes, Honorable from Mauritius, then I see Honorable Karenyi. And yes, Honorable, please go ahead. Thank you.
Yes, somehow distraught and powerless as a female.
Thank you, Honorable. Yes, Honorable, please go ahead.
I feel sad, and as I was listening to the story, this is where I was saying to myself, that's the reason why we must advocate for safe abortion, because she ended up taking other measures, which was not even health for her, in as much as she was educated, but she was helpless.
Thank you very much, Honorable. And what new information did you learn from the story about early and unintended pregnancy, about abortion, maternal mortality, amongst other key sexual and reproductive health and rights issues? Yes, Honorable, please go ahead.
One of the lessons for me is that I represent a country where there is limited access to safe abortion. There is abortion with qualifications. Now, here's a case where abortion was clearly necessary. But in terms of the options available in my country, it would be the same conclusion.
Thank you very much for that, Honorable. And what choices, I think it goes back to the response that Honorable just gave now. What choices did Dolly have in this story? What choices did Dolly have? Yes, Honorable, please go ahead. And then Honorable.
She had a choice to report the case with the police.
Thank you, Honorable. Yes, Honorable, please. Okay. So Honorable Karenyi also had the same response. Yes, Honorable, please go ahead.
Yes, and also she had a chance to keep the pregnancy, especially because she's working in a law firm. She's okay. She does have an income to raise their child. So she had an option to keep the baby. Yeah.
Yes, Honorable, please go ahead. Honorable Chair.
I think maybe there is more information we don't know. She could have taken a morning after, just to make sure, because she was raped. She knew that somebody had violated her. She could possibly get pregnant. If at that particular time she afforded it, she could have taken it.
Thank you, Honorable. And in addition to Dolly, who else was affected by Dolly's death? So the rest of the family. So the rest of the family, we'll say pretty much her entire community, because it seems that she was quite active, supporting her siblings, but also the extended family as well. So that's such a huge impact and a huge loss. And has this story increased your empathy for people in Dolly's situation? And by people in Dolly's situation, I mean adolescent girls and young women. Has it at all increased your empathy towards them, or brought about a bit more understanding, of the realities or the issues that they actually face?
It's a constant reminder of what many women go through and why it is important, especially for those countries that use, whether it's religion or culture, as the reason not, to make abortion legal.
Thank
Yeah.
you, Honorable. Yes, Honorable.
Oh,
please.
thank you very much. I also feel that I think it is high time that we must invest more into education and awareness, especially for our young girls out there, even the boys, because yes, we talk about it, but we just need to budget in terms of monetary so that we go out there, give them knowledge and also equip them on the issue of HRS.
Thank you very much, Honorable. So this is just one exercise that we do as part of the VCAT session, right? To just reflect and share the lived realities. Dolly's story is not a new one. I'm sure we've seen press releases or we've seen articles in newspapers. Although sometimes they are not always focused on raising awareness and facts, they are sometimes sensational. But we've seen this where it happens, where girls die or young adolescent girls die, young women die, and it's reported. Or we know from the statistics, the presentation from Dr. Lamboli that was just showing the statistics. This is Dolly. And Dolly is not a standalone. Dolly is that 20% that he was mentioning, the 20% maternal mortality, that is Dolly and who Dolly is representing. So when it comes, so just to wrap up this session, when we talk about the VCAT, looking at it from the perspective of the SRHR policy and governance architecture within the SADC region, it's quite relevant, especially for you as honorable members, because the session enables us to understand why we believe what we believe. So the values that we hold dear to us. I think earlier when we started with the tree, we were talking about the religion, the culture or cultural influences, the socialization and understanding why you hold the views that you have today, but also the different experiences that then shaped those views or continue to shape those views. And what it does then is that it promotes ethical and reflective thinking. So thinking of yourself as a parliamentarian, I think it was the honorable member from South Africa that said, I might be Catholic and come from a bit conservative Christian denomination, but I understand that as a parliamentarian, I have a duty to go beyond my own personal religious beliefs and think about who in my constituency needs this policy or this law to be put in place. Who needs for us to talk about issues of budgeting and resourcing in parliament to ensure that that law then becomes a reality, it's implemented on the ground and it's not a white elephant that just then sits somewhere in where it's not being used. And when we look at the transformation, it's looking at some of the shifts in terms of the biases, the attitudes, and also being inclusive and look at evidence, the evidence that is on the ground and what we need to come up with evidence-based responses at legislative level. And then also looking at the regional national structures that guide SRHR laws, the budgets, the oversight, but also looking at parliamentarians being at the center of that. Parliamentarians shaping, monitoring, and then also resourcing sexual and reproductive health and rights related laws and policies. And then lastly, looking at the SADC region. So the reason why we're looking at diversity, because it's 16 diverse countries. We have shared commonalities, but we also have diversity within the 16 countries. We have shared norms, diverse cultures, but we have one thing in common. That is one vision for a SADC region that is progressive, that when we look at issues of sustainable development, we're looking at attaining sustainable development and maintaining it. So the word sustainable, ensuring that it's long lasting, that we do not regress when it comes to some of the development areas or the developmental outcomes within the region. And also building on accountability under the SADC Vision 2050, amongst other regional policy frameworks that are there as well. So this is also looking at the issues. So this is just a summary of the table that we had. But why VCAT matters mostly in governance, it's not seeking to change your beliefs, but it's seeking to promote the reflection on personal influence vis-a-vis the public responsibilities. So looking at what you've been entrusted with as a parliamentarian who's been voted by your respective constituents to represent their voices, to also represent their aspirations for health, for well-being, for equality, for equity, amongst other key issues, including issues of peace and security as well that we were raising earlier, including issues of addressing poverty and food insecurity, amongst other critical issues, and the interlinkages that are there when we look at issues of sexual and reproductive health and rights. But most importantly, it's looking at legislative justice, inclusivity, and accountability as honorable members of parliament. So that accountability that you represent those diverse constituents or the diverse identities that we had in the center, those are the ones that you are representing that will benefit from the laws and the policies that you put in place. And then just lastly, looking at the strengthening of the policy governance and architecture. So what we were already doing, the self-reflection, thinking about where some of those values come from, challenging the assumptions that we already hold, but also inspiring exploration of some of those entrenched norms. So looking beyond yourself and thinking of, besides my identity, besides my culture and my religion, what do I need to put in place? And then building empathy and understanding of the diverse lived realities, and then shifting perspectives and catalyzing transformation of attitudes so that we have inclusive policy development, we have enhanced oversight, we also have reduced stigma, but most importantly, advancements in rights and commitment that ensure the safeguarding of the health, of the dignity, the well-being, the present and the future of the SADC citizenry, especially the adolescent girls and young women, when we're speaking to some of the issues. So we'll not look at this exercise. I'll just move on to, sorry.
Charmaine, I think there is a recommendation on the table that we run for lunch.
Yeah.
The kitchen will likely close before we eat, and then we can come and finish when we come back. Yes.
Okay, that's all right. Thank you very much, Honorable Chair, and thank you very much, honorable members, for giving me your time, but also your engagement. That made the session because we're able to reflect and engage together. Thank you very much, honorable members.
You're still gonna finish when you come back, or do you think thank you very much, honorable members. I think we are quite late for our lunch break. Let us please rush for lunch. This is 1:45. How much time can we give them, Miss? An hour. So we are giving you an hour. We'll be back here at 2:45. Possibly to come and finish up the session, then we can wrap up and move to the next presentations. Thank you.
A1. One, two, 1, 2. Yeah. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Sound check. 1, 2, 1, 2. 1, 2. 1, 2.
Yeah, but he's late. I don't know if she and the guy can come. If it's the same. Yeah.
Because at that stage, there was a guy from Brazil, very young, was also LP.
We load it up. We load it up. Okay, so wait, just here.
That one is for next slide. You want to go back to the previous one? Yeah, it's fine.
Honorable members, could we please make it into to the room? Good afternoon again, once again, honorable members, our resource persons, our distinguished guests. Hope you had a very nutritious lunch. We are just a few miles to completing the marathon of the day. And I hope we can have your energy reserved, your attention reserved, such that we finish the remaining agenda items that we have today. Before we move on to the next session, honorable members, we left for lunch after such an interactive session, a session that calls for deep reflection from ourselves as members of parliament in terms of what our roles are and how do we actually handle them with the highest level of objectivity. If the words of leaving nobody behind truly technical team, I'm told that there is no translation. Would you kindly fix that, please? Do we have translation already? Okay, thank you very much. So I was really saying in short before we move on to the next presentation for the day, I really would want to appreciate Ms. Charmaine for the presentation and a mix of activities that she got us involved in, because I believe they were very critical in really reminding us about our roles as members of parliament and how our responsibilities go beyond our own preconceptions, go beyond our own opinions, because indeed our job is to represent the masses, is to represent the citizens of SADC, and in doing so, we need to try and make sure that we don't leave anybody behind. The exercise that we had here really emphasized how the different circumstances and different identities of people can be affected differently by a similar issue. We had members who were able to make it to the end. We had members who remained behind. And those that remained behind are your constituents. They are the very same people who voted for you. So this says we really need to reflect deeper as to how do we approach the lawmaking process as members of parliament. Is it about what I think as a member of parliament who is before the bill at that particular time? Or do I try to consolidate what I believe would be the needs of the people that I represent? This will help us to be able to come up with laws and policies that are equitable, that are inclusive, and that are free from bias. And this is what we are looking for when we talk about objective law-making process. Honorable members, without saying much, I would just urge that we take the lessons that we learned from that presentation. As we move on to the next presentation, it will be quite important to have them as part of our message moving forward. I now have an honor to introduce our next presenter, who is Honorable Yvonne Dauzeb, who is the former Minister of Justice and Member of Parliament. Honorable Dauzeb has also served as a chairperson of the Law Reform and Development Commission, and previously as the Deputy Dean of the Faculty of Law at the University of Namibia. She's a highly respectable legal scholar with a strong record of work and publications in the areas of access to justice, disability rights, children's rights, and constitutional law. Her leadership continues to inspire progressive legal and policy reform across the region. Today, Honorable Dauzeb will be presenting on critical topic, evidence frame on the impact of safe abortion on attaining sustainable health and socio-economic development outcomes, saving lives. Honorable members, please join me in warmly welcoming Honorable Yvonne Dauzeb to deliver her presentation. You're welcome. Thank you very much.
Thank you very much, Director of Proceedings. I want to acknowledge the presence of all the honorable members. I remember just until March this year, sitting in your position as a member of parliament and the Minister of Justice. So the environment is quite familiar with me, and I'm hoping that the conversation will ignite some spirited debate on the issues that I'll be sharing with you. I also want to acknowledge that all of the presentations that have taken place so far has an influence on what I'm going to be sharing and also what my dear sister will be sharing around this particular topic. So I want to start off with continuing with that reflection that we were talking about. If I may maybe have the mic, the roving mic, because I want to kind of see what's happening on the screen. One, two. And also I want to apologize for the way my hair looks. I've been laughing a lot earlier today, although I had combed it in the morning. This is the consequence of my heritage. Some of you may accept that. But not only why are we here, but let's really think about the importance of us sitting in this room right now. And I'm going to run through this presentation so that we get a little bit more time to have a discussion. So we are here because, firstly, SADC-PF has as its tutelage members of parliament as key stakeholders when it comes to legislative arm of the state organ. So I think sometimes as members of parliament, we forget how important we are in state governance. You know, you have the judiciary, you have the legislature, and you have the executive. So that's the first thing that we need to recognize. Secondly, members of parliament, at least from where I'm sitting, are the one body that has often in constitutional provisions have an indication that they represent the power of the people. They are the voice of the people. And if you are the voice of the people, there's an expectation that you are the champions for the people. And so for the moment, I really want us to forget a little bit about the act called abortion. Let's forget a little bit about that. Let's think about human beings. Let's think about our children, because some of us may have a story to tell about either a friend, a child that may have actually gone through an abortion. Let's think about the young adults. Let's think about persons with disabilities. And many of us may think, well, persons of disabilities are ordinarily already taken care of by some provisions of the legislation. But let's think about that. Let's think about the future potential that gets lost through what we would call infamously as backstreet abortions, as unsafe abortions. Just picture that for a moment. And I particularly like Shmaine's presentation because it was helping us think about the reality that we are coming here to discuss. We are not talking about a law. We are talking about the lives of people. Picture that for a moment. But what does our socioeconomic realities tell us? The rape of our daughters by their fathers is a conversation that's picking up in many of our jurisdictions. Incest is a real problem from the jurisdiction that I come from. Many of you may be able to tell a story about that. gender and sexual violence in peacetime and in conflict. We have harrowing stories about sexual violence in Sudan, for example, where there is a very serious conflict happening. What should happen when the religion and so forth is subjecting those women to a life of shame? Should we be leaving them to live that life of shame when they've already been subjected to rape and will continue to carry the brunt? There are so many examples, and I want the honorable members to think about that. We must also remember that when we talk about a model law, firstly, it's not the first time that it happens at this level. A decision was already taken elsewhere. But what we need to recognize as members of parliament is often model laws are interrelated and linked to existing continental and regional state commitments. So it's not something that I think sometimes may happen, like maybe SADC-PF wants to look good on paper and therefore they're introducing a model law. I couldn't now see. Sorry. There is apologies. Just that last one that I can't see is that SADC has a collective vision. What is SADC's collective vision? That vision is health, justice, freedom, and autonomy. And we need to interpret that vision, those principles, for the benefit of the people. And then lastly, on the slide, is we need to think about when we return home, because it's quite nice to sit here, honorable members, and hear these beautiful words and learn this incredible and have this incredible information. But what do we do with it after we have gotten on the plane to return home? And it is that part that we're going to be talking about a little bit more later on. So I want us to really visualize and think about why we are sitting in this room. Do we understand that our sitting in this room is a privilege, and an important privilege for that matter? So we understand, I certainly do, and I think when the previous speakers on the scorecard, on the values, when they were talking about it, they also understood that we are coming from, and we want to recognize that all of us are coming from different party political persuasions. We recognize that. We recognize that there is for, there is against, there is in between. There are party political manifestos. There are policy positions of particular political parties. We recognize that. We know that exists for you in your mind. We also know that you have some personal, cultural, and religious views on the topic. And this is why I thought it was important that my presentation happens neatly just after Charmaine's one that dealt with the issue around values, because it gives us an opportunity to really start thinking about, as a member of parliament, I may have these strong views, but should they override the general public interest that I sit here to represent? We also know that there are national policy positions on these issues, on abortion, on termination of pregnancy. Each country has its own unique position on this particular issue. We also know that universal health coverage is a thing. We know that health gets the bigger budget in any jurisdiction. I'm not aware, and we are happy to learn from you to know that there may be a country where health does not get as much as it should, and how others do it. But does that mean that if health gets the budget that it gets, are we seeing the impact of that budget on the way we deal with issues pertaining to termination of pregnancy, for example. There are national priorities. Each country has national priorities. We are aware of it. There are questions around service delivery. What is at the top? Is this issue something that we should put at the top? Is it something that should be removed or disaggregated from other health needs that we have in the country? These are the questions that we should be asking ourselves. We also know that you're sitting here with your constitutional precepts in your own country. What we are hoping, honorable members, what we are hoping is that at the end of today and at the end of your time in Johannesburg, we can have some shifts. I believe there were some shifts that started happening during the previous conversations. I'm sure there are some shifts that started happening. If I just remember from my honorable member, sister from Eswatini, who said, as the scorecard, we want to take it back to our countries and remind the executive, if we must, because we have an oversight function, to remind them that why are we behind Namibia on this particular issue of maternal mortality, for example. We need to do something about it. So I believe that these conversations are already starting to have us think about things differently, and that is what we are hoping to see. So I think apart from the legal questions, because as lawmakers, that's what we're thinking about, but let's look at the question of safe abortion as a public health intervention. Because what does it do? Well, it reduces preventable morbidity and mortality. It protects households from catastrophic costs. We don't realize just what a huge impact, because it's a sudden cost. Many of us may not know what our young people, young adults are doing outside of home. But that, the impact of their decisions, for example, to have an unsafe abortion, will come back to us, because we are the families, we are the parents. If our child is not well, that will have an impact on our household income. It strengthens health systems quality. If we focus on how can we improve our health infrastructure, for example, perhaps to get the latest, whether it's medicinal facilities or health facilities, so that we can deal with the emergencies associated with unsafe abortions, that could improve overall. Because it doesn't, when you walk into a health facility, it doesn't say that this is simply for people who have committed or have done abortions, in the back street, because they don't have the safety of coming. And I'm sorry for using backstreet, because I think it also has a negative connotation, but just to say unsafe abortions. But what we know for sure, that we have seen from the evidence, partly will be reflected in our position paper and other documents that we'll share with the honorable members, is that incidents are driven far more by unintended pregnancy rather than by legal status. That's an established fact. And we hope that this discussion will ignite a little bit more for us to see how that works. So what should be our shared outcomes? Our purpose and our shared outcomes, what we want is to save lives. What we want is to prevent injury. What we want is to protect family finances. What we want is to strengthen services related to health, gender equality, reduced inequality, economic growth, consistent with our various promises, not only in the SDGs that we have. We want to see quality care for everyone, regardless of the choices that they make in life. We want to see zero coercion. Many of us may know that oftentimes third parties, our parents, our pastors, and so forth, have influences about the decisions that we take around our bodies. So we hope that what we want to see, and we've continued to see it, is to implement our commitments under the various protocols, international, regional, national, sub-regional that we have signed, we want to see that there is some improvement even on the milestones in the scorecard. I think generally, and I will not go into too much detail here because I think there will be sufficient, hopefully, Charmaine, there will be some sufficient information shared with the honorable members that would define some of this. But I think we all want to know what is a safe abortion, what is unsafe, what is less safe. We want to define that and understand the scope. We want to understand what is abortion, what is post-abortion care, medical versus surgical abortion. There are developments elsewhere. Even if we restrict access to safe abortions for our people, elsewhere people have access to medical abortion, where they get a decent tablet that would expel, under safe conditions. And then there's, of course, surgical abortion. And then grounds versus access. I think many of our jurisdictions, including my own, has limited restrictive abortion legislation, and that says only if you are in this particular category will we be able to allow you to have or permit abortions. But what we would like to see is what South Africa and in some instances other jurisdictions have done is to allow for abortion and make it accessible. And then there's, of course, there's aspects of induced versus spontaneous abortion. So that's just your definitional framework. But what does the evidence show us? And here I'm just dealing with some broad principles that show us what the evidence says. So we may not always agree from various perspectives, but what the evidence shows us is that on safety and mortality, safe abortion has very low mortality rates, whereas unsafe care drives a measurable share of maternal deaths. That's the evidence. The evidence shows us on law incidents, restrictive laws don't reliably lower abortion rates. Instead, it shifts women towards unsafe methods and delays care. We also know that the evidence shows us that then delays drive harm. Barriers such as waiting periods, like we've seen in some jurisdictions, stigma, cost of travel to health facilities, once those procedures are pushed back, you are likely to have a higher risk, and you'd have higher costs associated with it. The economic impact, we may not see it directly because we think this is an individual matter, but typically the impact on the economy is treating complications is costlier to the state than providing safe early care household, and household would face high spending and income loss. That's the impact, because if you are spending money on assisting a young lady from recovering after she had done an unsafe abortion, you are spending money on that activity instead of spending your money on something else. Equity. I think we've talked quite a bit about equity, and I think the exercise of Charmaine was also starting to show us that, is that adolescents, and I know that some of the work that we've seen has focused on young women specifically. It doesn't mean that we don't have challenges around older women. And when we get into the discussion, I have one or two examples that I would like to share and hear your views on. Rural women, the poor, there's a disproportionate harm from unsafe or late care and from forced continuation of unintended pregnancy. There is no benefit in forcing someone that feels at that particular time for various factors, because it matters what people go through and what the circumstances are that they are subjected to before they get to that point. But there are also system enablers, task sharing, availability of abortion medicines. It has now been shown that abortion medicines have an 85% success rate. But it's important for us to create what we call confidential pathways. People want to know, when I come to a public health facility particularly, I want to know that my information is safe, that whoever I'm sharing that information with is not going to take it outside, because the moment people don't feel safe and they don't trust the system, they will not participate in the system, and they will go elsewhere to get the benefit that they would otherwise would have been entitled to get through the public health system. Post-abortion care, extremely important, because people want to know not only before what kind of information is provided. I need to know everything as a young woman. When I'm sitting in front of someone, a healthcare worker, I want to understand everything before the decision, before I make that decision about terminating a pregnancy. Contraception synergy, again, it's not the one or the other. These two, whether it is termination of pregnancy or whether it is that I have access to contraceptives, it's important that I know that these two work together. Both are needed. So not just contraception alone, because it will not necessarily eliminate the demand. I'm almost done on the evidence. But again, just the regional lens, and I think that's why we are here. I will not focus too much on that, because I think our Secretary General is very good at explaining the importance of the model laws that we are proposing. It's something that you can benefit from because you have quick access to it. But this, when you have this kind of interaction between various countries, there is also an opportunity for sharing resources, sharing some lessons, some new learnings, new ways of doing things. Then last one that I want to talk about, and there's also health systems and cost impact. I think that we can talk about a little bit later, but service delivery and what works is important. It's important that various actors in that space are sharing, particularly task sharing, particularly between your mid-level providers. And then there has to be a clear medical abortion supply chain, confidentiality, stigma reduction, telehealth where lawful. I put that in there because in Namibia, we have a very dynamic young Minister of Health. And I think she came also at the back of having done some digital work. And there is a conversation growing in our jurisdiction, and I'm sure we will hear stories about similar activities in your regions or in your jurisdictions, is where we are able to, so somebody doesn't have to go to the physical building called a hospital, that you can have at least some preliminary access through not social media, but digital platforms that are created by the hospital. So where it's lawful, this may be a game changer for many of us. I think rights and legal design, again, how you frame, and this is where your model law would be very, very helpful, is what kind of language and text are you putting in your law, so that helps with deciding how you're going to proceed with your legal text. Sorry, there's a thing about these digital platforms. I feel, SG, that I'm being sabotaged because honorable members are tired and okay. Just to say two things. How specific provisions are written is important. South Africa is a good example about your gestational limits. You know, in South Africa, you have up to 12 weeks. You can walk in and you don't have to explain why you want to terminate your pregnancy. Between 13 to 20, there are some conditions, and after 20, it has to be an emergency. So it's important for us to understand that that would be something that you want to be clear about in your law. Emergency exceptions, what would make us have a termination of pregnancy at a particular time, co-management of privacy between the person that wants to terminate pregnancy and health workers. What does that relationship look like would be important. Some of these, once it's clear in the way you've provided for in the law, are real game changers. Case notes, we've seen that countries that has liberalized saw sharp declines in deaths and complications. A good example is South Africa. And then consensus and safeguards, I think we need to, when you talk about safe abortion, you need to do the entire thing. It must be a wholesome look at quality of standards, data transparency, provider training, referral duties, and respectful care, because it's all of that that is within the ambit of what we would like to see from a human rights perspective. Best practices, we've seen South Africa, Mozambique, and Zambia in various formations are used as good places to learn from. But what downplays some of this evidence? What we have seen, and it's often weak, it's contested, it's polarized, but what we have seen is myths such as abortion causes breast cancer, infidelity, major mental illness, often not supported by high quality evidence. We've also seen selective anecdotes, single cases presented as a trend. We've seen ecological fallacies. If one person in a particular community or if a number of people in a particular community have had incidents of either infanticide or abortion, then that particular community is labeled. That's your ecological fallacies. And then also when moral or philosophical absolutes are framed as data. And I think we've started to see some of that play out this morning. But what is interesting, and I'm using the Namibian example here, is that sometimes there's an overestimation of the number of pro-life groups. For example, in 1999, one of our Namibian ministers, she's retired now, dropped an abortion bill because 99% of the population was against it. 99%. And yet there were so many institutions, women's groups that were in support of choice, but that kind of information leads to, people not wanting to support it. Or, references to if we are going to have an abortion law that is liberal enough to allow for people to, at certain times, walk in and get it on demand, you would have references like, will become a Sodom and Gomorrah, or references to school closures. I know my brother from Namibia earlier on said we are only 3 million. And if we are going to allow safe abortions, it means that we are reducing our people or that there will be no children. So someone actually said schools will close. There'll be no children to go to school if we allow for safe abortions in our country. So it's important, or even things like women will lose their value, nobody will marry them, and so forth. I know thousands of women, for example, that have, because it's a private matter, have gone through an abortion, are happily married, are having children today, and so forth. So it's important that we guard against these kinds of anecdotes and evidence that wants to downplay hard evidence that exists. There is the mixed bag, obviously. Just want to raise the issue of conscientious objections. It's okay for people to say, and there should be provision in the law for that. It's okay for someone to say, I'm not comfortable as a health worker or as any professional to say, I do not believe that this is something that I can support. Even members of parliament in the Namibian constitution, and members of parliament have a constitutional right to say, my conscience does not allow me to participate in this particular debate. But we must not kill the debate because we don't want to be part of it. We must allow those that believe in that for the better of everyone else to continue the debate in good conscience. But also, if a health worker is uncomfortable with proceeding with issues related to abortion or termination of pregnancy in the manner that we envisage it under this model law, then they must have an obligation to refer the person to a person that would otherwise assist them. So it's important that when some, conscientious objection will become a problem if it becomes a barrier. And so it will become harmful if it becomes a barrier. That's your mix. But our language, what should our language and our awareness be? And I'm almost done, honorable members. Remember our shared goals above? We know now what our shared goal is. But let's look at our language. If use of safe or abortion is not comfortable, we should be happy to say, as honorable members, we think we should say pregnancy-related mortality or timely access, whatever it is that we think is comfortable for us. Simply, but the point is we should not let our people suffer because we don't like the language that is being used. Propose new terminology that you think would still do the job. Implementation, a stronger case for parliamentary involvement. I know that sometimes when we come to these platforms, we are often asking ourselves, okay, what should I be doing beyond this? Some of us are sitting here asking, but what is the process? After I've come here and I go back, what am I supposed to do with this information? So remember, our first principle when it comes to implementation is rights require remedies. That's, we cannot have rights if there is no remedy. We cannot have a right if there is no obligation. Then second is states are primary duty bearers. And so the obligation to safeguard health, ensure dignity and non-discrimination is on the state. As an oversight body, we have a responsibility to remind the state that you have a responsibility to protect. The state has an obligation to meet its obligations under international law, under regional law, and under national law, because we have constitutions. But the third principle, this is where you apply, where you fit, is MPs as legislators have a role in lawmaking, oversight, and people's representation. You must use that power, honorable members. You are a powerful organ. Use that power to find a way to harness increased political will for human rights protection, establish and inquire about coherent and coordinating pathways for implementation. So in retrospect, unsafe abortion is a preventable cause of maternal harm. Restrictive laws don't stop abortion, they increase risk. Earlier, safer care saves lives and money. The most affected are adolescents, rural, and the poor women. Some practical fixes, task sharing, reliable medicines, PAC everywhere. In other words, aftercare, respectful care, and contraceptions are immediate lifesavers. Call to action, supply chain reliability, and let's look at how the technological space can enhance protection of our women and girls. So I pause here, the chair, and I want us to think about some of these questions and or any other questions that you may have related to my presentations. Thank you very much.
Thank you very much, Honorable Yvonne, for such a presentation. It's a perfect connection with what we discussed before lunch. And if you look at it, you'll realize that the presentations are very interconnected from beginning, and what we are receiving now is building up onto what we have been discussing all day. For that, I really thank the Secretariat for really having organized resource persons that are able to capacitate us in these crucial topics. At this point in time, honorable members, unless there are any reactions from you, honorable members, I'm going to pass on to the next. I'm not even sure I'm allowed to provide time for reactions from members, given our time. Okay, honorable members. So I'm being told that I indeed can give some bit of time for your reactions from the floor, but also remembering the fact that the presentation that was made by Honorable Yvonne was more of the presentation of the position paper, policy position paper that I believe honorable members may have received. If that's not the case, I hope the Secretariat will help us with that. But right now, we really want you to speak about, do you really see the intersectionality between the position paper, the topic that we are discussing today about safe abortions? What are some of your views around this? And honorable members, let's try not to make it too long. We are already behind time based on how we proceeded today. So if really you have that strong feeling that you would want to speak before we move on to the next presentation, kindly do so. But if you feel like you can be able to intervene after the presentation, also kindly do us a favor of reserving your comments for that particular presentation. May I see hands that really, truly want to intervene? I see honorable member from Eswatini, and lucky enough, that's the only that's the only member who wants to say something now. The floor is yours, honorable, and Madam Yvonne will be listening for your intervention. Thank you.
Thank you very much, Mr. Moderator, and thanks to the presenter for that insightful presentation. One or two questions. I have no doubt that what he has just presented is linkages and correlation to the previous presentation, particularly so far as it affects the SRH aspect. So it's flowing nicely. That I must applaud. Seems abortion not being mentioned just willy-nilly or in bad faith, but to ensure that our SRH project or perspective is properly implemented. It's a pity, like the colleague from Eswatini did indicate, maybe we would benefit better, and we can still benefit better if those that have best practices could share. For instance, not in a bad way, but I'm just quoting South Africa. In the good old days, there used to be the common law abortion. Now, with the advent of this law on SRHR, what is the position now with the old abortion? I know that might be very unfair to you, but maybe the South Africans who are here, that they might be able to shed some light. But what is more critical to me is that you have indicated that where there are, and I underline the word restrictive laws, evidence has it that mortality rates are not reduced. Hey, I don't like that. What is the problem, real? They are not reduced. Instead, they are driving women to unsafe methods of abortion, meaning they go into the bush or what, go to unlicensed clinics or what? What does it mean, really? I'm not very sure here. I'm saying this from the perspective in Eswatini. We have a law. It is in the Constitution. It is also in the Health Act. It does give a way of how you would go up. In other words, it is recognized that there will be such cases, but you go under strict conditions before. You cannot just wake up somewhere, hey, I have an unwanted pregnancy. I'm now going straight to a clinic, because we don't want to open floodgates for illegal fake clinics. What would be your comment on that? Thank you.
Mike can't turn on. My mic can't turn on.
Hello.
Seems like, yeah, we'll use this one in the meantime. Honorable Yvonne, the comment is there. Kindly quickly react to it so that we can then move on to the next session.
Thank you very much, Honorable Member. And I will not be long, because I think this is the crux of our conversation in this room today. And hopefully, when we get to the position paper and we continue the conversation, some of this will come out. But what I can tell you from even just our example as Namibia is, because you have a prohibition or a restriction on abortion or termination of pregnancy, what typically happens is that our jurisdictions don't have accurate data on the number of persons that come to public health facilities for assistance. So once a unsafe abortion has taken place, and you're absolutely right, it's called an unsafe abortion or termination of pregnancy, because it happens in an environment where sometimes people with scrupulous intent, some of it criminal, would take money from these vulnerable young women and give them something that would otherwise not have been tested by a health facility. The second thing that happens, and this again is, we have many examples of young women who get involved with married men. We've seen incidents where these anecdotes are shared with us about, these individuals giving money to those women, and they go behind the street and they have an abortion. What this tells us is that we have a challenge with individual countries' information pertaining to abortions. I think it's easier for countries, and I actually wanted Charmaine to maybe make some additions here, because we talked about this yesterday, is that when it happens that countries' laws are restrictive or prohibitive, typically the people that walk in, or the person that walks into a public health facility, and people there would actually see that this could have been a termination or an attempt at the termination of a pregnancy. They would know, but no one can talk about it because it is against the law. By analogy, it's a problem that we've always had with sodomy and distributing condoms in hospitals. It's a similar scenario that we find ourselves. So my own view is, and I want to pause here because I think there's opportunity when we have the position paper to stretch this conversation a little bit, because we want to understand, does it mean if we are advocating for safe abortions, does it mean that we are promoting people promiscuity, for example? And so I think there is great opportunity in us seeing this as a platform where we can dissect, we can find, is there a way that we can find to get information about this? But we can get that information, honorable member, if those of us who are in this room are going back to our jurisdictions and saying our girls are dying. Let's do something about this. We think that is one way. There are other ways that we can solve this issue, but starting with a model law could just be the answer that many of our jurisdictions are sitting with. Thank you. I don't know whether Shemaine.
Yes, Shamin and Director, you can put in a few remarks.
Thank you. You're welcome to call me Rosé. Thank you, Honorable former Minister and Honorable Babe from the Kingdom of Eswatini. I wanted to share a little bit of, and this is from a medical professional. I'm speaking from not as SAFAIDS, not as civil society, but from my previous life as a medical practitioner. One of the procedures, and there could be other medical practitioners in the room, one of the procedures amongst the many procedures in medicine that is the most traumatic psychologically, mentally, emotionally, is accessing abortion. And there is a lot of evidence for a very long time, actually, I would say decades long. And there is also evidence that the abuse of accessing that procedure is quite minimal. In the regular population, of course, 1 or 2 humans may choose and, may not find it traumatic and may choose to do so. But in the broader population, and this is global, not just within our African continent, but it is global. So I thought I would just share that, that it is quite well documented that that procedure itself, it does not matter what the characteristic of the woman or the adolescent girl is. Is this someone who engages in transactional sex? Is this someone who was raped? All the judgment that could be there, whether they were innocent in it or they were careless. Either way, the constant evidence has been that it is very traumatic, emotionally and mentally. So that has correlated with a reduction to a degree in the risk of it being abused, unlike certain other procedures or even medication. If you legalize marijuana, for example, or emergency pill, things like that, they could be an abuse. But with abortion, it's painful. It's very, very emotionally and psychologically painful. Nyabonga, Kialabwa.
Thank you very much, Rosé, for that last statement.
Thank you very much, Honorable Chair. I think maybe just to add briefly, is that usually within the confines of law, where you see the law is a bit liberal or least restrictive, there is a whole process that is involved, a whole system of counseling, of psychosocial support. There's also linkages to contraceptives where the repeat is not likely going to be there because all of these things are done. There's a mitigation for repeat termination of pregnancy. Whereas with the unsafe or the clandestine operations where now a lot of adolescent girls and young women are being forced to go to, there isn't any of this. So you find that the chances of putting yourself at risk is actually more with the unsafe methods. And then what was listed by Honorable Yvonne to say that there's a repeat, it doesn't stop it, it just makes it unsafe, is that when they make that decision, I think because of a whole lot of issues that she was listing, that they'll still carry on with the decision. And we've had, unfortunately, people that have seen that as a way of abusing that loophole where they're there to make an income from that, but compromising the health and the well-being of adolescent girls and young women. And the evidence shows us that almost all of these deaths, over 95%, are easily preventable. The morbidity that is a result of this is easily preventable if it's safe and legal. Thank you.
Thank you very much, Charmaine, for that. Really, I think the statement that Rose said at the end, that abortion is not fun. It will not suddenly be something that every woman would want to do just because it recently became legalized. These are some of the things we need to be thinking about as we speak about this. It's not just a luxury thing that we say, oh, let's just go do it, it's legalized. It's a very difficult and painful experience, as she says, and nobody would just want to get into that. They have to, because they're in desperate situations, they are vulnerable, they just can't live with the circumstance that they are pregnant and they don't want that pregnancy. So we really need to also remind ourselves, honorable members, that as we speak about these sensitive issues, we are not the first people to have these kind of conversations, but we are likely to be the ones who come with the breakthrough. We are likely to be the ones who end it all in a very just and dignified manner. If we look at the Maputo Protocol, Article 14 of it, it talks about, the sexual and reproductive rights of women, indicating that they have a right to choose their own method of contraception. And if we are not going to consider safe abortion to be another method of contraception, then what is it? Yeah, we can define very different methods of contraception, the loops and everything. What do they do to stop the pregnancy from happening? How fundamentally different are they from somebody who realizes I'm pregnant, I'm 2 weeks, and goes to the hospital and requests to terminate? So we are not reinventing the wheel. We are not coming up with new concepts or new things that have never been discussed. There are even other legal frameworks or instruments that have actually established that people do have a right to consider how they would want to live their lives. So it is our choice as members to say, are we on the side of the law, or are we just here to make life difficult for the citizens we represent? So now, members, just by saying this, I'm going to move on. We have had a great presentation from our resource person. Now we are moving next to presenting our distinguished presenter. We have Ms. Azurina Muvutse. And I'll apologize for not maybe pronouncing it right. She's a highly accomplished legal practitioner and governance specialist. She's a registered member of Law Society of Zimbabwe and currently serves as the Deputy Director in the Parliament of Zimbabwe. She brings over a decade of extensive experience in legislative drafting, legal advisory, litigation management, governance, and public sector leadership. Her academic credentials include a master's in business administration from the University of Science and Technology in Zimbabwe, and a bachelor's of law from University of Venda, South Africa. She has also completed a diploma in legislative drafting from the Zambia Institute of Legal Education and a certificate in advanced legal drafting from the Institute of Chartered secretaries and administrators in Tanzania. Ms. Mfutse is a seasoned legislative drafter and governance expert with proven expertise in crafting model laws, bills, statutory instruments, and broader legislative frameworks. Her work spans the parliament, regulatory bodies, and the private sector, where she has consistently championed legal frameworks and upheld institutional integrity, transparency, and stakeholder collaboration. Today, Ms. Mfutse will present the policy position paper on the SADC model law on safe abortion, sharing her insights on the legislative framework and its implications for advancing sexual and reproductive health and rights across the region. Ms. Mfutse, we welcome you. Thank you very much. I'm just informed that I should invite, what's the name? Oh, Mr. Kurasha. Seems like there is some bridging that he needs to do between the presentations. So kindly allow him to address us in a bit, and then we'll have you come through.
Thank you, Chair, for your kindness and generosity. May I request to be able to share, which means dropping off the presentation that's currently. Thank you very much. Thank you very much. So my job today is for those who read the Bible. I'm like the John the Baptist, who is a forerunner for Jesus. So before Ms. Mfutse makes a presentation, I've been requested to beat the SADC PF's drum on behalf of all of us in terms of the history and the work that we have done leading to where we are when we are talking about the issue of safe termination of pregnancies, issues of safe abortion. May I find out from the honorable members, I know for sure Honorable Sebastião will be covered under this one. Who amongst you was with SADC PF in 2017? Can you show by raising your hands? The general was already there, I know for sure. But who else amongst the members was with SADC PF in 2017? That's interesting. And the way members are engaged with a subject matter that predates them also speaks to the effort that you're putting in engaging with the issues. Because often we have seen that as democracy takes effect and new members come in, sometimes we lose momentum with issues. And that speaks to what my presentation is going to focus on. I've prepared 9 slides, but I'll speak to only 3 of the slides. The rest you'll be able to see when the presentation is shared in the groups. So what I seek to do is to be the bridge in terms of just giving a perspective of how far we have come with the advocates for safe abortion and some of the efforts that the seminal efforts that have been made by SADC PF along the way, particularly in 2017, and I'll speak about the specific incident. So I will not go into details of the context and the history because, first of all, that's what we have been looking at, and also the person I'm running for would be able to sufficiently deal with that. But maybe what I wanted to focus on in terms of what has prompted the work that we're doing as we move towards the development of the model law on safer abortion. And I'm doing this so that, honorable members, you are clear in terms of where we are, in terms of context, but more importantly, in terms of process. Remember, the model law making process is a clearly defined process that SADC-PF follows through. So we're clear that amongst the many things that we're dealing with when we are looking at efforts towards the model law on safer abortion, we are addressing of issues of lack of clarity in terms of the laws, where there is unclear laws, when there is issues of inadequate services, there are issues related to stigma, but also issues related to limited information. And along the way, and this is really where I want to speak to, because it speaks to some of the critical parliamentary interventions that we have seen SADC-PF leading. In 2017, there was a parliamentary gathering of women parliamentarians of the SADC Parliamentary Forum. This was the first time for honorable members that may be new to SADC-PF. The Regional Women's Parliamentary Caucus was not always made up of all women parliamentarians of SADC-PF. In the past, it was a grouping of only the chairpersons of national caucuses. When we amended the constitution through a repeal in 2013, when we were consolidating what we call operating like a parliament, building the infrastructure towards the SADC regional parliament, one of the things that actually came out of that process was to broaden the membership of the Regional Women's Parliamentary Caucus to bring all women parliamentarians of the SADC region. And one of the first things that the Regional Women's Parliamentary Caucus achieved was a convening which they came up with a resolution that was called the Maher Declaration. The Maher Declaration was convened, was born out of a gathering that happened ahead of the 41st Plenary Assembly. When we go to Durban in December, we are going for the 58th Plenary Assembly. So during the 41st Plenary Assembly, that's when the Regional Women's Parliamentary Caucus adopted the Maher Declaration. And this declaration had 4 things that are important that we must remember as we contextualize the position paper that the council will be presenting on. So the first was that there was actually a declaration which was adopted by the 41st Plenary Assembly, where they were clear to say we are adopting a stand when it comes to safe abortion, including the need for a model law. So there was the issues of decriminalization that were contained in the declaration. There were issues of the need for a model law to be able to bridge the legal gap, which I alluded to earlier on, and also the need for harmonization. So since 2017, we have continued on that journey because of the clarity and leadership provided by the Regional Women's Parliamentary Caucus through the Maher Declaration. And for honorable members who have been long enough with the SADC Parliamentary Forum, we will speak to the issue of our model law making process. But maybe before I do that, another important aspect that you see in the Maher Declaration was it makes it explicitly clear that the issues of safe abortion must be addressed from a rights-based approach. The other important aspect is the issue of addressing stigma that surrounds the issue of abortion and reproductive health. Then also expansion of access to services. And lastly, the issue of respecting bodily autonomy. Right. And then we also see during the same period, at continental level, the African Union adopting a campaign on unsafe abortion and called on member states to remove legal and police barriers to access to safe abortion. We also see efforts by civil society organizations including aiding to the board of evidence that confirm in essence what we have been talking about this morning, where we say that there is evidence that criminalization does not reduce abortion, but it only renders women more vulnerable, young girls and children in instances where we have seen children falling pregnant, becoming more vulnerable. So when this has happened, the work that SADC PF has been doing leading up to where we are must be understood within the context of my last slide, which is the overview of the SADC PF model lawmaking process. And I would invite honorable members to appreciate where we are in terms of the process when we are presenting the policy position paper, so that we understand and appreciate what are the next critical steps that we are going to be following until we adopt the model law. So, honorable members, for your benefit, the model law making process is much more complex than what we try to reduce it to for purposes of simplifying for understanding. We have said the model law making process can be summarized as constituted of 4 processes. The first one is the initiation, where typically in your standing committees, because this is where you're dealing with thematic issues, evidence comes to the fore that there are legal gaps, and we need to do something to address those gaps until you convince the plenary assembly through your reports, which then are adopted by the plenary to become a resolution. And we are past that stage with the model law on safe abortion. Then we go into the drafting stage. The drafting stage is where we are doing further research. It has happened in SADC PF that sometimes after a model law has been motivated, further evidence shows that the gaps are not necessarily in terms of the law. It's sometimes they are elsewhere. We did this with the model law on the digital economy, where we wanted to do a model law until it was reduced to guidelines, because evidence is pointing out that we have sufficient laws. Maybe what we need to do is to accelerate action. And so we do further research through the policy paper. In other words, the policy paper seeks to reconfirm that indeed, based on evidence, the model law is still relevant. So the model law is constituted of what I call 3 wives and a husband. The wives are, we are reaffirming the question of what, that's the first wife. What exactly is the model law about? We are dealing with the question of why. Why do we need the model law? What is it seeking to address? It also, in some respect, deals with the question of who, in terms of the different role players that must contribute to the development of that model law. And then the husband, the how part. Part of these steps we are following are the husbands. And we are at this stage now where we are dealing with the wives, and hence we are going to be considering the contents of the position paper as part of the drafting process, where we are looking at the research. It will also include elements of consultations. What we're doing right now, we are validating the position paper as part of the drafting process. And then we will then go into the drafting of the actual text, which takes us to the next stage. So this is, in essence, the focus of my presentation as I usher in the lady whose shoes I'm unfit to untie. As the John Baptist said, he said, the one whom I am a forerunner, I am unfit to untie his shoes. So I wish to then, through the chair's indulgence, hand over to our presenter to then proceed, having laid the ground of the background leading to the policy-based position paper. Thank you very much.
Good afternoon, honorable members, our esteemed SG colleagues. Allow me to write on the protocols already observed. So my task today is to unpack the police position paper on SADC model laws on safe abortion. So today, as a self-proclaimed medical doctor, you know, there's a myth that there's a common myth that it is very hard to focus after eating, but I violently disagree with that. In fact, I think it's a blessing that our minds are no longer preoccupied with what we are going to have in terms of lunch, and we can now dive into the important discussions ahead. So let's get started. Also to acknowledge my senior counsel, Dr. Kurasha, thank you very much for bridging the gap. So obviously, building on the insightful contributions shared by previous presenters, it is clear that the conversation around sexual and reproductive health and rights in the SADC region is both urgent and multi-layered. The health dimensions outlined, including pre-activities we did with Charmaine, the so touching story about Dolly, as we continue this dialogue, my presentation will focus on the strategic role of harmonized legal frameworks and the importance of rights-based legislative reform, particularly through the lens of the police position paper to address the persistent gaps and challenges that have been so eloquently highlighted. Honorable members, like already been alluded to by Doc Kurasha, it is clear that this position paper is not a new proposal. The Maya Declaration of 2017 laid the foundation for a model law on safe abortion, beckoning a regional commitment to advancing reproductive rights and health. Today, as new voices join this ongoing journey, we gather not to revisit the past, but to reaffirm our shared responsibility in continuing the struggle for dignity, equity, and access. This position paper offers a framework for reflection and dialogue, one that honors previous efforts while inviting renewed engagement toward a harmonized rights-based response. So the screen is not shared. ICT, do you have ICT? Please assist me because I shared it on your screen. Oh, I can't see. Okay. It's me. Where am I now?
Is this okay?
What slide is it?
Hmm?
Is it now slide 5?
Won't be the same. It's not the same as this one.
It's okay.
Sorry about that. I've got a disability. I'm not an IT person. I'm still learning. So as we continue, however, before any drafting process could begin, it was agreed that there must be a clear understanding of whether such a model law is truly needed across SADC member states. Hence, this position paper, a document that presents the current realities, challenges, and opportunities surrounding abortion in our region. In simple terms, a policy position paper is a tool that helps us reflect on a problem, examine the evidence, and guide our collective thinking on the way forward. So here we just tried to define the policy position paper that I'm unpacking. So as we proceed with this presentation, honorable members, you will see what is contained in the position paper and why it lays a strong foundation for future legal and policy reform that responds to the lived realities of our people, and also why it lays the groundwork for a harmonized rights-based response to unsafe abortion in our region. So also as a way of introduction, across the SADC region, the urgent need to address unsafe abortion has become increasingly evident both as a public health imperative and a human rights concern. The lived realities of adolescent girls and young women, compounded by restrictive laws, procedural barriers, and social cultural resistance, demand a transformative response. This position paper explores a pathway forward, one that is bold, harmonized, and rooted in rights. Drawing from SADC's legacy of using model laws to foster regional coherence and reform, it engages with values of dignity, equity, and Ubuntu to envision a future where access to safe abortion is not a privilege, but a protected right. What that future looks like and how it can be realized will be reviewed in the concluding section. So current landscape. So as highlighted in the position paper on safe abortion, understanding the current legal and policy environment across SADC member states, it is a critical first step. So it allows us to identify existing gaps, inconsistencies, and areas of divergence that hinder access to safe abortion services. By making these realities, the position paper provides a solid evidence based and strategic insights to inform and guide the development of a harmonized model law that responds to the region's shared challenges and aspiration. So the evidence, the evidence was shared previously by the former Honorable Minister with regards to the need to have the model law. Also, drawing from the policy position paper on safe abortion, it is evident that many SADC member states continue to uphold highly restrictive legal frameworks where abortion is criminalized except under narrowly defined circumstances. These laws vary significantly in scope, clarity, and restrictiveness, creating legal uncertainty and unequal access to safe abortion services across the region.
This fragmented landscape not only undermines public health efforts, but also places adolescent girls and young women at heightened risk. The position paper suggests that fragmented landscape not only undermines public health efforts, but also places adolescent girls and young women at heightened risk. The position paper also responds to this challenge by presenting a regional overview of these legal disparities and proposing a shared policy direction that could inform the development of harmonized model law, one that reflects the realities of member states while promoting health, rights, and dignity. So current landscape overview examples by country legislation. For example, in Namibia, there is the Abortion Sterilization Act 1975, Act 2 of 1997, their Section 3. In Zimbabwe, we have got the Termination of Pregnancy, Chapter 1015, and it's Section 4. I see the chapter number is missing there. It's Chapter 1015. The Namibian Abortion Sterilization Act and Zimbabwean Termination of Pregnancy share a major similarity that both laws permit abortion only under exceptional and narrowly defined circumstances and require multiple layers of medical certification before the procedure can be lawfully performed. So as you can see, honorable members, it's not just about the actual termination of pregnancy, but also the procedures that are involved for one to have safe abortion. That is also an impediment. So when we look at this issue of safe abortion or termination of pregnancy, it's not just that actual termination, that actual action, but there are a lot of issues surrounding that. Like for now, we are seeing that even the procedures for you to be able to have safe abortion in countries that are permitting safe abortion, it's actually still an impediment because of the required multiple layers of medical certification. And before you know it, it will be 9 months. And by that time, it will not be possible for you to terminate the pregnancy. As we continue with our examples by country, in both jurisdictions, Namibia and Zimbabwe, abortion is allowed where a pregnancy poses a serious threat to women's life or physical or mental health, where there's a substantial risk of fetal abnormality, or where the pregnancy results from unlawful sexual intercourse, such as rape or incest. Additionally, both laws mandate that at least 2 medical practitioners, often with specific qualifications or roles, must certify the grounds for termination in writing, thereby reinforcing a highly regulated and restrictive framework for accessing safe abortion services. So what's coming into my mind is that that other girl who remained stagnant during Charmaine's activities. Do you think that girl is going to afford that procedure? Getting 2 medical practitioners to certify that truly there is need to terminate the pregnancy. Food for thought. As we also proceed with examples highlighted in the position paper, Malawi and Tanzania enforce highly restrictive laws. In Malawi, abortion is only permitted to save the life of a pregnant person with no exceptions for rape, incest, or fetal anomalies. I feel like repeating, you know, as the preacher, sometimes there are certain things that you need to repeat. What am I saying? Malawi and Tanzania enforce highly restrictive laws. In Malawi, abortion is only permitted to save the life of the pregnant person with no exception for rape, incest, or fetal anomalies. According to a study by IPAS, Malawi 65, over 141,000 unsafe abortions occur annually in the country, contributing to 18% of maternal deaths. Similarly, in Tanzania, their penal code criminalizes abortion, except in cases where it is performed to save the life of a pregnant person. We continue with examples. At the extreme end, the spectrum is Madagascar, where abortion remains completely illegal under all circumstances. The country's penal code imposes penalties on women who undergo abortions, on those who assist them, including healthcare providers. Data from WHO World Health Organization 2022 indicates that unsafe abortion contributes to approximately 12% of maternal deaths in Madagascar. People are still dying. As we continue with our examples, criminalization exacerbates the stigma around abortion, deterring women from seeking essential reproductive health care, even when legal provisions exist. Due to legal and policy restrictions, women and adolescent girls and young women often resort to clandestine and gravely dangerous and unsafe abortion services provided by unlicensed and unqualified service providers in unhygienic places. Abortion laws in Kingdom of Eswatini, Malawi, Madagascar, Tanzania, and Zimbabwe impose a prison sentence for women who terminate a pregnancy that does not align with the provision of the law. Fear of prosecution prevents many women from accessing post-abortion care for complications resulting from unsafe abortions. Mozambique and South Africa both have legal frameworks that permit safe abortion under specified conditions, yet practical access remains uneven due to systematic barriers. Mozambique's Penal Code Law number 35 for 2014 allows abortion on request up to 12 weeks and under extended conditions up to 24 weeks. But implementation is hindered by low public awareness, stigma, and limited health infrastructure. Countries with liberalized abortion example continued, and we are saying those with liberalized abortion countries are South Africa and Mozambique. So in comparison, South Africa's Choice of Termination of Pregnancy Act 1996, number 2 of 1996 is among the most progressive in the region, permitting abortion on request up to 12 weeks and under broader criteria thereafter. However, access is constrained by provider resistance, uneven service availability, and persistent social stigma. In both countries, despite enabling laws, adolescent girls and young women continue to face barriers that drive them towards unsafe abortion. So what are we saying in terms of the position paper? It seeks to build consensus across SADC member states by representing evidence of these shared challenging and proposing a harmonized rights-based policy direction that lays the ground for a future model law on safe abortion tailored to the regional realities. It is important to acknowledge that within the SADC region, there are member states where safe abortion is not yet legalized. These legal positions are often shaped by historical, cultural, religious, and societal contexts that may be respected. However, the position paper does not seek to challenge or criticize these national frameworks. Rather, it aims to foster a constructive regional dialogue by presenting evidence on the health and human rights implications on unsafe abortion, particularly for adolescent girls and young women. Through this inclusive approach, the position paper invites all member states to reflect on their own realities and consider pathways towards strengthening sexual and reproductive health rights in a manner that aligns with regional developmental goals and shared values. Targeted group. So in terms of the position paper, the targeted group for the model law is to focus on adolescent girls and young women, at least for starters. Why? These face the highest risk of unsafe abortion due to limited access to contraceptives, stigma, and restrictive laws. The position paper lays foundation for a model law that places the needs of adolescent girls and young women at the center by advancing age-appropriate rights-based policies designed to safeguard their health and strengthen their autonomy. Evidence shows that adolescent girls and young women aged 15 to 24, particularly those from rural areas, resource-poor settings, face the highest rates due to factors such as low education levels, limited decision-making power in healthcare, and inadequate exposure to contraceptive messaging. Studies indicate that up to 55% of adolescent girls aged 15 to 19 in Africa have unmet need for contraceptives, with SADC-specific data showing access rates as low as 10.2% in some countries. This gap in access underscores the urgency for targeted policy interventions. So there are also procedural limitations. In several SADC member states, procedural limitations continue to obstruct access to safe abortion services, even where abortion is legally permitted under specific circumstances. For example, in Angola and Mauritius, survivors of rape must present a police report to access abortion, a requirement that often discourages them due to stigma, trauma, and delays in law enforcement processes. Similarly, countries like Namibia, Seychelles, and Zimbabwe require judicial authorization, which can be costly, time-consuming, and emotionally taxing, especially for adolescent girls and young women who may lack legal representation and financial resources. In Zimbabwe, the Termination of Pregnancy Act mandates that the court approval in cases of rape, incest, or fetal malformation, further complicating access to safe abortion. Another constraint which was a finding in this position paper was the health system constraint and resource constraints. Across the SADC region, weak public health systems and limited financial resources significantly hinder the implementation of abortion-related policies and law. Comprehensive abortion care is not fully integrated into primary health care, leaving men, women, and adolescent girls and young women without safe options. These systematic limitations perpetuate unsafe abortion practices and contribute to preventable maternal deaths. There are also social, cultural, and religious barriers to safe abortion access. Social, cultural, and religious perceptions held by policymakers, religious, and traditional leaders continue to obstruct the enactment and implementation of progressive abortion laws across the SADC region. Abortion is often portrayed as incompatible with religious doctrine and cultural values, reinforcing stigma and moral condemnation. In countries, faith-based organizations have strongly opposed legal reform efforts, while traditional leaders argue that abortion undermines communal norms and the sanctity of life. These influential voices not only sustain restrictive legal environments, but also perpetuate harmful myths such as abortion causing infertility or being a reflection of moral failure that further marginalize women and adolescent girls seeking reproductive health care. So all those that I've mentioned are barriers to safe abortion currently in countries that have legalized abortion and also in countries that that have not legalized abortion, including that those have restrictive laws. So what are we saying here? What we are saying is how can we then leverage regional and global commitments to overcome these barriers to safe abortion? What can we do about it? We have the church saying it's a no. we have got our traditional leaders saying also maybe it's a taboo. So how can we then bridge this gap? Given the barriers outlined in the previous slides, including restrictive law, procedural hurdles, social cultural resistance, and weak health systems, it is essential to recognize the enabling role of regional and international frameworks in guiding progressive reform. Instruments such as the Maputo Protocol and Sustainable Development Goals, SDGs, offer a robust foundation for advancing sexual and reproductive health and rights, including access to safe abortion. So I understand that our member states have already committed to these protocols. And these protocols also envisage the issue of safe abortion. So I'm made to believe that it's going to be easier for us to have a model law because we have already made that commitment in terms of other protocols. Article 14 of the Maputo Protocol calls for the decriminalization of abortion in cases of rape, incest, sexual assault, and threats to health or life, and has already informed legal reforms in countries like Mozambique and Zimbabwe. I can't belabor this point, I've already spoken to it. Similarly, SDG 3.7, in alignment with SDGs 5 and 10, emphasizes universal access to reproductive health services and gender equality. We are continuing with leveraging regional and global commitment to overcome barriers to safe abortion. Reflecting on the limitations identified regional and international frameworks such as SADC HR Strategy 2019 to 2030 and the Internal Conference on Population and Development ICPD Program of Action serve as a critical enablers for abortion policy and legislative reform. The SADC HR strategy provides a unified roadmap for member states to address unsafe abortion by strengthening health systems, expanding access to comprehensive reproductive health services, and reducing preventable maternal deaths. It explicitly identifies unsafe abortion as a public health concern and urges member states to adopt progressive legal frameworks aligned with the Maputo Protocol and Maputo Plan of Action. The strategy also highlights the essential role of parliamentarians, policymakers, and civil society in harmonizing national laws within international commitments in pursuit of SADC Vision 2050. So together, these frameworks provide a strong legal and policy foundation for advancing gender equality, protecting women's and AGYW's rights, and reducing maternal mortality across the region. Status and drivers of unsafe abortion in the SADC region. So beyond physical harm, unsafe abortion carries serious mental health consequences and imposes social and financial burdens on AGYWs, that's adolescent girls and young women, their families, communities, and already strained health systems. These multidimensional impacts underscore the urgency of addressing unsafe abortion as a public health and human rights priority. Honorable members, so what we are saying here is that a key driver refers to a primary factor or underlying cause that significantly influences or contributes to a particular outcome or issue. In the context of unsafe abortion, key drivers are the root conditions or circumstances that directly increase likelihood of individuals, especially adolescent girls and young women, resorting to unsafe abortion methods. So these are the key drivers of unsafe abortions which were identified in our position paper. and there's gender-based violence and unmet contraceptive needs. AGY who experience sexual violence, including rape, coercion, and intimate partner abuse, often face unintended pregnancies. When access to modern contraceptives is limited or denied, their ability to prevent pregnancy is compromised. And what do? They simply resort to unsafe abortion. These circumstances frequently lead to unsafe abortion, especially in environments where legal and social barriers restrict access to safe abortion. Another key identified driver of unsafe abortion is climate crisis and humanitarian emergencies. Environmental disasters, displacement, and conflict disrupt health systems and access to SRHR services. In humanitarian settings, AGYW are at heightened risk of sexual exploitation and have limited access to contraception or safe abortion care. This crisis exacerbate existing inequalities and often push reproductive health needs to the margins of emergency response. Like if we can recall in Zimbabwe, the time of Cyclone Idai, a lot of things happened and there were a lot of displacements. And in such scenarios and situations, we end up having sexual exploitations and unlimited access to contraceptives or safe abortion care because a lot of things would have been destroyed. And these young girls and adolescent girls would then often resort to unsafe abortions. Another key driver that was identified is poverty, food insecurity, and disrupted education. Economic hardship and lack of basic needs increase vulnerability to transactional sex, early marriage, and unintended pregnancy. Adolescents, girls, young women living in poverty may lack the resources to access healthcare or education on reproductive rights. Disrupted schooling further limits awareness and agents, increasing the likelihood of unsafe abortion as a desperate response to unplanned pregnancy. Another key driver of unsafe abortion, stigma, discrimination, and harmful gender norms. Deeply entrenched social norms often shame AGYW for seeking reproductive health services, including contraception and abortion. Fear of judgment from families, communities, and even healthcare providers leads many to avoid formal care and resort to unsafe methods. Discrimination based on age, marital status, or sexual activity further isolates AGY from the support they need. Consequence of unsafe abortion. So what was also identified in the position paper is that unsafe abortion is a public health and human rights crisis. Unsafe abortion continues to claim lives and compromise health across the SADC region, contributing significantly to maternal mortality, particularly among vulnerable populations such as adolescent girls and young women. Beyond the devastating human toll, unsafe abortion also violates fundamental rights, including the right to health, dignity, and bodily autonomy. Another consequence is that there's a hidden barrier to economic growth. I have heard that if we allow abortion, there's an argument that is being posed that if we allow safe abortion, it means that there will not be economic growth. But in terms of this position paper, it's actually vice versa. It's saying that unsafe abortion is actually a hidden barrier to economic growth. Why? It imposes a substantial economic burden on already strained public health systems, with governments forced to allocate scarce resources to treat complications from unsafe procedures. Because whether we disallow safe abortion, our young girls are going to do it. And that's going to be an extra burden on the government to treat complications from unsafe procedures. These include emergency care, long-term reproductive health interventions, and loss of productivity due to disability or premature death. The cumulative financial impact undermines national development goals and perpetuates cycles of poverty, making unsafe abortion not only a public health and human rights crisis, but also a pressing economic concern. So, what is the core message of safe abortion policy position? Honorable members, the core message is that there is need to harmonize legal frameworks. The position paper seeks to usher a proposed model law which aims to allow abortion laws across member states, ensuring that safe abortion is legal, accessible, and free from stigma. By creating a coherent regional standard, it helps reduce legal confusion and promotes equitable access to care, ultimately lowering preventable maternal deaths. Another core message of the position paper is that it seeks to promote Ubuntu, reproductive justice, and gender equality. Through this values-based approach, the position paper invites member states to reflect on harmonized legal pathway and uphold health rights and justice for all. So this is just findings in terms of the police position paper and the barrier summary. We have spoken to this, that the barriers are that there is criminalization of abortion in many SADC member states, police and legal barriers, procedural barriers, that's court approval and police reports, limited health systems capacity abortion and post-abortion care, stigma within health facilities and communities. Another finding was that there's policy inconsistencies between health ministries and legal statutes, which create confusion for service providers and barriers for adolescents, girls, and young women seeking care. Stigma and fear of prosecution discourage healthcare workers from offering safe abortion services, even where permitted by law. So basically, the decision of the plenary then was timely and well considered, recognizing the need for a harmonized regional approach through a model law on safe abortion. Recommendations. So these are some of the recommendations that they is established a rights-based harmonized legal framework for safe abortion in SADC, aligns with SADC Vision 2050, RISDP 2020 to 2030, and the SRHR Strategy 2019 to 2030. The other recommendation is that to promote access to safe, legal, and stigma-free abortion and post-abortion care. The other recommendation is that to have a proposed model law on safe abortion, which should focus on the following principles: human rights, dignity and bodily harm autonomy, gender equality and non-discrimination, cultural sensitive and Ubuntu, evidence-based public health approach, accountability and progressive reform. Another recommendation is that there should be reduction of maternal deaths and unsafe abortion rates by legislating for safe abortion, empowerment of AGY through access to reproductive rights, strengthened health systems and economic efficiency, alignment with global treaties, Maputo Protocol, SDG 3 and 5. And these are the expected outcomes: improved SRHR outcomes, decreased post or abortion care costs to health systems, strengthened legal protection for women's reproductive rights, regional cooperation, and police coherence. And in conclusion, safe abortion is a public health and human rights issue. The SADC model law provides a roadmap for harmonized reform. Validation of this process is key to ensuring health, dignity, and equity for women and girls. Thank you.
Thank you very much for such a detailed presentation. Honorable members, I can see just by looking at you, it has been a long day. It has been a long day. I'm very sure some of you feel like it's Wednesday. Anyway, this is the duty, honorable members. This is what we have committed ourselves to. I would really like to thank our presenter really for going through such a lot of material and making it as short as possible. Honorable members, we are not going to spend a lot of time. I would just want to know if there are any members who would want to give some comments as the policy paper is going to move on to the stage of drafting. I would like to pass special thanks to SAFEIT for helping in the commissioning of this policy paper. We really appreciate your support and believe that you'll always be the resource to SADC PF throughout the process. So, honorable members, if we do not have any comments at this point in time, I would really suggest that we move on to the next agenda item, which definitely will be leading us to the closing session. But before we do that, I really want to pose a question for every one of us in this house to be thinking about. If a man can say, I don't want that baby, but a woman cannot say, I don't want that pregnancy, why should society grant a man freedom of choice when the pregnancy was initiated by both of them? Have we thought about that? You know, if a man can refuse fatherhood through neglect or abandonment, why can't a woman reject motherhood through a medical procedure? Why does it suddenly turn to be so immoral? So these are some of the things really as we deliberate about these issues. We talk about gender equality, we talk about women empowerment, but do we see how some fundamental things we are failing to reflect the will to empower a woman? We are failing on ourselves to say nobody should be left behind. Honorable members, without further ado, let me then read to you what our next agenda item will be. And as I look at our, yes, and I think that this is how we are going to close the session, because what we have is no longer the presentation. Madam SG, through your indulgence, can we guide perhaps how we carry through this next one? Because I do not see who the presenter of the next session will be. So this is the briefing of members of parliament on the media and communication strategy for the committee sessions and members' expected roles.
Okay. Thank you, Chair, for your indulgence. Honorable members, there are two things that we are going to do this afternoon. We're waiving one, we can do it in the morning. The presentation on the media strategy that we are going to be deploying during this session. It is important when you come to regional spaces that you utilize social media to account for your absence. There are people who are going to your constituents and saying things that are not true in terms of where you are. And what we have done is to come up with a strategy to help you to counter such narratives by showing the important regional work that you are doing while you are here. So tomorrow morning, we will start with a presentation from our media team on how we are going to be doing that while you are here. But what we are going to do now, this afternoon, we're going to invite young people. These young people are going to help us to, within the context of a project that we are doing, it's a 1.4 million euro project we are doing through ADA and European Union through GIZ to do a baseline on Mentimeter. So you'll be using your phones to just gauge in terms of where you are to inform future interventions that we must on in terms of what we must focus on to capacitate honorable members as we move from protocols to action. It won't be long, it will be very short, but more importantly, it is also going to be digital. So we wish to invite Ronald and Ishmael to lead us through the process of the Mentimeter. Ronald and Ishmael, please approach the bench. You will explain to the honorable members how they are going to use their cell phones to participate in the process. And it's something that we will be seeing on the screen real time as we participate in that by just clicking. So there's no writing, just be clicking and we get that baseline information. When we conclude that, we will then close. I will make one final announcement before when we have concluded the exercise and then we move. Ronald, are you coming? Ishma, please come and use because you will need to be speaking to the honorable members. You need to, you can use this or you can come here.
Good afternoon. Hello, good afternoon. Yes, we need to kill the tiredness. So, by way of introduction, my name is Ishmael Chuposio. I'm from Botswana. I work for GIZ SADC. We're based in Gaborone, Botswana. As Dr. Kurashi has mentioned, we have a small exercise to try and understand, but also to seek your input into a study that we will be commissioning as we commence. So before we start, I know we're running thin on time, but being a Gen Z or a generation before Gen Z myself, energy is one of our characteristic. So I kindly ask our honorables if we could kindly stand up, do a little bit of an exercise so that we are much more responsive to the survey as we commence. I seek your indulgence in asking you that you stand. Thank you. Yes, I can even see some of the honorables already leading us into the exercises. Okay, so this exercise is called We Catch the Ball. I understand Dr. Kurashe is his favorite exercise as well. So I was inducted by Ronald. Are we all ready? Can we free our arms? Let's start there, just to free our arms. Okay, so let's raise our hands in the air. So as I do, you do as I do, or do as I say. So when I point this way, we catch the ball with energy. We catch the ball. So can we do? We catch the ball. We put it here. And we bounce, bounce, bounce. Okay, great. So let's do a serious one now, okay? One more time. We catch the ball. We put it here. We bounce, bounce, bounce. Thank you very much. You may take your seats. Okay. Oh. I'm afraid some of you may be called to order, so we have to. Great. So this is called a Menti. This is a tool, the survey tool. I kindly ask that you use your cell phones, your mobile devices, using a QR code scanner or application on your phone. Kindly point to the screen. And then there should be a pop-out on your screen that asks you to open. So please open that link. If there's anyone having a problem or a challenge, kindly raise your hand and we'll come to assist you. Okay. Who else is having an issue connecting? Okay. There should be a QR code scanner. Okay, I'm coming. Does it have the QR skin? Never seen that. You can use my I'm going to the website directly. Ah, okay, that's fine. I seem to know your phone. Yeah, I've never seen that thing in that phone. Translate site. Yes, I saw his Anyone else who needs help? Looks like we are set. We're fine? Okay. Then we can commence the study. Okay, so the objectives are shown on the screen. This is a pre-evaluation assessment in readiness for the different interventions that we'll implement in our collaboration within this project. So we'll go on to the next slide. Again, the objectives I'll explain it clearly to establish baseline values on your understanding of various regional integration topics. You can hear? Okay, I'll try and put it closer. And then the next slide, section 1, we just want to understand or to get a gauge of who you are in terms of your profile. We're not asking for your names, but some basic information about who you are. So in terms of country representation, as you can see, this is the representation or distribution of the participants in the room. We have at least one person has responded from Angola. If there are any who are struggling to respond, we could kindly come to your aid. Yeah, what you see is not the same. This is giving us the picture of the responses. So, but here the question is for you to indicate which country you're coming from. So you have to pick one. Looks like others might still be having a challenge, so we'll just assist them shortly. Yeah, regional integration. Yes, sir, but we'll explain them. Okay, so the first question was about entering your basic bio data, telling us about which country you're coming from. This question will be followed by I'm also trying to respond here. Okay. Okay, so after answering about the country, the following question should be about what role do you play in your national parliament? So what position, are you a member of parliament, are you a clerk, and so on and so forth. So this is where you respond. This is this slide. What role do you play in your parliament? Are we together? Ronald? The question on the screen, colleagues, is what role are you playing in your parliament? Please indicate. Yeah. Okay, just fine. No, not a problem. We just have to drag it down. Huh? Okay, and then this is okay. Next. Okay, and then again next, and then yes, and then you choose your country. Okay, so I hope we're all here. I know some of us could be further ahead, but the question is, what role are you playing in your national parliament? What position do you hold, if any? And then you respond accordingly. I hope this is fine for everybody. We're moving on to the next question. Here, you just have to indicate to us your gender, whether male or female. I'm sure this is quite straightforward. Okay. Moving on from gender, the next question is, what is your political affiliation? So we're trying to gauge here whether you belong to one side of the aisle over the other, or you are non-aligned. So again, what is your political affiliation in your parliament? Okay, no, that's good. You're fast. Okay. Following that, here's the next question. How many years do you have in your national parliament? So again, gauging your experience. So there are options there. You just have to tick accordingly or choose accordingly. Yes, ma'am. Is it? Yes, multiple. So you can, if you have many, you can select, you can enter a couple. Okay. The following question after the question on your experience in parliament is on your knowledge or your experience working on SADC regional integration in parliament. So years in parliament, that was the first one. And then here we're looking at how many years have you spent working on SADC regional integration issues within your parliament? Okay. Again, you select accordingly. And then you select. Okay, so I should be on, we should be on section 2 for those of us who are still catching up or going with the flow. This is to now check your knowledge as self-assessment on various regional integration issues. Again, if we proceed, the next question is whether you have received training on regional integration in general. This is a generic training on regional integration. So as a member of parliament, have you received any kind of training, information seminar on various regional integration issues? So you have two options of yes or no. And then the next question is, please state the SADC protocols that you are familiar with. May I just go slightly? So what sort of protocols are you aware of? The gender protocol is a good example. There's a protocol on trade, I assume, and many others. So what sort of protocols are you familiar with as a member of parliament, given your experience? Okay. Then the next question is, by your understanding, what are some of the successes of SADC regional integration agenda? So in general, I could give an example of a driver's license, the SADC driver's license. One would consider that as a success, as an example. But I'm sure you have many other examples as you respond. So that is the question. These are some of the responses that are coming onto the screen that you have provided. It will be interesting. There is transformation, there are model laws, the Africa Free Trade Area. It's a continental thing. But again, it's also prevalent in SADC, the amendment of the SADC Treaty, and so on and so forth. So it's good to see the responses coming through. Okay. The next question, what are the challenges? Some of you have written political will, I guess the lack of it. Undermining of the role of parliament by the executive, that's interesting. If the executive is in the room, we would appreciate their feedback on that. So again, just highlight some of the key challenges. Here you have the option, as well as in the previous question, to offer multiple responses. So if you think there are more than one challenges, feel free to share as many as you can. Okay, moving on. This section will look into the role of parliament in regional integration. Now, looking at the parliament as an institution. We're moving too fast. Okay. It's okay. You're having challenges. Okay, he will come to you. Okay, we'll pause for now. It looks like some colleagues are having issues. Okay, let's start here. SADC protocol. So have you submitted already? You've answered? Okay, then you go to next question. Yeah, and then successes. So you enter the successes, like SADC successes. Okay, if you don't know, then you can simply submit, and they need to ask you to skip. Okay, and then you go to challenges, like that. So if you don't know something, you just skip. Yes, then you go to, what does it say? Start over. Okay. Yes. So this is the role of parliaments in regional integration. Yeah. So what is the role of parliaments in regional integration? And then so here you have to, okay, you press next because the question. So these are, okay, yeah. And then I will explain this section. Okay, you've selected this one. And then next. Then this one. You're on another, this is another section. Yeah. Go submit. Then another question, you respond. Yes, Chief.
On such, can I talk about the strides made in coming up with the regional pilot?
Yes, you can list up. Okay. You can't. Okay, just next question. I think I've answered it. Okay. We are on the domestication question. So this is the question on what role does the parliament play in the different stages of regional integration or domestication of policies. So under domestication, you are rating. This is a rating question. The expectation is for you to rate what role does parliament play, for example, under domestication. Is it a significant role, less significant role, or highly significant role? That's low. Okay. Are we okay with this one? Have we rated? Has everybody provided their rating? Because we have about 60 people, so we should have more responses here. That would be what? 18 now. 18 responses. Okay. Adapt. Okay. All right. I thought the time was a factor. But if we're fine with time, then we slow down a little. Okay. you winning? Oh, you're done. Okay. That's good. SG, are you done? Okay, that's good. It shouldn't ask you that one. No, I think that was just, it must have been an error in our inclusion. We never intended to ask people's name. Yes? Structures. So committees, for example, committee, parliamentary committee. Yeah. Okay. If we're fine with this section, I'm going to move on to the next step. What role do parliaments play in the implementation of regional integration protocols, strategies, and so on? Okay. The next part. Here, we're trying to assess your understanding of the role that SADC PF plays in regional integration. So first and foremost, establishing its mandate. So this is a ranking question. There is a scale of 1 to 10. 0 denotes strongly disagree, and then 10 denotes strongly agree. So you have a choice of choosing anything in between, or the two extremes if you like. Are we on the same page? Is there anybody having issues? It's about 30 questions. Yeah. Then I think you're done. Yeah. You should be done. Thank you. So again, this is assessing, for example, in terms of your value to your work, how do you see the role of SADC PF playing or adding value to your work as members of parliament in your respective parliament? And then the last question is asking you to check whether you have familiarity with the transformation journey that the SADC Parliamentary Forum is undergoing to become a regional parliament. So you can give a rating whether you know some information, you are more familiar with the transformation process, some of you are heavily involved in it, or and so on and so forth. If we are fine, I'm going to move to the next section. Ronald, there is a call for assistance here. while we do that, the next section is looking into application of skills and knowledge on regional integration here. So the first question, we are asking if you have contributed to any debates or discussions on regional integration. Again, there's a lot of discussions around model law in the SADC Parliamentary Forum. So we're trying to gauge whether you have had any input whatsoever on key regional integration debates. This is in your national parliament. And the following question, you will see that it follows on to this to then check if you have been involved in that debate, what was that debate about? Or what were the issues? Or what was the debate centered around? And these are some of the responses. Good to see that the issues around abortion, which were being discussed today, are also featuring there. The transformation of the SADC Parliamentary Forum was a debate in one of the parliaments. That's also good to see. There was a motion on HIV and AIDS, I guess, at a national parliament, but maybe this was on a regional dimension to the HIV/AIDS discussion. And many other responses, which obviously we can reflect later on. Here, we want to understand how your national parliaments are structured at a national level in relation to the regional integration agenda. So, for example, do you have committees that are focused on specific regional integration issues in your national parliaments? That's one of the questions. Do you have people who are assigned specific roles to focus on in relation to the regional agenda? That's one of the questions as well. And how effective are the resources that you have that are dealing with the issue of regional integration in your national parliaments? I've heard in some of the discussions within this forum, some of you have research offices. How effective are those research offices? Are they well resourced? Is the information flow as fluid as you would like it to be? Or are there any noticeable gaps and so on and so forth? So these are the kind of responses we're looking for here. Are there any challenges with this question? Oh, good. Okay. We're almost at the end, so let's stay the course. Here we're trying to assess your confidence in the process of alignment, especially at looking at your institutional capacity. So the first question is, how do you rate the effectiveness of your parliament in coordination activities? So as parliament as an institution, in playing its function as the legislative arm of government, how do you rate its coordination function in as far as regional integration is concerned? There you have to provide a rating between 0 to 6. So this is denoting some of the responses that you have shared already. Some of you are giving it a 1 score, quite interesting. The highest number I can see on the screen is 5. So this is communicating something in as far as coordination is concerned. Okay. I think this part will first. Be here. Okay. I think I spoke to that already. Now, in one of the responses earlier on, there was a conversation around the collaboration between the executive and the legislature. So again, this question is asking you if you are able to rate the type of collaboration that exists between the parliament and the executive arm of government in as far as regional integration is concerned. A typical example would be if a model law is debated in the SADC PF, and some of you have the passion to take that up at a national level, and maybe in the national parliament, a debate has ensued, and it's in favor of adopting that piece of legislation or model law. How do you engage with executive to ensure that you finally reach the end of the line? So what sort of collaboration exists between the parliament and the legislative arm of government? It's a rating, so you can give your score based on your experience and previous interaction. And last but not least, on this section is the role of non-state actors, civil society organizations. By your own estimation, how do you feel about the role that civil society play in discussions, debates around regional integration within your national parliaments? Do they participate in some of your sector committee meetings at a national level on regional issues, or they are cast out, or they are involved later once the legislation has already been adopted? Again, we just want to get your responses to this. Because some of the measures that Dr. Kurashi has spoken to will speak to advocacy strategies, which would offer some opportunities on how you can better engage civil society as you do the regional integration work in your parliament. So we are in the last section. If we are all moving at the same stage, or some of us are already complete. So these are open-ended questions. The first question is asking, what is your perceived take on the biggest opportunity to advance regional integration in SADC? Some of the responses are showing on the screen. You're talking about trade interests. If they are aligned, that could be the biggest opportunity. Okay, I'm being asked to. Yes. Are you fine? An example. Yes. What was the question? Okay. With the first. Yes, so if you have contributed to regional integration, you say yes, and then you give an example of the protocol or strategy that you worked on and submit. Don't start off. Hey, does this took too long? So give an example. Then the protocol, whatever. Biggest opportunity. You perceive as the biggest opportunity to advance regional integration. Parliamentary and control. Parliamentary and okay, so I think we should be fine here. Okay. The next question following this one was on the barriers. What do you think are the barriers to regional integration? Some of the responses are monetary and technology support, if it's lacking, I suppose. You have religion and culture. I think we've had some discussions around that today. There's the issue of air connectivity. That's an interesting one, I think, from an infrastructure point of view, or communication, transport and communication point of view. Weak or no funding models at home. This is about self-resource mobilization to push for regional integration. So these are some of the barriers that you have indicated as being a hindrance to advancing regional integration. If we are fine with this one, we can move to the very last section of the study. So this is now to check your preference, your wish list, if you like. What topics, what issues would you like to be capacitated on as members of parliament on regional integration issues? The first question. So what do you hope to gain from the SADC PF capacity building measures on regional integration? And these are some of your responses. You would like to get an understanding on political and ideological dynamics. I understand regional law making processes. That's one of your wish list. Someone says everything. That's an interesting response. Some of you would like to know the role of MPs to advance regional integration. I guess that's fitting. Insight on member states on how they tackle their issues that affect their country. So more of an exchange, a peer learning platform for member states to share and learn from one another. Knowledge and more information about model laws. I guess model laws are still becoming popular, so you'd like more of that. Okay, the following question. Here, again, we would like to get an understanding of what topics interest you the most. So besides that wish list, what other areas of interest do you have or you find very interesting? There's the issue of domestication you have pointed out there. Model laws development is an interesting topic, I suppose. Elections and democracy is an interesting topic to some of you. You also write all of them. I guess we'll bring a whole basket. Free movement of goods and labor is an interesting topic to some. I guess we'll look into that. Eradication of problems for the continent, I suppose. That's what it might be saying in Portuguese, I think. Ratification is another interesting topic that you would like to see. Then the final question. How will you apply these skills once you have gathered them, once you have acquired them? And some of your responses, you're saying you will use them in parliament. I guess that's even more relevant. By putting motions and questions in parliament, again, that's good because we would like to see the end product of that knowledge that you've acquired being put into action. You'll also use them in lawmaking and oversight. I think that's also quite interesting to see. And you will also use them more during parliamentary debates. So I hope we have all reached this stage. Is there anyone who feels they could not have reached this stage that still need assistance? Hmm? Ronald, are we fine? Or almost? Okay. And as we wait for Ronald to give us the thumbs up, is there anyone who has a reflection on this study so far? This is a pre-assessment. Any thoughts, ideas, questions, clarity? I see the Honorable from Zimbabwe. Do you have a comment, question? Please feel free. If you could kindly use the mic, we can hear.
I was just whispering with my colleague that the survey, I think is good. It also brings in some insights of everything, whether we are here or we are home. Well, it was more talking more about our SADC region, and it cuts all parliaments, and obviously the issue of the topics are just the same from how I was reading them.
Thank you very much for that reflection. The topics are cross-cutting, very relevant to the work that you do as members of parliament, especially at the regional level. So we appreciate that feedback. Any comment, further comment, insight? How easy or difficult was the study? Anyone would like to comment on that? Was it easy to follow and do the study? Confusing maybe? Yeah. Okay, yes, please go ahead.
Não, eu acho que o exercício foi muito bom, no sentido de até chamar-nos a atenção para algumas questões que às vezes nos passam ao lado, mas eu considero que houve perguntas muito parecidas e às vezes isso nos deixa, pelo menos no meu caso, deixava um pouco assim, mas já respondi, confusa, já respondi, agora tenho que responder novamente, portanto foi mais ou menos isso. Mas de resto considero o exercício muito bom. Obrigado.
Thank you very much, Honorable. Really appreciate that feedback. We will try and avoid the repetition or similar questions in nature so that we are a bit more pointed to the point. But thank you very much for that feedback. We really appreciate. Okay, it looks like we've reached the final end line. Thank you very much for your active participation and embracing the Menti exercise. We will have another exercise at the end of the sessions towards the end of the week. So hopefully that one will be even more interactive. I hand over back to the program chair. Who was that? Okay. Dr. Kurasha, we are done. And the room has finished the exercise. I'm handing over back to you, sir.
Thank you.
Thank you very much.
We can do a better job in clapping for the young people. Thank you very much, Ronald and Ishmael. Honorable Mendes and other chairpersons of standing committees know that when last time we circulated questionnaires, they were never responded to. And we said, if Mohammed cannot come to the mountain must come to Mohammed. So we we are grateful that honorable members you indulge us and we have been able to successfully do this. There are areas where we will improve, but we must all agree that for us to improve the way we do our things, we need evidence that is coming from you as the customers or the end users as honorable members. At this juncture, honorable members, we must move towards closing for the day. It has been a very long day, but very engaging. And we appreciate the honorable members for the very active engagements we have had. So tomorrow, we have the official opening session, and we will have the Honorable Speaker of South Africa, Toko Diza, as the host for the 58th Plenary Assembly. will be coming as the guest. As honorable members will know, plenary assembly sessions start with the committee sessions. So we are already in the 58th plenary assembly, so our host will grace us tomorrow. Another important announcement is that we're going to have ambassadors from two of our key cooperating partners gracing the event, the ambassador of Sweden to South Africa and the ambassador of Austria to South Africa and SADC. And we will therefore be expected to be on time so that when our guests arrive, we will be already in the room. We also hope that we can have ample time to deal with some of the few things that we couldn't deal with today, including the introduction of members that are new who are attending SADC PF for the first time, so that we get to know them and embrace them as they join the family. And the rest of the program, we are going to be having the SADC Secretariat now looking at most of the issues that we were reflecting on through the survey, which is the ratification, the domestication, and implementation of SADC protocols. We do not have any further announcements except to wish honorable members a restful evening so that you come back fresh tomorrow morning. Honorable members, one more reminder, we require boarding passes, the stubs of your boarding passes. They must be handed over to our colleagues from finance as part of compliance requirement from our cooperating partners. Please see Paulina, see Lorenda, and the rest of the staff from the Secretariat and hand over your boarding passes. Thank you very much. Asante sana and good evening. Right. As honorable members are leaving, we request the Secretariat and our partners to stay behind for a debriefing.
Sorry.
Yourselves.